amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini, sisi zote binadamu. Matajiri masikini, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka, Kenya nchi yenye baraka. Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo, tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote, mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya, wenye nchi
Kenya kipenzi chetu, hatutaiacha milele. Wenye nchi Kenya kipenzi chetu, hatutaiacha milele. Ninaimba siyo wimbo, ni maombi, nikiomba Mwenyezi Mungu aibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu nguvu zangu nimeziweka mbele yako, bibi yangu na watoto nimewaweka mbele yako. Tabu zangu shida zangu ziangalie Kenya yangu, tabu zangu shida zangu ziangalie Kenya yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele.
Thank you for your love. Thank you for your care. Thank you, Father, for bringing us together to this celebration. Impact has been around from 2003 to date. Father, we are celebrating 20 years of existence. Therefore, Lord, we want to thank you for this far you brought us. You are our Ebenezer. Father, we glorify your name. Thank you for the partners who have joined together with us to reach this far. Thank you for the executives. Thank you for Dr. Kawango, who has been with us steering this organization to this level. Father, we thank you as we start. I want to pray the Lord, you will start with us. Thank you for the presentations. Thank you for those people who shall be traveling to come. I want to pray that, Lord, as we start, be in our presence, because I pray in Jesus' name. Amen. Thank you very much for coming. I want to invite each one of us to be seated. We are celebrating 20 years since the inception of Impact Research, and we are going to have several sessions. So I invite the MC to continue. Thank you very much.
Thank you. Kindly let's get in. Those of us who are at the door, please let's get in. Asante sana. I want to take this opportunity to welcome you once more. I want to welcome our MOH who have arrived. I want to welcome our implementing partners who have arrived. I want to welcome our the research institutions that we collaborate with who have arrived. Phil at Watu wa Vihiga mpo? Watu wa Vihiga sijawasikia mpo? Busia mpo? Busia wako? Busia mpati t-shirt. Kisumu mpo? Siaya mpo? Kisii mpo? Kisii kama ni wawili wanapata t-shirt. Nyamira, my stronghold. Mpo? Stronghold la wapo. Haya, thank you so much. I want to invite our HR to come and take us through the next presentation. Thank you. Right.
So, good morning, everyone. Good morning, everyone.
Good morning.
My name is Ryan Owira. I work with Impact Research and Development Organization as the Human Resource Manager. I also oversee Administration Division. Please feel most welcome to IRDO. In the interest of time, I will move straight to my presentation. So I'll give a presentation on the overview of IRDO. A bit on IRDO's background. So IRDO was registered as a non-governmental organization on 23rd of January 2003. We have been in operation for the last 20 years, implementing evidence-based public health interventions and research studies in up to 25 counties of the 47 counties of Kenya. IRDO's programs focus has mainly been on prevention, but also on treatment of HIV, malaria, and TB. Our research covers observational studies, clinical trials, and project design and evaluation. Our mission is to improve public health and development by promoting research and programs that leverage community resources. And our vision is healthy and empowered individuals and communities. Our core values are supremacy of human rights, accountability and integrity, a non-partisan approach to development, community support and participation, collaborative decision-making, and professionalism. In terms of our leadership and governance structure, IRDO is steered by a board of governors, and I will take you through the members of the board. So we have Jacqueline Ngutia, and her main area of expertise is legal. She is an expert in legal issues, and she's the chairman of the board of governors. We also have FCPA Edwin Makori, the treasurer of the board of governors. His main area of expertise is finance. We have Professor Elizabeth Bukusi, whose main area of expertise is she's a research scientist and medical officer. Dr. Zachary Kwena is also a member, who is a researcher and also a social scientist. CPA Rose Adem, also with an expertise in finance management and also grant management. We have Cynthia Elkash, who represents the youth. So she's an advocate of the youth within the board membership. We have Reverend Dr. Sylvester Odanga, who is an academia, but also representing the clergy in the board. And finally, we have Dr. Kawango Agot, who is the secretary to the board, the CEO of the organization with an expertise in research and program implementation. IRDO is also led by management committee members who are drawn from the different divisions and departments within the organization. As the chairperson, we have Dr. Kawango Agot, the CEO of the organization, Dr. Mark Ayalo, our clinical manager, Redempta Oden, the programs manager, Mike Ogera, the finance manager, Jacob Onyango, study coordinator, and myself, the human resource manager. As you can see, we have a vacancy in the management membership. So for a better understanding, we have our organogram, which then gives us the flow of power in the organization or influence in the organization. At the top, we have board of directors, who then is reported to by the director or the CEO. You can see a dotted line from the internal audit department, ideally reporting to the board, but because of day-to-day operations to the director. We also have a dotted line of the management committee, who from time to time handle the operations of the organization. We are comprised of 4 main divisions. There's the programs division, the business systems division, the research division, and the business development division. Under programs division, we have different projects that we implement, and beneath the projects, we have various interventions. Under the business systems division, we have 2 major units. There's the finance unit and the administrative unit. Under an administrative unit, we have transport department, procurement department, stores department, human resource department, and ICT. In research, we have 2 major units under the research division. There's the non-clinical research unit, and we have the clinical research unit. We have our research studies and different research studies under the non-clinical research unit, and the clinical research unit is heavily embedded in the hospital. So under our business development division, we have the fundraising hub unit and IRDO unit. IRDO unit is the hospital unit, which is our IGA as an institution. And under IRDO, the hospital, we have 3 major departments: the clinic research department, the healthcare department, and the training department. So who are our main donors? We have funds, mostly we receive from National Institutes of Health, Global Fund through AMREF Health Africa, Global Fund through Kenya Red Cross Society, World Health Organization, Centers for Disease Control and Prevention, CDC, the World Bank, Belinda and Melinda Gates Foundation, and USAID. We have also been partnering with a number of research institutions in the last 20 years, but because the list is long, we capped it at 5 years for purposes of presentation. We have collaborated with Kenya AIDS Vaccine Initiative, UON, National AIDS Control Council, NAC, University of Washington, University of California, San Francisco, University of Pennsylvania, the Duke University, Georgia State University, RTI, Research Triangle Institute, ICAP, Pharmaceutical Products Development, University of North Carolina, Chapel Hill, Yale University, and New York University. Impact has been a Sabawadi and also a prime partner in different grants. For University of Maryland, Impact was a Sabawadi between the period 2016 to 2018. EGPAF, a Sabawadi between 2016 to 2017. And between the period 2017 to 2020, IRDO was a Sabawadi of JPEGO. We have also been a prime partner in implementation of a number of projects. And so far, we have been able to subaward 19 organizations, namely CMMB, OLPS, NIGE, University of Maryland, SAPTA, NOSET, SWOP Kenya, UCSF, NASCOP, LVCT, EGPAF, ICAP, CHS, KP Consortium, BOMU. We have a strategic direction as an institution, having existed for the last 20 years. We are yet to realize our vision, and so we have a number of things to put in place. So one is to expand the scope of public programs beyond the communicable diseases while ensuring quality of access. You realize that mostly we are focusing on HIV, TB, and malaria, so we'd like to do a bit of research and implementation of non-communicable diseases. To increase the use of research findings, evidence for decision-making, improvement, and development of new programs. We'd also want to construct IRDO block, office block, to have adequate space and even lease. We will also want to diversify IRDO's resource base and reduce over-reliance on donor funding, also improve quality and timely reporting using the latest technology. And finally, our aim is to increase effectiveness and efficiency of support systems of IRDO operations at all levels. Thank you.
Let's appreciate our better, please. Thank you so much, Rael. I want to call upon our programs manager, Redemptor Odeny, and as she comes, kindly, those of us who are preparing our beneficiaries, they are next. In the next 2 minutes, kindly put them ready. Thank you.
So good morning, ladies and gentlemen. So to our visitors, IRDO staff, we welcome you to our celebration. As has been alluded to in our organogram, programs is one of the 4 divisions at Impact Research and Development. So before I begin, I want to recognize the team that has been behind some of the figures that I'm about to present. So I want to request the programs team from Kisii, Nyamira, Vihiga, Busia, and Nandi to rise up. Very quickly, please. Thank you for coming in your numbers. Just wave and sit down. Thank you very much. Have a seat. So, IRDO programs have been enabled courtesy of external funding received from PEPFAR, Global Fund, and Bill and Melinda Gates Foundation. And therefore, my presentation will be based on the projects that have been supported under the grants that I've received from those 3 donors. Next. And so, as I start, I want to begin with Pefpar-funded programs, because PEPFAR is the donor that we received the first funding from PEPFAR, and therefore we began implementation courtesy of their support. And therefore, I'll start with the first program that we started implementing in the year 2004. And this program was for HIV prevention. And under this, we implemented, we rolled out voluntary medical male circumcision, and the project was called the Tungane Youth Program. So this was funded by PEPFAR through CDC, and it existed from the year 2004 to 2010. We served young people, and we served young people and adults, key and priority populations, and uncircumcised men. And our coverage was in 7 districts then, in 2004. That was before promulgation of the new constitution. And therefore, what existed then was districts. So we were in 7 districts: Kisumu East, Suba, Bondo, Kisumu West, Rarieda, Sia, and Nyando district. So we did so much, but I want to present on key indicators that respond directly to HIV prevention. And the first one is on HIV testing services, where we reached 418,946. We circumcised, in 2 years, we were able to circumcise 92,885 men in those districts. We also trained MOH personnel on safe VMMC service provision. So we trained 523 of them. And we improved capacity of 20 MOH facilities to provide safe and free voluntary medical male circumcision services. Now, that color green is not in vain. PEPFAR applied what we call color codes. And therefore, at a glance, when you look at a green shows that you are performing well, you are exceeding your expectations. So within the green, we had a spectrum. So there was light green to dark green. So we were always trying to, we're always working hard to ensure that we register a dark green in our, across all our indicators. So that is it. Next. So on the second, due to the successes of the first program that we implemented between 2004 and 2010, we received funding from PEPFAR to continue implementing HIV prevention, and we had 2 cooperative agreements with PEPFAR through CDC to implement the Pembe-Tatu model and Tuungane 2. So Pembe-Tatu was on provision of comprehensive and integrated HIV prevention interventions, and as indicated, it's a funding that was received from PEPFAR to implement the project between 2010 and 2016. We targeted key populations, priority populations, and the general populations, and our coverage, you can see it widened from our first project, and therefore, we implemented this in 10 counties that are indicated here. And our interventions was on HIV testing and counseling. That is what it was then, but now we call it HIV testing services. So we provide HIV testing services, voluntary medical male circumcision, evidence-based behavioral interventions with key populations, fisher folk, and HIV-infected individuals. So during that project period, when we implemented the Pembe-Tatu model, the key indicators that responded directly to HIV prevention were the 3, and therefore we are proud to report that during that period, we tested 398,833, and as I'd indicated, when you see a green, then it means you either reached or surpassed your target. So we fared well on that. And circumcised men reached with VMNC services were 500,025, and we trained 1,981 MOH personnel on safe voluntary medical male circumcision service provision. So like I'd alluded, we received funding for we received 2 grants from PEPFAR during that period of 2010 to 2016. So the second project under that period was the Tuungane 2 project. And the Tuungane 2 project was on supporting the scale-up of combination HIV/AIDS prevention services for general populations and youth. It mainly focused on key and priority populations, and coverage was in the 4 counties in the former Nyanza province, that is Kisumu, Homa Bay, Migori, and Siaya counties. And the interventions were HIV testing and counseling, voluntary medical male circumcision, evidence-based behavioral interventions with key and priority populations and HIV-infected individuals. So during that period when we implemented Tuungane 2 project, we were able to test 561,878 individuals, and that is when we also rolled out the DREAMS program, and we were able to enroll 20,030. Next. So due to the successes of the first funding cycle and the second funding cycle, I think we had won what we call donor confidence, and therefore we received new funding, and this new funding was on government, communities, and donors in partnership for a sustainable HIV-free generation, what we call the Tuungane 3 program. So we implemented programs under this project targeting key and priority populations, the general populations, including people who are living with HIV, and coverage was only in 2 sub-counties, that is Siaya and Homa Bay. Then the focus was on go to where the virus is, and that was the motivation for this. So we implemented HIV testing services, ART, key populations, interventions with key populations, interventions with adolescent girls and young women, that is the DREAMS initiative, and evidence-based behavioral interventions that target adolescents and young people and people who are living with HIV. So under that Project Tungane 3, these were our selected key achievements, and for that 5-year period, we reached more than 1 million people with HIV testing services. During that period is when we scaled up HIV testing services. We went door to door to provide HIV testing services. So home-based HIV testing services was vibrant during this period. Sorry. I'm not able to see my presentation. Apologies about that. Projection. Apologies about the technology, failure of technology, but I think I will continue from my laptop as we wait for it to reconnect. So I was on Tungane 3 project that we implemented during the period 2016 to 2021. So we tested 1,113,367 individuals, and during that period, we registered viral suppression of 97%. So we all know that under UNAIDS, the target is 95, 95, 95. So we are proud to say that we surpassed this target, and our aim was to reach 100%. So we circumcised 40,392 men, and we reached 114,972 fisher folk with comprehensive package of HIV prevention services. We reached adolescent girls and young women, totaling 72,383, and also provided PrEP, pre-exposure prophylaxis, to 11,936 key populations, fisher folks, and adolescent girls and young women. Our fifth project that was funded by PEPFAR is what we call Key Populations Investment Fund. Key Populations Investment Fund was funded by PEPFAR through CDC, and Impact Research and Development Organization was the prime partner for this particular project. And it targeted female sex workers, men who have sex with other men, male sex workers, people who inject drugs, and the transgender. Coverage was in Kisumu, Siaya, Homa Bay, Kisii, Nairobi, Mombasa, and Makueni. So this project was implemented in 2 years, between 2019 to 2021, and we were able to work with 7 service delivery partners, 5 key population-led CSOs, and 1 network of KP-led CSO for advocacy. So during that period, we served 127,689 key populations that included 93,423 female sex workers, 13,918 men who have sex with other men, 10,976 male sex workers, 8,784 people who inject drugs, and 588 transgender. So we provided comprehensive package of HIV prevention interventions to this category. We provided HIV testing services to 190,235 new key populations and linked 98% to ART. Through the support of KPIF, we supported 45,395 key population who are living with HIV on ART at various dioceses that were registered under the different implementing partners, and we registered 96.5% viral suppression for the key populations that were on ART. So through the support of Key Populations Investment Fund, we initiated 8,176 key populations on PrEP and registered 55% continuity of on PrEP by the end of the project. And so during the period 2004 and 2021, under the support, under PEPFAR support, we were able to make footprints in 25 counties out of the 47 that are in Kenya. And through that support, we provided HIV testing services, voluntary medical male circumcision, key populations, interventions with key populations, pre-exposure prophylaxis, evidence-based interventions. We also reached orphans and vulnerable children and adolescent girls and young women with DREAMS initiative. So, ladies and gentlemen, in a nutshell, through the support of PEPFAR between the period 2004 and 2021, we circumcised 662,066 males above, age between 10 years and above. And that is 27.6% of Kenya's total number of men circumcised by the year 2021. We trained 2,534 MOH personnel on safe voluntary medical male circumcision. We tested in total 2,835,202 for HIV. And of this, 19,252 were tested through what we call assisted partner notification. And that is what gave us the highest yield ever recorded by the program at 42%. And that was, again, the highest nationally. We reached 41,405 youth aged 10 to 24 years and 6,692 parents of adolescents, parents of adolescents. Can you go to the previous slide, please? Yeah, so thank you. So these are the figures that I'm talking about. Yeah, so in a nutshell, if you have forgotten everything else that I talked about, when you leave this room, let this be registered in your mind. And we served 72,383 adolescent girls and young women through the DREAMS initiative. We reached 18,044 key populations and 152 with a defined package of services. We initiated 11,936 key populations, fisherfolk and adolescent girls and young women. So that is in a nutshell what PEPFAR funding that we received between the year 2004 and 2021 was able to achieve. So we move on to the next funding category that is under the global funds. So the global fund programs, move to the next. We have received 4 funding cycles from the global fund. So our first funding cycle was what we call Global Fund Round 10, which was implemented between the year 2012 and 2015. Target population was female sex workers and MSM, and our geographic scope was in Kisumu County, and specifically Kisumu Central Sub-County then. So through that support, we reached 2,135 female sex workers and 157 MSM. So because of this achievement, we were able to receive the next funding, we were able to receive funds to implement projects under the next funding cycle, what they called Global Fund New Funding Model, between 2015 and 2017. So during this period, we served female sex workers and MSM, and expanded our geographic scope to Kisii, Nyamira, Migori, and Homa Bay counties. So implementing this grant in the counties, we reached 3,141 female sex workers and 511 MSM. So this was a great success, and therefore we received the next funding, we received funds to implement the projects under the next funding cycle, which was New Funding Model 2, that was implemented between 2018 and 2021. So during this period, we worked in Kisii, Nyamira, Vihiga, and West Pokot counties, targeting female sex workers, men who have sex with men, adolescents and young people 10 to 30 years, and people who are living with HIV. And with this, we reached 2,550 female sex workers through this support, 562 MSM, 21,164 adolescents and young people, and we registered 82% among PLHIV that we are following in West Pokot counties. We all know the challenges with the implementation of programs in West Pokot counties, because this is, traditionally it's a migrant population, and tracing them sometimes, once they're put on treatment, sometimes they stop because of, the migration. And therefore, that is the suppression that we registered in West Pokot during that period. And because of the successes of the previous funding cycles, we were funded to implement a project under Global Fund New Funding Model 3 that runs between July 2021 and June 2024. That is what we are currently implementing. And we are targeting female sex workers, men who have sex with other men, people who inject drugs, truckers, men in high-risk settings, and people who are living with HIV. And our coverage is in the 6 counties: Busia, Kisii, Migori, Nyamira, Nandi, and Vihiga counties. So far, we have reached 9,372 female sex workers through that support of NFM3, 413 MSM, 425 people inject with drugs, 289 transgender, 10,681 adolescents and young people, 2,938 trackers, 430 discordant couples, and 152 pregnant and breastfeeding mothers. So the funding is by Global Fund through Kenya Red Cross Society. Next. We are also implementing TB program courtesy of Global Fund through AMREF Health Africa in Kenya. And we started implementing TB program in the year 2016 when we received the first funding for TB under new funding model. So the target population was the community, county and sub-county HMTs, health management teams, and TB patients. Our geographic scope was in Migori, Migori and Siaya TB control zones. And during this project period, we trained 122 community health volunteers and 122 community health assistants on community TB care and prevention. We reached 2,544 bacteriologically confirmed index cases that includes 149 children who are under 5 years for household contact tracing and screening for TB. We reintegrated 613 TB interrupters on treatment. Because of that great success, we received funding to implement projects under the new funding model 2 that ran between 2018 and 2021. We targeted the same population, the communities, county and sub-county health management teams, TB patients, and civil society organizations. Our activities were implemented in Busia, Migori, Siaya, and Turkana counties, and we were able to register a number of successes. One is we trained 90 civil society organizations on organization development and system strengthening and DRM. Domestic resource mobilization, sorry, that slipped off my mind. We reached 9,256 bacteriologically confirmed index cases, including 722 children under 5 years for contact tracing and screening for TB. We reintegrated 635 interrupters. Rather, of the 635 interrupters that were registered, we were able to trace and reintegrate 598 on TB treatment. Because of the great success in implementing new funding model 2, we received funds from AMREF, from Global Fund through AMREF, to continue implementing community TB care and prevention under the new funding model 3 that runs between 2021 and 2024. Our target is on community health volunteers, healthcare workers, private and public health facilities, and chemists, key populations, people who are living with HIV, prisoners, long-distance truck drivers, and the school community. This project is implemented in Busia, Migori, and Siaya counties. So far, we have registered a number of successes. One, 4,761 bacteriologically confirmed index cases, including 482 under 5 years have been reached for contact tracing and screening for TB. So of those, 367 that have been tested negative for TB have been initiated on TB prevention therapy. 194 defaulters have been traced, and 172 of the 194 have been reintegrated on TB treatment. We have so far trained 90 civil society organization members on organization development and system strengthening. We have had 36 media engagements conducted across the 3 counties, and 37 civil society organization members have been trained on community-led monitoring and advocacy. We move on to the next. The next program area is malaria. Malaria program is being implemented courtesy of Global Fund through AMREF Health Africa in Kenya. Our collaboration and partnership with AMREF Health Africa in Kenya to implement malaria programs began in 2012 for the first funding cycle that was known as Global Fund Round 10, and this ran up to 2015. During this period, we targeted general populations, community health volunteers, community health and extension workers, and county and sub-county health management teams. Our coverage was in Siaya, Homa Bay, Turkana, Isiolo, Marsabit, and Marsabit counties. So during this period, we were able to register 43,200 suspected cases of malaria, of which 40,124 were tested, and we registered a positivity of 52%. And all the ones who were tested positive for malaria were treated. Because of that great success, we received funding to implement the next project under Global Fund New Funding Model that was implemented between the year 2015 and 2018. We targeted general populations, community health volunteers, community health and extension workers, and county and sub-county health management teams. NFM was implemented in Siaya County and in Vihiga County under Emuhaya sub-county. We reached 110,046 individuals who were suspected for malaria, but of those, 257 were tested, and positivity of 69% registered. All those who were tested positive for malaria under rapid diagnostic test were treated for malaria. Because of that great success, we received funding to implement the next cycle of Global Fund New Funding Model malaria under NFM2 that ran between 2018 and 2021, and this targeted general population and community health volunteers in Siaya, Vihiga, and Kisumu counties. In Turkana, West Pokot, Isiolo, Samburu, and Marsabit and Nakuru, we provided oversight to the county and sub-county health management teams. So during this project implementation period, we registered 133,278 individuals suspected for malaria, of which 126,267 were tested for malaria, and a positivity of 69% was registered. And all those who were tested positive for malaria were treated. And because of that success, we received a new funding to implement what we call Global Fund New Funding Model 3 that we are currently implementing and runs from 2021 to 2024. Our target population is general population, community health volunteers, community health and extension workers, and county and sub-county health management teams. This project is implemented in 3 counties, Kisumu, Siaya, and Vihiga, and so far, we have reached 640,714 individuals who have been suspected for malaria, and of those 607,011 have been tested for malaria, and positivity of 76% registered. All those who have been tested positive have been treated for malaria. So we are currently supporting 524 community health units, 4,837 community health volunteers, and 1,055 community health and extension workers and community health assistants through the support of Global Fund through Amref Health Africa in Kenya. Our next program, what we refer to as research program, was funded by Bill and Melinda Gates through JAPIGO. And this project was implemented for 3 years between 2017 and 2010. And it targeted key populations, female sex workers and MSM in Kisumu County. And during that period, because we're implementing a research program on a model to scale up integrated delivery of oral PrEP in Kenya, this project was anchored on the ongoing implementation of Global Fund HIV program in Kisumu County. So we tested 16,285 key populations. Of this, 16,117 were HIV negative, and these are actually the people who are eligible for PrEP. So of this, we screened less than half of them, that is 7,361. And of the ones who were screened, we found out that 5,544 were eligible for PrEP. There's an eligibility criteria that we used. And during that period, we were able to initiate 2,739, and we registered 54% month 1 continuation and 33% month 3 continuation. Next. So those are the projects that we've been able to implement courtesy of our 3 donors, PEPFAR through CDC, Global Fund through AMREF Health in Africa, and Kenya Red Cross, and Bill and Melinda Gates Foundation. So as I finish, I want to take this opportunity to acknowledge Ministry of Health through NASCOP and NAC, county governments in the 25 counties where we've worked so far, PEPFAR, the Global Fund, Bill and Melinda Gates Foundation, CDC Kenya, Kenya Red Cross Society, AMREF Health Africa in Kenya, implementing partners that we've collaborated with, Cambry, LVCT Health, EGPAF, CHS, CHEB, KCCB, CAP, COPTIC, and NIGE. And there are others that we've not mentioned here, but we appreciate the support that we received. We also want to acknowledge the program beneficiaries who form part of the data that I presented. We want to appreciate the local communities where we work, and we want to appreciate all IRDO staff for the expertise that you brought into the program and for your time. So thank you very much.
Kindly give her another applause. Thank you so much, Redemptor. So the next, we are going to our employers. We want to give our #1 employers an opportunity to talk about if we have made an impact in their lives or not. Kama tumepita ama hatujapita. So Redemptor, your employer is speaking next. Kindly come and introduce them.
So thank you very much, Maura. I had already mentioned that we had beneficiaries of our programs, and we invited, in this occasion, we could have invited so many, thousands of them. You saw the numbers, right? But we have just a few to represent the key areas of implementation. So we'll start with peer educator and outreach worker, the ones who are from Kisii, Samantha, and outreach worker from Nandi County. Can you come over? Samantha, say something about our program implementation in Kisii County.
Saseni, mkoaje wa babas? Hey, makastoma zongu mkoaje? Munaniona? Mora Samantha Nyagaka ndio huyu. Nafurahi kuona, nimeona customers wangu hapa. Hope tutapatana nyuma ya tent. Yangu mimi ni kushukuru mradi. Si wengine wanaogopa kuongea mbele ya watu. Si mimi nimejitolea naongea. Sababu nimetoka mahali na nimefika mahali. Na ni kwa neema ya nani? Nashukuru. Naitwa Samantha Mora, vile nimewaambia, beneficiary, natoka Kisii County. Mimi ni wale watu vile mmezoea kutuita ile mizururo. Siku hizi sisi si mizururo, empowered sex workers. So nikianza kwa kuambia, nataka niwaeleze vile imefanya sasa leo hii naweza jiita an empowered sex worker. Nilianza sex work 2013. Program haikuwa imeanza. So tulikuwa tuna risk maisha yetu hiyo time. Nilikuwa mlevi, nilikuwa navuta bangi, nilikuwa mwizi pia. Mwanaume akikuja na pesa si mimi naponyoka nayo. Juu sikuwa nacheka na pesa. So hiyo time tulikuwa tunavioletiwa, tunapigwa, tunashikwa na maaskari, tukipelekwa kwa cell, saa zingine tufikishwe kwa cell, Tukifika tu kwa kona tunaambiwa inama kidogo, unainama, unamaliziwa, unaachiliwa. Hiyo time program iko imekuja. So tulikuwa tuna risk life yetu, jua tu kwa tunajua kuna watu wangekuja kutusaidia. Nao program ikakuja Kisumu County 2013. Nilikuwa mmoja wao, walipata hiyo wakati. Walikuja wakatuongelesha hiyo time, mtu alikuwa akiniambia tuende for HIV testing, mimi na wewe tumemalizana. Hiyo story staki. Sasa program ikakuja 2013, imetusaidia kwa mengi. Hiyo time nikiongea, hiyo time nilikuwa navuta bangi, nilikuwa nakunywa pombe. Saa hii sikunywi pombe, sivuti bangi, niko sawa. Pia mimi saa hii ni mama ya watoto 3. Nafurahi na niko proud, nasimama naongea kwa watu. So hiyo time tulikuwa tuna risk hiyo life yetu. Program ikakuja ikatuongelesha, nikasikia ni kama nimesikia huo mwito, nikafurahi. Nikaona ni kama wametusaidia. Mtu kama mimi nilikuwa mmoja wao, wale watu walifanywa counseling, tukaongeleshwa, program ikatuweka hapa karibu, ikapata tumebadilika, tumekuwa watu wengine. Sasa hizi mnaweza kuwa mnakaa hapa na mjua watoto wengine, watoto wenu kama wanauza town nyingine. Hata wazazi wetu hawajui tunakuanga town tunafanya sex work. Si nikienda town, nikienda kwetu naenda kama mdozi. Mimi mtu nafanya kazi kwa hoteli kubwa, mzazi wangu anajua nafanya kwa hoteli kubwa. Usiku akuangi na mimi, usiku mimi nimeponyoka, nimeenda biashara zangu. Msitudharau. Juu huwezi jua mtoto wako ako town nyingine anafanya nini. Na si nyinyi wa mama wenye mnatuchukia. I wish mungejua wa baba wenu. I wish mungejua. I wish mungejua tu. Hata kama mnatuchukia. In fact wacha niwaambie siri moja. Kama kuna mtu unafaa kupenda, ni huyo malaya unaitanga malaya. Furahi. Huyo unajua akitaka kukumaliza ni sekunde ngapi? Na akitaka kukupea, kukusaidia pia atakusaidia na sekunde ngapi? 1. Kwa nini? Wewe utamdharau hapa? Mwanaume ni mwanaume. Ni longi tu wamevaa. Ni longi tu. Mwanaume ni longi wamevaa tu. Tukipatana na yeye, mimi nikimweka na yangu hapa, kidogo tushaponyoka na yeye. Wewe mwenye unanichekelea, unanidharau, unaniita malaya, nikitaka kukumaliza sitakumaliza tu. Penda watu. Ni watu kama nyinyi, wengine hata wamejificha tu. Usiku tunapatananga huko mpaka unashangaa, huyu si ni askari. Huyu si ni daktari. Na mbona tunangangania client? Kazi ni moja tunafanya, ni giza tu ndio inatofautanisha watu. Sasa mimi yangu ningeshukuru mradi vile ilianza imetusaidia. Sasa hii Kisisi amsikii cases sana za violence. Mimi niliwaidungwa mpaka kisu na wanaume. Hiyo time tulikuwa tunavioletiwa juu wanajua hatuna haki, hatuna right yoyote. Siku hizi sasa hii watu Kisii wanaogopa mpaka tunaitwa madaktari. Madaktari wa macho ni sisi. Au wako na watu wao wa kuwapigania. Au ukicheza na wao ile kitambo ulikuwa unapita tu hiyo ni malaya tu anapita hata unamwona tu venyako. Sasa hii Kisii hiyo mambo hakuna. Tunaheshimika kama watu wengine wowote. Juu wanajua tuko na wakubwa wetu, tunaitwa madaktari. Yetu tunashukuru na tunaomba pia mradi yake iendelee kutusaidia. Sasa hii at least tumeimprove. Hatuko tunapenda hata kupimwa. Sasa hii tunapimwa, prep ilikuja inatusaidia, pia tunashukuru. Mradi iendelee hivyo hivyo tu. Na kitu ya mwisho ningependa kushukuru mradi sana. Nilianza sex work 2013. Si nikisema sasa hii HIV negative, si hiyo ni plus. Si ni impact imenifanya. Nashukuru, asanti.
Madaktari wa nyanjani, sio? I'll be very brief and I'm going to read through this. These are drafted speech for the priority population, Nandi County, as I being the peer lead, and I'm going to read. Distinguished guests, all dignitary, people of diverse sexuality, orientation, and identities, protocol observed. God is good. All the time. Kwa Waislamu wanasema aje? Assalamu alaikum. Alaikum salam. Tumusifu Yesu Kristu. Good morning for the atheists. I'll start from the quotes of Mahatma Gandhi. It is health that is real wealth and not pieces of gold and silver. I give my gratitude to Impact and Development Organization on a milestone and initiative they are doing in researches. This is seen as the grassroots of ideas collection and documentation. It has tremendously impacted the lives of the vast community at large, including young adolescent girls and women, vulnerable communities, and the key population and plus the priority communities. Lives has been impacted through researches done and development, leading to implementation programs that are solicited to communities in different counties. It is my pleasure representing more than 3,000 people who will have been here. Personally, my journey to IRDO started in the year 2022, July, when I was approached by a sex worker who enlightened me about the implementation of programs in Nandi by IRDO and the need for volunteer. Absolutely, I was in Moi and I was fourth year. I was delighted about it, and from my comfort, I was engaged as a community volunteer in HIV, STI prevention, human rights, mental health advocacy. Through community mobilization, the heterogeneous were and are brought on board. The community is enlightened on matters HIV prevention, human rights, mental health awareness. As aforementioned in Mahatma Gandhi's quote, health individuals have been brought on board through the support of IRDO. This is evident through outreaches, enriches, mental health sessions, advocacy forums. For sure, pieces of gold and silver has been considered worthless by IRDO service providers for community are receiving health services at no cost. Our able peer educators have continued advocacy on behavioral change for the heterogeneous GBMSMs, people who inject drugs, and the sex workers, with the support of the stipends allowance as they do their advocacy work. The PWID are receiving needles and syringes at no cost with ease and other many, just to mention but a few. This has reduced the risk of HIV infection. I've witnessed change individual ethnic communities in Nandi, ranging from the heterogeneous GBMSM, sex workers, and people who inject drugs. I being part and an example. Furthermore, we are the Nandi community request IRDO to continue reaching out, bidding for more funds from partners and donors to support gaps as the PWID cannot afford food for those who want rehabilitation to be rehabilitated, widow sex workers to have support through small business initiative and other vulnerable communities that will uplift their life, change their risk behaviors. Finally, our HEBO director, Dr. Professor Agot Kawango, we welcome you to Nandi for you witness the great impact of IRDO with our community living in the region. We welcome you to Nandi and we say Karibu. They are all and are saying Kongoi. They are saying Biamuno. They are saying Erokamanu. We love IRDO and hoping for more years of implementation to continue with the good work. Cheers to IRDO for 20 years of implementation. God bless IRDO. God bless everyone. God bless Kenya. This has been drafted under my able leadership in Nandi as the outreach worker, the heterogeneous GBMSM, as I go by the name Magame Duncan Omoke. Wababa wakiwa hapa, pia mimi nawapenda. Napenda magari kubwa kubwa. Napenda wamama wa pesa, na pia napenda wanaume. Wanaume wa ndevu, wanaume wa misuli, na wanaume wanaotosheka. Asante sana. Mwenyezi Mungu awabariki.
Thank you, Duncan. Okay, next we shall have our beneficiaries from Kisumu County talking about malaria. And in the room is Susan Okode and Fred Misachi. I don't know whether Fred is around. Fred, yeah, please. Okay, so Fred, it is your opportunity.
Good morning, everybody. My name, I'm Fred Misach. I'm from Kisumu County, Kisumu Central Sub-County. I'm one of the community health volunteers. Now we've been graduated to community health promoters by the launching that was done in Kericho Green Stadium recently. Just want to appreciate the IRDO for the support that they're giving to community health promoters. As I gave you a bit of background, community health promoters, we are managing at least 100 households within the area that we are covering. And one of our roles, we are doing health talk, we are doing assessment on various diseases such as diarrhea, eye fever, and other other diseases that can be transmitted within the community. We are able to manage them. There are some that we are able to manage within the community. That is malaria and diarrhea, and some fevers we normally refer that we cannot manage. The support that we have gotten from Impact IRDO, we've been trained on CCM, that is malaria, community case management. We have gotten a support of tools. We have also gotten a support of monthly meetings. We've also gotten a support of quarterly support supervision and annual review meetings within our CUs. As I stand here, I represent some of the CUs and 4,000 and something community health volunteers who have been impacted by the IRDO. So far, the program is still continuing, and we are still getting the support from them, both monetary and commodities in that order. I want to give thanks to Got Kawango. I know her long time ago. She was doing another research in collaboration with UNIM, and yes, thank you so much. Thank you.
So thank you very much, Fred. So Susan, I'll request that you speak from up there.
Good morning. Good morning again. I'm Susan Okode. I'm one of the beneficiaries of Global Fund programs. I'm a mother of 4. I'm married to one husband. Okay. As they've been saying, I said I'm a beneficiary of this program. Okay. I said I'm a beneficiary of this program. I'm a mother of 4, and I had a tendency of starting NC clinics at a later stage. I will start my NC clinics at around 32 weeks. Nikisema sitaki kupangana hospitali. But with this program coming in place, and I appreciate our CHV, whom I happen to be among her household. She walked with me through this journey. Right now, I have a baby of 5 weeks. He'll be turning 6 weeks next week. And even right now in the morning, she came and reminded me that my baby is supposed to go for the immunization on Monday. And when I was pregnant, before even I conceived, she will come to my house to do screening for the other kids and even the entire household. She will clean us for malaria, she will clean us for TB, and in case we presented with any sign, for the younger kids, she will do testing. She used to have those kids. She will do testing, and if any of them happen to be having malaria, she also will provide drugs, and if it is a referral case, she will refer her to the hospital. But one day when she came to the house, she found that I was very sick, not knowing that I was expecting. I was only 6 weeks pregnant. So when she talked to me, I confirmed into her that I'm pregnant, but I was very sick. I had low abdominal pain, headache, chills. And what she did, she actually escorted me up to the clinic. I was tested, and fortunately, I was found to be having malaria positive. I was treated. But on that very, very day, she insisted that I start the NC clinic. So this baby of mine is the only baby that I started the clinic at an early stage. She walked with me through this journey, and up to the time that I was going for delivery. During this pregnancy time, she will ensure that I take the IPT, the malaria preventive. She will ensure that I go to the clinic regularly, and also she will ensure that I have received mosquito net. Na hata akachukua opportunity ya kunifundisha vile nafaa kuweka hiyo net, kui-air, and I appreciate her so much. When I was going to the clinic, she will come to the house to confirm kama nimepata hizo vitu zote, the IFAS, hizo vitu zenye watu hupewa hospitali, dawa za malaria, za IFAS, nimedungwa hiyo TT. Na nikiwa mgonjwa, angekuja, in fact, angeweza kumaliza siku 2 kama hajafika kwangu. And I appreciate her effort so much. When I was in labor, she was the first person I called, because she has now become my confidant. She took the initiative of coming to help me reach the hospital, of which by God's luck I delivered safely. In that very wee hours of the night, I again called her. She was just outside. Kumbe, she never went back to the house. I called her to confirm to her that I've delivered safely, and she was very happy. I appreciate the program. I appreciate your efforts. And to the donors, we are also very happy and very grateful. Please extend your hand to the others who may not have reached your interventions. And for those of us who are in the community, we are now even becoming the advocates of others, to advocate for them to go for early antenatal clinics, ensure that they take the malaria preventive measures. And thank you for bringing the community health promoters on board. Thank you so much.
Thank you very much, Susan. So you have heard the testimonies from our beneficiaries in the community. So the last category will be on GFTB. We'll have Samson Ochieng, and who is a linkage assistant from Yala Sub-County Hospital, and Caroline Nangila Obwora from Busia County. So if you're here, kindly step forward.
All protocols observed. Is it an afternoon or morning? Okay, good morning. My name is Samson Ochieng from Sia County. Game Sub-County. And it is such an honor to be here today. As I want to talk on GFTB, IRDO has really been of great support to us as the link assistance from Siaya County. First of all, through ACF, at the facility level, that has led to tremendous growth in bacteriologically confirmed cases. And you could see even the performance that were laid out here. There has been a great increase in the bacteriologically confirmed. And now we are extending it even to the community level. Yep. And then the introduction of under 15 chest X-ray has also led to an increase in case identification as far as TB in peds is concerned. Treatment interrupted tracing has also impacted much on taming our clans, hence near 100% cure rate. Supporting community activities has allowed us reach the marginalized population and even the vulnerables, improving our performance. And you realize that mostly TB is in the community. And so when IRDO came up with this issue of supporting community activities, it has tremendously helped us to reach them, even the vulnerables in the community. Through IRDO support, Siaya has managed to be at the top 3 in terms of performance. We can just clap because of that. And not to forget, my sub-county, Game Sub-County, being the second sub-county in this year's performance. Let us just give a clap for that. It has not been easy, and these are things that we were not realizing when IRDO had not come on board. And through their support, we got to get at the top in terms of our performances. Let us clap again. It is my humble appeal to Dr. Kawango, and the entire team that in the next grant, please don't forget to remember Siaya County again, because we really need this, and the impact is already felt, and the community is also happy receiving the care they never had before, even until this point. Thank you so much. My name is Samson Ochieng. Before I summarize, now through IRDO support and even through the passion that I've had doing these TB activities in the community and even at the facility, IRDO has also supported me that I've been able as an artist to even release a song as far as advocacy for TB is concerned. If given a chance, I'll be able to perform the song. So my name is Samson Ochieng, and from Gebsam County, Siaya County. Thank you.
So thank you very much, Samson. So I think we end that session. Ladies and gentlemen, mambo ni mengi, masaa ni mafupi. Yeah, so to our donors who are here, you have heard of what is going on. The need is great in our communities, and we want to appeal that should there be funding that comes your way, do not hesitate to reach us. We are ready. We have the capacity to implement. Thank you very much.
Wow, thank you, Programs Department. Munaona, tunaweza, hatuwezi. Tunaweza. Hiyo ni kionjo tu. That was the programs. Now, I want to invite our CEO, Director, Dr. Professor Kawango Agot, to come and present for us the research overview. Hapa pia tutadecorate, mtaona tu. Karibu sana daktari.
Aiwan wergo diambo kama amanya ine mansungi gimwala tuna diambo
Timo hata wewe. Hamjambo. Hey, I'm so happy to see you here. And the testimonies we hear is the reason why we do this job, right? And as Redemptors, no, I think it's Mora who said, these are our employers. Impact is not your employer. Your employer is the person that you serve. The employer is the beneficiary. Ukimtreat vibaya, kazi hakuna, ama. So we value you, we value you. So allow me to run through. So we are a program organization, but we are also a research organization. So I'll run you through the research, and then, hey, where do I stand? I don't like standing up there. You know, me, I'm a teacher by profession, so teachers move around. Okay, so I think in the morning, we shared how impact is structured. We have research division, we have program division, we have business systems, and then we have business development. So we are moving to the research division. Next. Okay, so you know inception was 2003, that's why we are here, 20 years. We've conducted over 40 major research studies. We've done a number of minor research studies, mainly funded by the National Institutes of Health, which is a US government funding or organization or funding agency. And our funding, we have received direct funding, but we've also received funding through various international universities, and I think you saw that in the morning. In terms of the universities, almost 10, 15 universities that we affiliate with. Next. And so, ongoing studies, I'll just talk about the ongoing studies and a few in the last 3 years. I'll not talk about all the 40. And so we have the study. I want you to note the names of our studies. Many of them are very interesting. So one is called Chanjo. And Chanjo, we are looking at understanding the potential public impact of vaccine to protect against gonorrhea. We know we don't have a vaccine currently as we speak, and the doctors in the room can attest to that. And so we are looking at doing the research to find out what the service providers would want, what the potential end users would want, and so that as the vaccine is being developed, it's actually being developed from the laboratory all the way to trying it out. As the vaccine is being developed, it is developed and consideration is given to what the end users would want. Because you can come up with an intervention, and if the end users are not interested, then it remains in the shelf. And so that's what we are doing. And we are doing it in Kisumu, and Nairobi counties. Our sponsor is Georgia State University and Duke University, and it ends next year. We've completed phase 1 and phase 2. We are now started phase 3. The second study is called Akiba 2. Akiba 2 is where we are trying to test whether we can encourage men who are receiving cash income, you know, the border, the fisher folk, the juakali, those who receive daily cash income, if we can encourage them to save part of that money. And if we encourage them to save part of that money, then it means that there's be less money to spend on sex and to spend on alcohol. While they're also building themselves. So that let sex ipate kidogo, alcohol ipate kidogo, but pia wajenge nyumba nyumbani, sindio? So that it's all rounded. So that's what we are trying to do. We are doing this thing in Bondo. We are doing in Sierra County through the University of Pennsylvania. It's ending in 2026. Funding is UN, National Institute of Health. We've completed enrollment. We are continuing. The next is Tuashindi 2. I told you we have very interesting. So Tuashindi 2 is a study that we actually developed the intervention ourselves. Working with adolescent girls and young women and service providers, and it's called Tuashindi na PrEP. We are winners with PrEP. We are conquerors with PrEP. And it is supposed to encourage PrEP uptake. You saw what Redemptor presented, where you have uptake after 3 months. No, after 1 month, you are at 50% continuation. After 3 months, you are at 33% continuation. After 6 months, by the way, you are at almost 10% continuation. So people take PrEP and they don't continue. So what do we need to do differently so that they can take PrEP and continue taking PrEP? So their risk remains, but they don't protect themselves. So that's what we wanted to do. And the whole idea is to work with those who are end users. I'm a believer in end user, and a believer in co-designing things with those who are going to use it at the end. And so we worked with adolescent girls and young women to actually come up with an intervention that's called Tuwashindina PrEP intervention. And so we identified what are the reasons why adolescents don't use PrEP. And a lot of it depends on the relationships. You know, it's like their partners don't approve, their partners think that they are infected, they're cheating, that they are sex workers, or whatever reason. And so we are, at this point, trying to work with adolescents themselves, and one of them is going to share with you briefly at the end what she has learned. This is in Siaya County, funding NIH again. We are moving on really, really well. Owete study, Owete means brothers in French. So Owete study is where we are trying to, you know, people have their social networks. In the beaches, the beach community is like a family. When you go to the beaches and you work in the beaches, they're like a family. They know each other, they know each other's issues, address each other's issues. And the men don't like going for healthcare services. We all know that, don't we? And because they don't want to go for healthcare services, how can we reach men? And a lot of this you'll see that we are working with women, but also men. And so what we are doing is like, we are identifying what is called a central promoter. A central promoter is somebody that is the to-go-to person. Ukiwa na financial problem, huwa unaenda kwa nani? Ukiwa na relationship problem, ukiwa na whatever problem, ukifiliwa, ukiwa mgonjwa. So that person that people are going into, we identify that person. We give them multiple self-test kits. They go to they give their peers, because their peers already trust them. And then the peers, after they finish, then we send them to the facility to go for confirmatory testing. If they are negative, they are linked to PrEP. If they are positive, they are linked to care. So that's what we do in the Owete study, fishing community, sponsored by University of California, and then 2025. Next, we have Pamoja. Pamoja study is an extension of earlier studies that we had done, where we've been using self-test kits, and then we give the women to give their partners. But we get a report back from the partners, from the women themselves, that my partner tested, but we don't know whether the partners actually tested, okay? So we want to hear it from the men. Did you truly test? And so what we do is that we give the women multiple self-testings, like my friend, hey, my buddy from Kisi. Uko wapi? Yeah. So we give them, because they have partners, and they said, ameona partners wengine wake hapa ndani, si ndio? We are not going to ask who they are. We will not ask. But the point is, we know that the most difficult group to identify are the male partners of female sex workers. Si ni kweli? We don't know who they are. It could be my brother, it could be my father, it could be my son, right? We don't know them. And who knows them? See, the female sex worker themselves. So we want to give them test kits to go and give to their partners and encourage their partners to go and test. Right? Yeah, so because we don't know who they are, they could be umu. We are not going to say, Philip Sinikweli. I'm not saying you're one. I know you are a pastor. But it's because I know you've interviewed a lot of them. So we don't know who they are, but our beneficiaries know who they are. And so we'll give them multiple test kits. We ask them to give to their partners. We ask them to tell their partners which facilities to go to, and then we go and wait for them at the facility and see whether they are coming. So that is to encourage the men. We are calling it reaching the last 20%, which means that 20% of men who are HIV infected do not know their HIV status. Then we have the core study, which is couples' reproductive decisions, and we are targeting discordant couples. Discordant couples in the sense that how do they make reproductive decisions so that when they have a child, the child will be HIV uninfected. So this is an exploratory study. It is one which we are supporting a student that's learning research to be able to understand. Next. So that's why we call it a training grant. Then we have one that is called DISC. DISC is one that we also developed the intervention from scratch. We actually talked with, DISC is a study that developed a clinical prediction tool to help identify HIV positive adolescents who are at risk of loss to follow-up, because we know that loss to follow-up is higher among adolescents and young people than it is among adults. They are in school, they have issues, where you're staying, and so it's a big problem. Viral suppression is also lower among adolescents. So we are trying to find out, and we know that the healthcare providers have a lot on their plate. Already they have a lot on their plate. So how can we come up with a tool that will make it easy for them to still manage these adolescents to the best of their ability without spending so much time, umeleta jikoni karibu, without spending so much time or at the hospital. And so this tool, it has an algorithm. If there's A and C and F, unaenda hivi. If there's, it's like syndromic treatment. If you have this symptom and this one, you probably have gonorrhea, maybe chlamydia, maybe this, maybe that. So that is the tool that we developed together with the youth themselves who are on care, with their parents, with the teachers, because the school is an important environment for the kids, as well as the healthcare providers. And so came up with that tool, we piloted it, then we actually rolled it out in terms of addressing a large number of groups. So right now we are analyzing data and looking at what's going on. And we were abstracting viral load data from the facility. And then we have a study that is just coming up that's called ethnodrama, and that is looking at how to address PrEP stigma towards young women. Because one of the things that is really making young women not take PrEP is because of stigma associated with PrEP. They think you're positive because it's the same. It's the same ARV that you take for prevention, the same one that you take for treatment. So how do you tell me where you are negative and where you are positive and you're taking the same pill? So you don't have, they will not even give you time to separate that. They'll just say this one is positive na natudanganya hapa. Or the issue around people will think you are promiscuous, right? In the community, or that your partner will think that you're cheating on me, or that you're suspecting me that I'm cheating on you. So there's a lot of stigma around that. So how do we use drama in the community to address that? That's starting now, also funded by NIH. As you see, almost all our studies are funded by NIH through Duke University. Next. Then we have our little baby that is called Jitegeme. In Jitegeme, these friends of mine have money, but they don't think they have money. And so this is a study where we are trying to get the sex workers to save part of their earning to be able to call back in case of emergency. You heard some of the emergencies they talked about. That you are in an emergency, ulienda na mteja hayuko. Si saa zingine unaenda na kumekauka. Si biashara ukauka saa zingine. Na biashara ikikauka, what happens? You may become desperate and then engage in something that you would otherwise not engage in if you had some money to fall back on. So that is the whole idea about Jitegeme. We want them to rely on themselves. We want them to have a reserve that they can call back when they are faced with a situation that would end up compelling them to engage in risky sex. And so we did my usual thing. We did multiple. First, acceptability. Is it even acceptable by sex workers? We completed that. Section 2, co-designing that by the sex workers themselves, the peers of sex workers, the implementers of sex workers, the Ministry of Health. We called all these people at different time points to be able to develop the intervention. And right now, we are piloting the intervention, and we want to see whether can female sex workers actually save part of their earning. Because when you talk to them, a lot of them, you ask them, how much do you earn per month? They say, about 3,000, 4,000. And then you say, now let's take 1 month. Let's start. Ulikuwa na watu wangapi? Wanasema maybe 7, maybe 8. Ebu give them, fake names. Let's take the first one. Umekuwa na yeye mara ngapi? Analipa. So when you calculate all this, you realize it is 20-something thousand. It is 18,000. They say, uongo, we say, matena, hiyo pesa nani anaiba? That's not my, I don't earn that. You walk back again with them, it's like, hiya, where does my money go? And then they start realizing that they have this spontaneous spending. Unaona viatu mzuri, unanunua. Unaona hii, unanunua. you know? So they don't plan. And so the intervention is helping them to budget, helping them to plan, helping them to know what they need, but also importantly, is helping them to save money that they can call back instead of kwenda na mtu kesho unasema na huyu chura alitoka wapi. Because you are desperate. So that desperation is what we want to reduce. Next. And then we have had 2 studies. We've said a lot of PrEP. PrEP is very effective if taken. And taking it is a problem. How many of us mukiandikiwa dawa mnameza mpaka mwisho, mpaka the last one? Weka mkono juu. How many mukipewa ukianza kupona pona unaanza kusahau? Weka tu. That is 90%. And you know that time, because what happens when you are well, unameza dawa. Na unajua hii sio ndogo, the size hii, inanyonga kidogo, si ndio? And you're taking it. So PrEP is an issue. It is effective, completely effective. But if you take it daily as advised. Right now, research is going on long-acting PrEP, that you can, long-acting different types of PrEP, also injectable, coil, film, and many others. But as we speak, we only have oral. And while you have one, huwezi kungojea whatever you don't know inakuja lini. You want to save that life now. You want to make sure that somebody doesn't get infected when? Now. So it is oral we work with. So we were trying to compare interventions for among sex workers in terms of what is it that can encourage them to use PrEP. And then we also, the M-PrEP is the male PrEP. We wanted to see, can we identify male partners of female sex workers and try to enroll them in PrEP and see whether they would take PrEP for their own protection as well. And the 2 of them are ending end of this year. And so also all of them NIH funded, next, through Columbia University. And then these 2 are training grants. We are training also students. I like mentorship. And so me, together with the others, we are mentoring students who are just graduated, just completed their PhD, and they want to launch their research career. So this is, in addition to the code one, so there are 3 of them. And this is engaging HIV prevention and preferences for long-acting injectable among men. We want to see that if the long-acting injectable comes, a lot of times you get interventions, and we always forget the men. We always think of women and girls. So we want to make sure that we also incorporate the requirement of, it takes 2 to tango, isn't it? Ama watu upata nini aje? See, it takes 2. Now you are dealing with 1, na unawacha, then you're doing only half the work. And then there's the girls' empowerment study that is addressing economic empowerment, because a lot of things that drive girls to unprotected sex is because of economics, right here. Next. And so our final one for the current studies is called, this one is a different one. This is for COVID trial. It's called Solidarity Vaccine, Trial Vaccine. And looking at developing a vaccine. The vaccine is already developed, but we were testing the vaccine to see whether it was effective against COVID-19 for people who are 16 years and above in Kisumu County. We have 2 sites in Kisumu. We are one of the sites, sponsored by CAVI, Kenya AIDS Vaccine Initiative, with funding from WHO, and it's ending next year. We enrolled 500 participants. We are 5 sites, and so altogether as a country, we were enrolling 2,500 participants. Next. And so just quickly in the last 3 years, just to give a sense. Next. So we had what was called Adapt Out, where we were now trying the drugs for treating COVID. The other one was vaccine. This was a drug for those who were already infected. Would that drug work? To 1, reduce the symptoms, and of course, reduce the rate of death. And then the Jikinge 1 study, where we gave multiple self-test kits, and that is what informed Pamoja. Multiple self-test kits to improve couple testing and partner testing. Those of you in the medical field, you know how difficult it is to get mameni kukuja kwa clinics, ndio? Wanakuja wanakuacha kwa gate, wanakuambia wakimaliza unipigie, ndio? How can you get the men engaged in reproductive decisions and services? And so we wanted to make sure that is there a way that we can get their partners tested? Because you really would want at MCH for the man and the woman to test. And so we gave multiple self-tests to the women and asked them to give out to the partners. And it showed that it's very, very effective, what is called secondary distribution of HIV self-test. Next. Then that was a training grant, a small one, that gave us data that then informed the current mentorship that I showed up there on the socioeconomic understanding. And so right now we are going to implement pilot and intervention. The other one, this one was just fact-finding. And then we used that, we developed an intervention which we are going to test in the training grant. AOB is a stigma study. AOB in French is Akwede Okboga. So Akwede Okboga means that I don't care about stigma. It's like stigma is an AOB to me, you know? So it had that name, which means that if you really know you are at risk, and you really know that PrEP will help you, stigma should not be a barrier. So that was the study that we did, and it showed really, really good prospects. Next. And then we have a photo voice. It's also another study. This one was interesting in the sense that it's a design that I'm not used to, but it's where people, you don't ask people questions. They go and take photos of what they think affects PrEP uptake. And so one person was telling me that she did a study that was assessing malnutrition among children. And so this mama alienda akapiga picha ya ugali kubwa. Alafu caption akaandika, hiyo ni ya baba watoto. And the point he was making is that baba watoto anakula all the nice things. Inakuwa selected and apewa. Sasa wale watoto wanabaki na kidogo, that's why there's malnutrition. I said that was hilarious. So anyway, and then we have another study that we did to try to encourage our KP it was an evaluation of the CDC program that we had on KP to try to see whether sending text can improve attendance and continuation of service access. Next. Girl study, I think that one, that's also, we were looking at how to get adolescents to test more and what testing modalities they prefer. And that ended. And then Wasichana Wetu is where we now lowered down this giving out of multiple test kits to adults, and we wanted to see that these young people of age 15 to 19, can they negotiate giving self-tests to their partners, some of them much older than they are, and do so without violence. And so we did that, sponsored by University of Pennsylvania. And I think I should be ending. Hello? Watu wanalala huko. And then my baby of the house is called Ray, Reducing HIV Among Adolescents and Youth. This is a mentorship program where we identified young people who had zero previous research experience, and we trained them from ground zero, where some of them sent in concept proposal handwritten. Some of them had never touched a computer. That was the first time they were touching a laptop. But they sent, and as long as the idea was good, they went through a competitive selection process, actually through 3 experts and 2 young people. We identified 30 people that had the most promising, obtained funds from the Bill and Melinda Gates Foundation. They were fascinated by the idea. So they gave each person $5,000 to explore, to test the ideas. And we actually held a really successful first international conference that is organized by youth, with all youth presenting. Sisi wazee tulikuwa tunakaa tu kwa kona. So it was done by, where's Winnie? Oh, okay. Yeah, she's the one who coordinated, and she's the one who has arranged 90% of this meeting. So she's a great planner. So if you're looking for somebody, I'm not marketing her. She's taken. Yeah, and so the measure, the unit that you measure research with is publication or international conferences, because then people know that what you've done meets international standards. So these young people who didn't even know how to type have actually submitted 4 abstracts that were presented at the University of Nairobi 2023 workshop. They have attended international conferences, 2023 Interest, International AIDS Conference 2023, AIDS Impact. That was in Mozambique. The next one was in Australia. The next one was in Sweden. The last one was in Chicago, US. IAPAC was in Puerto Rico, and ICASA is coming up that we are going to present in Zimbabwe. And where's Gerald? He's only one of the 7 people in the continent that has received the Zimbabwe UNICEF funding paid for to sponsor him to go. So this is my pride, building people from nothing to something. And I like to build them from there to be above me. That is what teachers are for. The teachers in the house, you know that. That is your work, to build people so that they can overtake you, and then you sit and you're so proud that that one is linked to me. So I think we are done. See, there's a thank you at the end. Thank you. Thank you. Asante, asante, asante. I want only one person to talk about their engagement, one co-designer. Where is Ndelema? Joe. One co-designer that we co-designed with an intervention. And she is also a youth advisory board. So she's a board member.
Thank you, Daktari. Hello, everyone. My name is Sarah Ndelema, and I'm grateful to be here today. It's a golden opportunity. So thank you for this opportunity to celebrate IRDO at 20, which has had a huge impact on me and also on other youths as me. So as Daktari has said, I'm a youth advisory board member in a study called Tuwashindina Prep, which focuses on adolescent girls and young women like me who are at risk of getting HIV infection. We are a group of 15 members. They are here, and who meet quarterly. We provide inputs or insights on the study activities, on how best they can reach and engage with the youth. And also, we provide insights on data collection tools. That's where we go through the tools and give insights, which can enable it to be easy to be understood by other youths. So this has helped the study succeed and navigate through the challenges in the implementation of the study. And this also empowered us as youths, so those are me and the 15 members. We feel like our voice is heard and we are involved in matters affecting us. So that's a great impact on us, since we feel like we are valued and someone somewhere really think our voice has a great impact and we can give some input on matters affecting us. It's so important. And secondly, IRDO also gave me and other youths also a zero experience in a research, an opportunity to capacity build our skill in study design and conduct that study, which is the AOB study that Daktari was saying. In French, it's called Aqueduct Boga, the stigma study, as members of the young research team. So we were YRT, we were 7 YRTs. We were able to conduct this study. We developed the tools, we collected data, we did data entry on the red cup. We also did transcriptions, we did coding and all those. So this has been a huge impact in our professional work and research network as youths. So that's a great impact, and we are very grateful for IRDO. We are very grateful for Daktari. So hongera IRDO, hongera youths. Thank you so much, and may God bless you all.
Jetty boy, make it dance.
So I forgot, me, I'm a co-designer. The other 2 people I co-designed this with, Jeremy, Joshua, just come and share briefly, because we really would want to make sure that what we come out with here is that we don't want to impose. You come with an intervention, you impose, and then you think it works, and then you sit back and wonder, why aren't people taking PrEP? And you didn't engage them when you are diseased. It's like, hiyo ni yako. Sasa hii tunataka iwe yao. This one, so this is now community first. Now, boss.
Okay, to the protocol observed, ladies and gentlemen, good morning. By virtue of names, I'm Jeremiah Okello. I work with the CABMOH at Migori County Referral Hospital. I'm one of the CAB members in the DISC study. I'm thrilled to get this chance to talk with this group today about the wonderful DISC study. In Migori County Referral Hospital, in Migori County, DISC study had intervention sites, namely Dede, Rongo, Awendo, Nyamaraga, and Godkweru. I happen to have interacted with the community and the providers from the respective intervention sites, and these were their comments about DISC implementation. I'm specific about the intervention because that's the point where the DISC tool was being used. So one, they say that this tool was elaborate, and this was giving the IRs enough opportunity to express themselves and to let the healthcare workers know more about the IRs. During that period also, IRDO trained healthcare workers on mental health, and this really impacted on the improvement in diagnosis and management of mental health in the respective intervention sites. This is very important among the adolescents. As you know, we have experience in the sub-county where I work of losing an adolescent who committed suicide because the parent did accidental disclosure and was abusing her due to her HIV status. They also said that this has improved in the appointment management among the IRs, because now they were being followed up closely. And then due to this, there was also improved adherence, and consequently, in the cohort that was being used, there has been improvement in VL suppression rate. Finally, allow me to take this opportunity on behalf of Migori County to express gratification from the CASCO and the SCASCO of Migori County government for IRDO for having done such a wonderful study. We request for implementation of this tool in all other facilities. My disclaimer is, why is it that very many studies are not in Migori County, but they're in other counties? Otherwise, thank you and may God bless you.
Good morning. I stand here wearing an hat of adolescents and young adults in Kenya. That is the over 60% population. By name, I'm Joshua Olio, and I happen to be the CAB representatives for adolescents and young people at the DISC project. And also another disclaimer is I was also in the planning team for Ray. Thank you very much, Kawango, for that leadership. I want to say that one thing is we are very grateful as young people that you are involving us in research. And that is much important, that nothing for us without us. And so our involvement in research is also building up the efforts that you're making. So continue with the same spirit and continue involving us in the same. So looking at DISC, I want to talk about only one very key aspect. Probably research-informed programs and programs informs advocacy, and advocacy informs change. So in our global world, 1 out of 4 people are suffering from mental illness. I think even where we are today, there are people that are maybe are not happy, inwards or outwards. And in Kenya, it's estimated as 10.3% prevalence for the adolescents and young adults aged 10 to 24. Allow me bring the aspect that this project was a research, but it led towards also intervening on mental health interventions for adolescents and young adults in Homa Bay, Kisumu, and Migori counties. We are very grateful that you are able to take through the healthcare providers, through the mental health trainings, that they were able to also impact back in how they really reflect in attitude towards service provision. And we also say gratitude to the research assistants. We say thank you very much. The way you also humbled us during those counseling sessions as well, we are really grateful for the same. And we recommend the same as last time we were having the discussions with the CAB. We still recommend that some of those observations for this project can also be included in adolescents and young adults programming in Kenya. Thank you very much, everyone. And we celebrate you, IRDO, for the great work that you have done. It is very, very exemplary that you have shown us the good way towards improving health of communities. Asanteni sana, and may God bless you all, the IRDO team.
IRDO at 20.
Wow. Thank you, Joshua. I just like your confidence. Umeongea hapa hata professor was paying attention. Paying attention. Thank you so much. And allow me to blow our own trumpet. Are you seeing how IRDO is involving young people? So we don't just say involve young people, we actually involve them. So I'm so proud to be associated with IRDO myself. I want to also inform all of us that we are actually streaming live. So whoever that is not here, please share. We are streaming live. Those who are in the IRDO wall, kindly share with the rest the link. We are on Facebook live as well. So shake your collar. Now, I want us to move ahead and I want us to move ahead and call our Dr. Kadima to come and present on behalf of IRTHS. Thank you.
Good morning, everybody. Good morning once again. I hope you can hear me. All right. You can hear me now? All right. Okay, you can hear me now. So good morning once again. I'm really happy and delighted to be here on this very special occasion to celebrate achievements that have been made by my fellow colleagues, years of dedication, innovation, hard work. It's such a privilege to be here to celebrate with you. So all esteemed guests and my fellow colleagues, I greet you and I acknowledge you. So my job here is very simple. Please tell your neighbor, I'm standing between you and tea. Tell them she's standing between you and tea. So I'll make sure I keep it short and sweet. So my job is very simple. just to share a little bit about the business side of IRDO, and that's basically about impact research, training, and healthcare services. I believe there is a presentation. No, there are two. The second one. Apologies for that. So impact research, training and healthcare services, which is a limited company, is actually based on our organization's strategic goal to refocus the organization's financial resources and practices so that we can be self-reliant and financially efficient. So that we are not only depending on funding from donors, from research grants, but also as an organization, we are self-reliant, we are able to generate income. So to be able to achieve this goal, the organization partnered with 108 local investors to establish the hospital as an economic wing of the organization. So the facility is registered as Impact Research, Training and Healthcare Services Limited. And it was registered in September 2017. The hospital, also known commonly as Tungane Hospital, is located just along Kibuye, right next to Kibuye Catholic Church. If you know the new Kiwasko storied building that's coming up, just opposite that, you find us there. And I'm buying time so that I can show you a little pictorial of the facility. Apologies for that. But basically, we were registered in March of 2018 as a level 3B hospital. We opened our doors to provide healthcare services in April 2018. We provide outpatient services, inpatient services. We actually registered to provide, we are registered as an inpatient facility with a 30-bed capacity. So we have the male ward, we have the female ward, we have the pediatric ward, we also have the newborn unit, and we also have the maternity wing. So all these add up to 30-bed capacity. We have ultrasound services. We have pharmacy services. As you will be able to see, we have both the hospital pharmacy and the research pharmacy that supports the clinical research site, which is located within the hospital. We have a laboratory that's registered as a Class E facility, ISO certified under KENAS. We have theater services, fully fledged to provide major and minor theater services. As I mentioned, we are also we also provide a platform or a facility that can provide can conduct clinical research. So we are an accredited clinical research center. So allow me just a minute to coordinate with Timothy so that I can give you a small pictorial of the facility. So this morning, we had the privilege to take some of our guests around the hospital, and I can assure you what I am telling you is what they saw, I believe. So I'm not just giving you a presentation, but they are my witnesses. They saw what we are talking about. You found it? Okay. So in the last month, through the support of Dr. Kawango, we have been able to do some little improvements here and there based on the feedback of our clients and also the emergent needs, to have the facility provide the utmost quality services. And so the hospital has a new face. Those who have been to Tungane before, please come again and see. The hospital has a new face, additional facilities that should make your hospital stay, your hospital visit comfortable and successful in terms of successful treatment of whatever brings you to the hospital. So if you could go to the pictorial, please. Yes. So this is basically the front face of the hospital. This is where you come in on my left. Next. 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 So this is a snapshot of the reception. Once you get into the reception, you are, okay, that was fast. But you are received and then going through the processes of triage and everything. You saw the consultation rooms. They were a bit fast, but I hope you got to see a glimpse of them. If there is need for you to go to the laboratory, I think there was a picture of the lab which is able to provide all the basic hematologic, biochemical, immunological tests. We are able to do them there. We don't need to send you anywhere else. If there is need for admission, we have the male ward that has been given a facelift, very comfortable. I believe that my guests this morning can be witnesses. We also have a fully equipped labor and delivery room with all the necessary equipment to ensure safe delivery of the baby and safe outcome of the mother. In case of any need for theater services, we are able to rush the mother straight into theater if there's need for a cesarean section and the rest. For the babies who, from one of my guests this morning, he said that for the little Kenyans who are having a hard time adjusting to life in the country, we have a small newborn unit where we help them gain weight. We help them if they are jaundiced. We are able to provide phototherapy, monitor them closely until they can adjust to the air in Kenya. So in summary, I just want to say that we are ready to receive you, your loved ones, and give them quality services. What we are looking forward to doing now, our next steps, are to build the capacity of the facility to be able to provide go-to maternal and child healthcare services so that all the mothers, whenever they are expecting a new guest, they know that they will come to Tungane and they'll be taken care of. And I know Prof's vision is to be able to put up a state-of-the-art mother and child center beyond Tungane Hospital, where all the services that you can think of, including innovations, can be provided, and this will be a go-to center in the region in the next few years. So otherwise, thank you very much, and sorry about the presentation.
Thank you so much, Dr. Kadima. And even with the technical hitches that we had, you are very graceful. Thank you so much. As she said, she was standing between us and what? And tea. And she made sure she really delivered within a very short time. So we are going to take a break for tea. Winnie there will show us the way out. Kindly, do you want to say something? Okay. Okay.
Hello, how are you doing? It's tea time. I'm requesting the guests to come with me. By guests, I mean everybody is a guest, amen? But I am talking about the guests on the front. So I'm requesting the first two rows. This is a row, the first two rows to come with me, and then the rest of the VIPs will just be directed alongside us. So we are all going down to the lawn behind us here. That's where the tea is served. And we are going to take 20 minutes, and then we'll be right back. And we're asking, especially staff who had not registered, please, outside there, when you come back, the first thing is to register, and then we proceed. Okay. All right, so we have a small change of how we are going to go to the lawn. We're going to use this exit, not the other one, because there's an interview going on the other side. So we are all going to come through this door, and I go with the first 2 rows, and everybody else will follow, will guide. Thank you.
Thank you so much. I have been your MC, Morajen, and I'll be ushering.
Wacha wao waporomoke, majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka, Kenya nchi yenye baraka.
Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo, tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote, mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya, wenye nchi Kenya kipenzi chetu, hatutaiacha milele daima. Wenye nchi Kenya kipenzi chetu, hatutaiacha milele daima.
Ninaimba sio wimbo, ni maombi, nikiomba Mwenyezi Mungu aibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini sisi zote binadamu. Matajiri masikini sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno sio tikiti ya mbinguni. Utajiri majivuno sio tikiti ya mbinguni. Kati yako
pesa tin okoka, funding odok chien pesa tin. But Nyasaye otelonwa, wan pod somehow nwa lose funding 2021 maduong'. But Nyasaye oting'o waketo malo mos mwachopo, kata kineno iye kacha opong' gi jogo mayudo ngima, yudo puonjruok, yudo ang'o, yudo nweng'o, nigi yuto koa kuom impact. Omiyo mane gima go Nyasaye erokamano ni kokadho kuomwa wamiyo jomoko bende ngima gi olokre. And mane ma wan go gi erokamano.
Kono ganda moseloko ngima gi nyalo chopo ganda moro mna reto ganda moro mna ma impact osendiko kata miyo nyalo dolo kumbo kuom higni 20 mokalo.
Omera joma dolo kumbo gi nying impact ng'eny. Ohinga eluf apar, over 10,000 people mwasendiko tich mopogre short term, long term, jomoko nitie mane wachako tiyogo kata pok impact ochakre odonjo impact, wabro neno gi kawuono. Koro joma osedolo kumbo gi nying impact ohingo eluf apar, but ok en dolo kumbo kende. Gitero nyithindgi skul, gibende gimedre somo, joma oseyudo masters, oseyudo PhD, oseyudo bachelor's degree, oseyudo diploma, gisomo gidhi mbele, gi-invest nitie joma ne nigi onge kata ot, sani nigi gorofa, ogero gorofa nikech yuto moa impact. Koro miyo ose-impact the community, and I'm not blowing my own trumpet. Bang' ma koro wadwaro ni higni 20 gi wiye ka jomoko miyowa pesa mondo watigo mondo wakonygo ngima kata afya mar oganda, wago erokamano. To lakini ok ng'ato nyal miyi pesa nyaka chieng'. Ing'eni nyaka chop sama koro be odparo ni nyathi bende no isenyuolo, bende osedhoth, bende isepidhe, koro chopo kama koro be odhi gere simba. Koro wadwaro ni koro mondo ochop kama communities serve mondo bedie self-reliant, ochakie gero simbnigi, ochakie bende yudo timo tije manyalo konyo gi giwegi, manyalo konyo afya gi giwegi, makata kwa yudo kony moa oko, to ok bed ni kony moa oko en 100%, ata malo 100 ani oko te. Obede ni nitie mini wuon inyalo timo kendi, to minyalo golo oko. To kata county governments wa, bende mondo ong'iyare domestic financing kanyalo improve, ok kata county nyaka pesa nyaka national and county ong'iyare domestic financing. Ere kaka ginyalo riwo lwedo gi jokor gweng' mondo wa take charge of our own health.
Moko kuom nyimine kata owete impact research minyalo siemo mosechako chung' kendo dongre.
Maka ng'eny, ibro winjo moko e iye ka. Nitie joma dong mang'eny mosechung' kendgi mosechako gigi ma giwuok makoro gichako. Achiel en ma, ineno mantie mbele kani, ma en staff wa. Sani ochako business kane program mana awacho norumo 2021. To ok obet abeta ni koro orito ni yawa ng'ama nondika. Ong'e ni en gi skill. To skill neno, sani oran gini makata yude ni mondo bi otimnwa gini, tidi ibuke mana in advance, kendo ibuke kata 2 months in advance. Kore koyud thuolo mondo bi okaw gimo kaw nieri. So that is what we are proud of, where people nyalo bedo employed to nitie gima kando, makapo ni employment, nikech sani ng'eni uchumi ok ber. Ka nitie kama odok chien kidogo, to in gi gama inyalo podhi. To gineno ka example ni mbele naka.
Daktari, weche mawachi gi
Koro wan gi board motegno. Board gimomiyo wachopo kama wantie ni. Ok en one person's job, ok en tij ng'ato achiel. Wan gi board motegno moting'o joma motiegre yore mopogre. Yeah, wan gi board moting'o, wan gi pastors, wan gi clergy, wan gi lawyer, wan gi finance people, wan gi jomo hotel hospital, wan gi joma thiring'inye research, wan koda serve youth mang'eny bende nie iwa kanyo. Koro miyo wariwre to rieko magimiyowa gimako lwetwa no emomiyo wachopo kama wachopeni. Erokamano.
Daktari koro chieng' kisechopo kanyo fulunwa joganyena mingi wachnwa ni weche mowachgo inyasero kose kwedo gi nyingi gimoro
Erokamano ahinya. Nyinga en Reverend Dr. Sylvester Odanga, an lecturer University mar Kabianga, kendo an pastor Kisumu, kendo an board member migao miluongo ni Impact Research and Development Organization. Weche ma director Agot Kawango wacho gin adier, kendo an aseng'eyo organization ni nyaka nochakre e higa mar 2003. Aseneno kaka odongo, aseneno challenges mosebedo godo, gik ma giseyuare godo, gik ma gisetemore godo, mago biro aseneno. Kendo aneno ka Nyasaye osekonyowa, omiyo kawuono kwachokore ka wabedo gi nyasi mar bedo migao kuom higni 20, to wan gi gik mang'eny mwanyalo chame nyadhi kendo wanyalo mor godo ma Nyasaye osekonyowa mwachopo nyaka kawuono. Omiyo gik ma jatelo wachogo gin adier kabisa, kendo an kaka board member wasewuotho kodgi ka wamako lwetgi kendo kok waduogi chien mondo gichop kama gintiere nieri. Kamano.
Oteni mogik ne oganda jokanyanam
Mokwongo dagone erokamano maduong' ahinya ne jo Kenya gi jo Kanyanam mantiere counties te ma wasetiyo piny luo, wasetiyo Mabei, Migori, Kisumu nyaka Siaya, to kata mana mokalo kanyo wasetiyo counties 25 kuom counties 47 mantie Kenya ka. Omiyo wagone gi erokamano ahinya kuom tich wasetiyo kodgi maber. Samoro programs mane watimo kuonde ma gintie norumo, to mago norumo nikech samoro funding norumo. To nitiere kuonde ma pod wadhi mbele gitiyo kodgi, wamedo mana rwako mondo wamed tiyo kanyakla. Machielo, sani koro kaka Impact Research Organization waseloso osiptal miluongo ni Tuungani Hospital man gi NHIF accreditation ma waluongo jo Kanyanam gi ji duto mantie Kenya karka mondo bi mondo thiedhi ka in gi kadi mar NHIF idhi thiedhi kendo wan gi rang'iny mamalo, masine madongo malich mapimo remo gi matimo gik moko te minwang'o Nairobi sani wan godo Kisumu ka. Theater wan godo ma is state of the art, the best probably in town with the newest machines and everything ma ng'ato nyalo dwaro. Warwako mondo ubi hospital kanyo mondo wathiedhu. To mogik daher mana ni mondo watiuru kanyakla kamoro amora ma utie gi IRDO, watiuru kanyakla mondo Nyasaye okonyo mondo watiuru kanyakla maber. Erokamano. Erokamano. Encha na wacho ang'o? Thank you. I am Reverend Dr. Sylvester Odanga. I'm a lecturer in the University of Kabianga. I'm a pastor in the city of Kisumu, and I'm also a board member in Impact Research and Development Organization. Today we are celebrating 20 years of existence as an NGO with IRDO. And indeed, God has been good to us, and we can say Ebenezer because God has helped us to reach this far. There is so much that has been achieved by this organization. We have worked in 25 out of the 47 counties in this country. We are currently working in several counties, and so the next thing that I'd wish to say is thank you so much, everyone that you have worked with in whichever county where you have been. Some of you are employees, some of you have been beneficiaries, some of you have been dependents of people that have worked with us in IRDO. Thank you so much for all that. Next, I would also wish to ask you, those with whom we are still working together, let's work together and let's continue supporting one another. Personally, I'm a member of the board of IRDO, and as a board of this organization, we have worked together with IRDO to ensure that they reach where they reach, and we are still committed that we are going to work even beyond this point to make IRDO as great as it possibly can be. The other thing that I would wish to tell every one of us who is listening to me, wherever you are, is that right now, IRDO has opened a state-of-the-art hospital in Kisumu, where we have theater and wards and every kind of treatment. Every part, the laboratory is state-of-the-art with the newest machines. Is a wonderful place. This morning we were actually there to inspect the site as the board, just to see the renovations that have been done of late since we were given NHIF accreditation. And so now, because we have NHIF accreditation as a hospital, anybody with an NHIF card, you can come to Tuungani Hospital and you are going to get the best medical services that some people would have gone to Nairobi for. They are now available in Kisumu, and that is what IRDO is currently offering you wherever you are. Thank you very much. Asante sana.
Kenya weni mama yangu, Kenya weni mama yangu, wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni, wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni, wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Tunajivunia sana tukijiita wa Kenya, nchi yenye baraka. Kenya nchi yenye baraka. Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo. Tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote. Mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya. Wenye nchi Kenya kipenzi chetu, hatutaiacha milele daima. Wenye nchi Kenya kipenzi chetu, hatutaiacha milele daima.
Ninaimba sio wimbo, ni maombi, nikiomba Mwenyezi Mungu aibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini, sisi zote binadamu. Matajiri masikini, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno sio tikiti ya mbinguni. Utajiri majivuno sio tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Kulani zako zazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibie hewa. Wataka kunyamba Kenya we, utuharibie hewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka, Kenya nchi yenye baraka.
Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo, tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote, mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya, wenye nchi
Kenya kipenzi chetu, hatutaiacha milele daima.
wenye nchi
Kenya kipenzi chetu, hatutaiacha milele daima.
Wimbo ninaimba sio wimbo, ni maombi. Nikiomba Mwenyezi Mungu aibariki Kenya yangu. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu nguvu zangu nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu shida zangu ziangalie Kenya yangu. Tabu zangu shida zangu ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini sisi zote binadamu. Matajiri masikini sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu. Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka. Kenya nchi yenye baraka. Tumekomboa Kenya, taifa letu tukufu. Tumebadili mwendo, tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote. Mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya, wenye nchi.
Kenya kipenzi chetu, hatutaiacha milele daima.
Wenye nchi.
Kenya kipenzi chetu, hatutaiacha milele daima.
naomba Mwenyezi Mungu aibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini, sisi zote binadamu. Matajiri masikini, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno sio tikiti ya mbinguni. Utajiri majivuno sio tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Kulani zako zazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni tuweni macho, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka, Kenya nchi yenye baraka.
Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo, tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote, mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya, wenye nchi
Kenya kipenzi chetu, hatutaiacha milele daima.
wenye nchi
Kenya kipenzi chetu, hatutaiacha milele daima.
Wimbo ninaimba sio wimbo, ni maombi, nikiomba Mwenyezi Mungu aibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini, sisi zote binadamu. Matajiri masikini, sisi zote binadamu. Tusahau majivuno na tuache kupayuka, tusahau majivuno na tuache kupayuka. Utajiri majivuno sio tikiti ya mbinguni, utajiri majivuno sio tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Fulani zako zazijua, lengo lako twalijua tu. Fulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya nchi yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
I want to invite you all to the next session. My name is Tobias Odwar. I work with Impact as a Regulatory Affairs Officer. For today, I'm your MC for this moment. I hope you're going to enjoy the next session. We are going to move in this order. For IRDO to have been in place for 20 years, it wasn't a solo journey. It took the effort of other people, collaborators and sponsors for us to walk this journey. And so we want to recognize and invite these individuals who have worked with us this entire moment. And we have the Ministry of Health from various counties, Kisumu County, Siaya County, Busia, Vihiga County. And then we have vendors, those who have provided services to Impact Research and Development Organization. In this case, we have Madison Insurance and the NCBA. After that, we are going to go to current donors with brief speeches. We have AMREF, we have Red Cross Kenya, and then we have the implementing partners, where we have CHS, CHEB, Kiswa, and then we have research institutions that we have collaborated with to include KEMRI, Jaramogi Oginga Odinga University of Science and Technology, as well as Maseno University. After that, we'll have an exhibition of posters and vendors, which will take the last bit of this session, as then we'll take lunch break. Having said that, I want to start with the members of the Ministry of Health, and we have two representatives. From Vihiga County, we have Dr. John Shigali, the Casco Vihiga County. I would want to humbly request you to come and speak to us briefly. And I would, in a humble request, I would request that you use the podium.
Yeah, all protocols observed. Good afternoon. Hamjambo. Hamjambo. IRDO at 20. Yeah, thank you so much. We are here to celebrate quite a good day, IRDO at 20. we are privileged as Vihiga County to have partnered and worked with IRDO, and we are still even working with them up to now. Just a reflection, we started working with IRDO in 2019. Although IRDO was there before in the malaria space, but now in the HIV AIDS space, we started working with them in 2019. Briefly, Vihiga, actually our population is at 616,117. When we started, we had been given a target by the KPSE2 for the FSWs and for the PWIDs. Our targets at that time for the FSWs was at 1940. And I'm glad to say we've actually achieved that target, but we're still working on it because at the moment we are at 1937. For the PWIDs, we were given a target of 552. Currently, we are at 136. We've seen a lot of progress in so many areas supported by IRDO. We've been doing clinical outreaches with them. We've had wellness vans across our sub-counties, which are 5 of them. We've also had support supervisions at the DICE itself. We've been doing the support supervisions. We've been able to do technical working groups at our counties and also advocacy meetings, whereby we are able now to engage with the lawmakers, we are able to engage with other stakeholders on issues of key populations. As you are aware, key populations, as you heard from our beneficiaries, these are programs that initially people were looking down upon them. But because of advocacy and other structural interventions, we've been able to see people coming out and embracing the program. As you know, there's the way people think, key population is a sub-program, but they are part of the general population. And of course, they can have other issues that interfere with their normal life in every day. One of them actually is also HIV and AIDS. If we don't give the interventions, of course, they are one of the vulnerable groups that can easily get HIV and AIDS. So we've had to have interventions for them. We've had to identify and also do testing and identify them. In our county, we are able to support actively 85 female sex workers and put them on care. And we can proudly say between 65 and 70 are already suppressed, which actually reflects to around 82.5 to 85%. For the PWIDs, we are having 4 who are on care, and the 4 are already suppressed. So the suppression rate is at 100% for the PWIDs. When we started for the PWIDs, we thought that our county is one of the counties that don't have the PWIDs. You know what usually the community states? That we cannot have people who inject drugs in our community. But when we were given the targets by NASCO, we thought, no, it cannot be. So we started doing mapping, and we ended up reaching 136 in the county. And the program started, this is 2023, we started in 2022. So it tells you that a community that is anchored in the village has also those kinds of populations. So what are we doing for them? Look at it this way. These are people who, if they are not supported quite well, they inject, they share needles, they even share blood. Because if one of them is not experiencing the high, of course, he can inject and remove blood from the other person and re-inject himself so that he feels the high. So what are we doing? We are giving NSP, the needles and syringes program, so that they are able to inject themselves in the right way, in the safe way. So those modalities have come in because of programming with IRDO. These are not things that you can do alone, but they are things that you have to get support from other stakeholders. One of our beneficiaries, I think from Kisi, stated clearly that they used to get also other problems like with the law. It is true. People assume a lot, and people take our key populations for granted. If they are not supported, you'll find them having issues with the law every now and then. But because of the advocacies that we are having and the engagements, of course the police officers, the law enforcers, the judiciary have been brought in, and they can be able to now understand what kind of populations we are dealing with. And they, you know, like for a peweed, you can easily say this is a drug peddler if you're not able to understand this person. So we are able to have discussions with them and have that one-on-one talk for them to understand where we are coming from. So, having said that, we've not been without challenges. Challenges are there. And the challenges that we experience a lot are usually not our own making. Sometimes it is a making from another quarter. One of them was actually commodity stockouts. This was not only in Vihiga, but all over the country. We had commodity stockouts, especially on testings, the RTKs. Those were challenges that were experienced all over. We also had challenges with condoms. And I know even up to now, we still have pockets of areas that are still having condom stockouts. These are some of the mechanisms that are actually hindering service provision. For HIV and AIDS, if you don't have preventive measures, we'll be exposing our beneficiaries to more harm than what we are doing to give them support. So the strengths are also there. We have a lot of strength that we can speak about. We have integration of facilities between our diocese and the health facilities that we have. Our beneficiaries can report that they can be able to get services from the mainstream government of Kenya services facilities. Collaboration with stakeholders, that is one key area that if you want to succeed, you have to involve all the stakeholders. Information is power. If people are not informed about a population that is in your region, of course there'll be challenges. Religion is one thing that can cause a challenge. If we don't involve our religious sectors, we'll have challenges. So we have to bring them on board. We have to bring in the law enforcers on board. Education, the education sector, very key. Because this type of population is with us, even in our schools. If we don't bring them in, we'll have a lot of challenges. So we have those stakeholder engagements and collaboration with them. Then political goodwill, of course, as a county. If we don't support the programs that we have, the programs cannot thrive and we cannot be able to assist our beneficiaries. And then lastly, I think, is the timely planning of activities and events that we have in the county, collaboratively with our partners. This is one thing that I would want to say has been one of our highlights, because we plan as a program, we plan for the outreaches, we plan for the engagements in the vans, we plan even for the support supervisions in our diocese. So it is one of the elements that has enabled us to pick and move quite ahead. Si niseme asanteni. Na tusherekee. I would wish all of us a happy anniversary. Thank you so much.
Thank you, sir. For the next presenters, I would not want to interrupt your speech, but I'll lift my notebook twice. The first one, it will just notify you that you need to think about winding up. The second time, I would be walking towards the podium. Thank you. So we're going to have a member from the MOH Siaya County, Mary Wambura, who is the County TB and Lung Diseases Coordinator, to give us a speech.
Good morning, everyone. My name is Mary Wambura. I coordinate tuberculosis and leprosy activities in Siaya County. I want to take this opportunity to thank IRDO for being a great warrior in taking care of TB in the community in Siaya County. This is, I think, the third round of the grant when we are with them, and we really appreciate the work that they do. Working with people at times is a challenge for many, many, many programs. But for IRDO, we appreciate. You bring us staff who are really understanding. You bring us even the accountants who understand the situations at home, and everything is done on time. We really appreciate you. Main things that are supported by IRDO are defaulter tracing. Those whom we initiate on TB treatment at times, they are interrupters. They support us in bringing them back to treatment. Contact screening, those who are bacteriologically confirmed, we need to trace their contacts, bring on board, screen for TB. We initiate those who are not having TB onto TPT, and this has really assisted us in improving on TPT uptake within our facilities. They also had some link assistance. This was on a request. After a long time of struggle in the county with staff shortage, when they brought in link assistance, they support us in doing triaging, they support us in doing health education and separating the coffers. Then they escort them to where they are supposed to be, producing sputum. This has really made Siaya to be excelling, and for the past 2 years, we are the best county in increasing number of TB cases. We really appreciate the fact that they are supporting X-rays. It has been a challenge. Siaya is among the counties that are considered poor. It is in the public. You can diagnose clinically, but you would want a support, like for X-ray. They are supporting 0 to 14 years with X-ray. They are waived, and this brought in the uptake of pediatric TB. Initially, we were doing 7%, 6%, but as per 2022 to 2023, we have achieved 12.6% children diagnosis. At times on request, when reshuffling have been done, we understand counties. We do a lot of reshuffling. Those who are working in high volume facilities taken to low volume. At times we always request for extension of support for support supervision. They really come in handy. We really thank IRDO for this. I know they stretch a lot because it is not under their mandate, but with the savings that they have, when we discuss, they really support us a lot. And with all the support that they have given us, we have experienced great improvement in treatment success rate and cure rates. we are doing 91% concurrently. Why did I say it is the support from the community? They have assisted us to reduce mortality, because patients coming, they default, they go back, rest at home. Before you bring them on board, there is no one who will think of coming to the facility. But with IRDO supporting us to go bring them back, they go on with the treatment, and default rate is below 2%. So thank you, and we are really happy to continue working with you as a team. Asanteni.
Let's give another round of applause. A good one. I've not heard you. I've not heard you. Thank you. So before I call the next MOH representative, I just want to confirm if there is a representative from Busia County MOH. None. Someone is waving. There's none. So we'll move. I want to invite representative from the MOH Kisumu County, Dr. Lucy, to come. Okay. Okay, thank you for that bit. I want to invite Mike, who will take us through that session in a very quick moment. The two vendors we have are Madison and NCBA.
As Mike is coming, there's one thing that I forgot. Allow me 1 second to mention that when I talked about Ray, that we build capacity of young people from ground zero to get their work done, submitted, get all the national approvals until where we are, I wanted to pay special tribute to two people. I don't know whether Nicholas Kipkuru is here. Nicholas Kipkuru, Ebu stand. That he's ahead of everybody. His paper is published in international journal. Come and wave to people here. Waone uso, kuja. Yeah, so he applied. He works in Nairobi. He works with Kemri. Yeah, he works with Kemri, works in Nairobi. And he started from the beginning, and he has reached where many academicians wish they would reach, right? I'm talking to the two academicians here. So just say one word. And then Ada.
Good afternoon. So it's a quite privileged moment to be here, and I want to thank Dr. Kawango for the opportunity he gave me through the Ray conference. Actually, it's through the Ray that I've been able to go to US. So I got some network through University of Washington, and I have a mentor who's been supporting me for a long time. So probably next year, I'll be able to get a scholarship and do some master's course. So thank you, Ray, for all the things.
Yeah, so he went to Chicago, everything paid for. Huh? So please, you're a clinical officer or nursing officer? Yeah, he's a nursing officer at Kemri, but really, really great. So, but she is special. You heard when I said there was somebody who didn't even know the keyboard. The first time alishika keyboard. This one here. The very first, but she had an idea. And actually, that idea is what gave birth to the Jitegeme that we're talking about. So don't think that you can only learn from Kawango. Kawango can learn from you. We learned from her. And I'll just say kidogo.
Thank you. Good afternoon, everyone. I'm Achungu Cheng Linet, preferred name Ada. I'm a female sex worker by profession. So my main... That is a profession. I started the sex works in the year 2008 till to date. My main topic was saving for a rainy day. as the female sex workers, there are so many challenges that we do go through. At a time when we go to the field, we have sex with men. Those men are men whom we doesn't fall in love with, but we have sex with them because we need money. And there's so many risks that we get involved in. One is HIV infection, unwanted pregnancy, and the STIs. And sometimes we end up dying at the field. So when we save, it can help us so that we don't get involved in those activities. So that's why we came with the topic. I'm just a class 8 leaver. Before, I haven't touched a laptop or a computer, so I didn't know how to operate it. So when I get a call after sharing with Winnie, so I say, hey, I've never touched a laptop, so I had to look for somebody to help me. So I went around looking for people. At long last, I got my brother Gerald. He was willing to help me. So I brought the ideas, and he was there to help me so that we could walk all the way through up to the moment where we finish. I say thank you, Mama Winnie and Gerald. Thanks so much.
And one thing about her data, she has the cleanest data of everybody that did quantitative work. We have data from masters, people that we can't even know whether there's a head or a tail. But she has data that is clean. And so we want to tell everybody here, my friend, uko nyuma, ako wapi? What was the name again? Yeah, si unaona? So she is a researcher, she's a sex worker, she's a peer educator, and she's here. So the sky is the limit. Thank you. Okay, and Gerald, we thank her for bringing Gerald, because we wouldn't have known Gerald, but they were looking for somebody who could help her. And then somebody linked her to this gentleman. This gentleman has taken Ray by storm. And everybody has supported them to write proposals, to turn their concepts into proposals, to get the approvals, and to get everything. Remember I mentioned that there's one that has got, is one of the 7 people in the whole continent that has got Zimbabwe UNICEF. Ni huyu jamaa. So just read people.
Habari yenu. So what do I tell them? So Prof has caught me by surprise. There's nothing much to say other than, the love of working with young people, supporting your fellow peers to bring them at the center of, making an impact towards the things that affect them, the challenges that they go through. Thank you.
And he has mentored more people than I have. He is good with mentorship, but he takes it overboard sometimes anakufanyia. But thank you. He is one person that I'm really, really proud of.
Over to you, Mike.
Thank you, Tobias. Thanks, Prof. Good afternoon, everyone. My name is Mike Ogera. I serve impact research in finance as the head of finance. And perhaps the biggest highlight of this morning for me is I never knew that an accountant would appreciate an accountant. Accountants are always the bad guys in the room. So thank you. The MOH representative for CI Accounting mentioned accountants for once ever since I began working. Asante sana. Thank you. I want to move very quickly in the interest of time to invite our corporate partners, the ones who have been with us in this journey for the longest. I'll begin with NCBA Bank, one of our major bankers. I'll invite Mark Kiema, the branch manager, Kisumu, to give his remarks. And Mark, allow me to stand next to you because we all know what happens when you give a microphone to a good marketer.
Okay, with all protocols observed, good afternoon, everyone. So my good names, as mentioned by my good friend here, is Mark Kiema. Promise I won't be a marketer right now. A lot of stories have been shared here that have really touched me, that even the cells in me have actually gone out. So with me are two colleagues, maybe Irene and Edward, you can come near. So first of all, thank you for inviting us, and it's a pleasure celebrating 20 years of impact research. We've been your partners, I think, for the last 10 years of that period. So it was very key for us to come and celebrate this moment with you guys. So with me here is Irene Omari. She's the Assistant General Manager in Commercial Banking. She's also the contact person for impact research. So Irene will share a little bit of what we have for you guys. Then we have Edward Wawire. He's our regional sales manager for Western region. So Western comes, it's actually Nanyuki all the way to Busia. So he has a very big area to manage. So I'll invite them to share very briefly on the products that we have with us today. So I can start with Irene, ladies first.
Thank you very much, Mark. All protocols observed, and thank you for having us here today. I wanted to say a greeting on the celebration today, and if you could just follow with me, just to have it a celebratory mood. So if I say impact at 20, you say go for it. Okay, that's our NCBA brand, and that's why I'm saying. So that's my greeting today. Sawa. Sawa. Impact at 20. Impact at 20. Thank you very much. So we are running a campaign at NCBA Bank, and I thought it's good that we share this with you because I know most of you are not banking with us, and we would want to invite you to bank with us. So not to take a lot of your time, we are running a campaign on a fixed deposits where we can be able to give you fixed deposits at a rate of 14.5% for a whole year for a minimum of 1 million shillings. So if you have 1 million shillings today, you can be able to get a rate of 14.5. You cannot get that in any market today. I was telling Doc that that's the rate we are offering between October to December. So, and if you have 100,000 today, you're able to get an interest of up to 10%, 12 months. I've just put it there. I don't want to go through it. And if you have 500, you can get 11. If you have 1 million, you can get 11.5. So we're also running another campaign for the accounts. So if today you walk into our branches and open an account as anyone, you're able to get a merchandise of 500 shillings, okay? You deposit 5,000 shillings, you're able to get a merchandise of 500. Secondly, we have another one where if you come and open a new account and you're able to do 100,000 shillings deposit, you will be able to get a winning prize of up to 80,000 shillings. Okay. So if you go back and you're able to deposit with us money on a fixed deposit account, if you put money in your fixed deposit account, you're also running a campaign whereby at the end of December, you'll be able to win up to 1 million shillings. So you may put 1 million shillings, and at the end of December, you're able to get another 1 million shillings. So what I'm trying to say this morning is NCBA is giving you a very good investment option for you who is earning up to less of 20,000, 30,000 shillings monthly. You're able to invest into NCBA Bank, and we will be able to get you also very good advisors who are able to advise you on your monies or on whatever you're going to deposit. I know Mike is looking at me, but I felt it's important to say this. Thank you very much, Mike.
Thank you, NCBA team. I'll invite you to their stand so that they'll be able to showcase much more in the interest of time. Or do we? 1 minute.
Good afternoon, everybody. Thank you for inviting us to this event, and IRDO, we really thank you for partnering with us. You know, we are one of your bankers. For me, as my colleague introduced me, I take care of the region, and I do sales. So for me, what I would like just to mention, I know most of us here, we have salaries, or we are also in business. So what maybe I can just challenge you, that little that you earn, that little that you get from the business, we usually support our customers in terms of acquiring properties. It can be a property, a house, a plot, or even the vehicles. So we do that, and because of in the interest of time, we have a tent here, and we invite you so that we can take you through our products that we offer. Thank you so much.
Santeni sana NCBA, you forgot to mention that we are a very demanding client. We call you up to 10 p.m. But thank you for your support, we appreciate. And next is the Madison team. I would want to ask John and Maurice.
All protocols observed. Good afternoon. As you've been told, my name is John Obare from Madison Insurance. Madison is basically a group, and so we are a big team here today. I'll quickly go into introducing the team members before we run through some quick slides on who we are as Madison. So my name is John Obare. I'll ask my colleagues to say his names and introduce the other members.
God is good. My name is Masiaga Morris. We have a big team, but mention is our branch manager who is around. Kodek. They can mention their names as we continue.
Bwana asifiwe. Asifiwe Mwokozi. Kwa jina la Yesu nimeokoka. Asanteni. It's good to be here, actually. My name is Clement Kodek, Madison, branch manager GIB. We have the life section and the general section. And to run the branch, you also need people to assist you to be doing the running. And I have my two colleagues here also. I'll give them also, they mention their names so that you can hear their voice. And please, make sure you take their contacts, you also interact. So that if you have any issue with Madison, there's something you need to know about our product and so on, you can be assisted. Thank you.
Good afternoon. Edwin Lumumba, Madison, Kisumu branch. Thank you.
Good afternoon. My name is Mtome David. I handle SME and individual healthcare. Thank you for your time.
So thank you so much. I'll ask my colleagues to go and sit. In the interest of time, we want to move very fast. I want to quickly go through a slide of who we are as Madison. So basically, as I said, Madison is a group. We are made up of three major companies. The first one is Madison Life Assurance. And then we have Madison Investment Managers. Then we have Madison General. So basically, we began our operations, our investment company began operations in 2001. So basically what the company does, invest money on behalf of our customers. Then we have, let's move to the next slide. And then we have Madison Life Assurance. My colleague will talk about Madison Life Assurance. Basically, they deal into insurance of lives, savings, education policies. I think my colleague will talk about it. Madison General is basically dealing with what's called property insurance. Under property insurance, we have insurance for, just move, because of time, I don't want to go through this. So basically, we are represented in all those towns as Madison General. We are operating in Nairobi, we are in Western, we are in Central, and we are also in Coast Province. We are financially very solid, as you can see. Our gross premium income in 2022 was about 7 billion. Those are reinsurers. When we insure, we also have to reinsure to make sure that we are well backed up. Those are some of the products that we offer. Fire insurance, burglary insurance. When a fire burns your property, you don't jump into the property because you want to save it. You just come to Madison. You tell them, unfortunately, my property was burned by fire. Please, can you assist me? Just go back slightly. Go back slightly. We have burglaries, basically theft. Your property can be stolen. Madison insures what is called theft insurance. We offer work insurance benefits insurance. It's a requirement by law. We have motor vehicle insurance, both commercial, private vehicles. Madison does that insurance. We have personal accident insurance. We have contractors insurance. Marine insurance, we do offer both hull and cargo. We have travel insurance. When some of you are traveling out of the country, it's a requirement for some of these countries you go to. They ask you to go get a medical insurance. It's basically a travel insurance. Talk to us. We'll be able to arrange a travel insurance for you. We also have professional indemnity and medical insurance, which most of you are familiar with, because we partner with you there. So again, many thanks for this invitation, and many thanks for what you're doing to serve the community, and you've been doing it for the last 20 years. We want to thank you most sincerely. I want to ask my colleague just to briefly talk about life insurance.
Thank you so much. My name is Masiaga Morris, Regional Manager in charge of life. So you can see that person running there. His life is in danger, and is being followed by a big animal. And that animal are rents that we pay. That animal are school fee that we are supposed to pay. That animal are the bills that we are paying. And that's why there's need to do something about your finances. Next. We are here as Madison Life to give you peace of mind and also to protect your family because you love them. We also assist you to save. Some of us are very, very pressed with the work that we do that you don't have time to invest. We'll invest on your behalf, and you'll see we give you guaranteed returns. Next. Besides saving and investment that we do in other places, as insurance, we again take care of you when you are critically ill. When you are critically ill, we'll pay for you and the hospital bills at a given percentage and also take care of your insurance cover. When you become disabled, we take care of your investment. When you die, we also ensure that the people whom you love that have remained live in peace. Next. The power of financial freedom, it is not an accident. It is a journey, and that's why we are here today as Madison, so that we can move with you the journey together. Next. It is all about priorities. Those people who have succeeded, they succeed because they have set their priorities right. And setting priorities, you need a professional. And that's why where insurance is where you can get financial advisors. Our work is to help you set your financial priorities right so that you get it right. Next. Next. There are things, we are talking about finances, that when you are planning finances, you should plan as if you were born alone. Don't plan with somebody else. I know people who are in houses, you can plan with your husband. You can see the DCI officer. This happened just the other day. If you planned with such a person, anaenda anajipiga na bunduki anakufa, and you thought is the person to take care of your child's school fee, you are dead the first day. And that's why as we plan as if you were born alone. Next. You can see that is head teacher of Mbale. Next. Who died. Most of us know him. So don't plan with any other person. Next. We are talking about school because we are here because we went to school. It's very expensive. And that's why, as Madison, we are saying, give us your kids. We ensure that they further their studies to the level that they can without stress, without going for bank loans. We have Bimayakaro. If you put a child, you will go to school whether you are there or not. And we'll ensure that we minimize your burden for schooling because we do business with this money, it earns you interest. We give you statement each and every year showing how your account is growing. Next. Lastly, as I finish, we also say people who are working, why should you pay rent for more than 10 years and you are working and you are earning salary? As Madison, we have brought a program called Uniplan. Go to the next. Uniplan that will ensure that you work for 5 years. Then you are able to buy a plot and build. Don't build for people houses, and yet you can build your own. We have a program for that, and you can see it gives you guaranteed returns, and it also caters for critical illness and all those other things. And in 5 years' time, say, work for 5 years, this is what I've done. So we have financial advisors all around for Madison, and these are areas that we have to think wisely. And that's why we are saying life is all about priorities. How you set your priority right, if you set them right, then you are able to get it right. Next. So you can see as you join the Uniplan, in case you lose anybody in the family, we are able to give you 200,000 for burial expenditures. Because any investment we aid you to do, we don't want it to be interfered with any death in the family. So we do that one also as Madison. Next. Tunataka pesa ikushike hivyo. And that's why we are here today, so that the little amount that you earn can be magnified so that you swim in money. So thank you very much. We have a tent there. If you want to know more about our products, you can engage our financial advisors. Thank you.
Asante sana. Thank you. To the last second. So next is representatives from our current donors, those who have trusted us with their finances for us to be able to support the communities that we work with. These are those people that when you see their calls, you delay picking it and ask yourself whether there is something you may not have sent. So allow me to, at this point, invite representatives from AMREF Health Africa who are funding our two programs, Global Fund Malaria and Global Fund TB. I'll begin with Dr. Dennis Wanyama. Kindly come make your remarks.
Good afternoon, colleagues, and big congratulations for achieving your 20 years anniversary. I was speaking to my colleague, Dr. Ann, because AMREF, we've done, I think we're in 60-something. So when we hit 60 years, I really don't remember AMREF doing something like this. So we are challenged positively, and we'll definitely take this back when I go back to the office. So all protocols observed. I want to thank IRDO, Dr. Kawango. I'm meeting you for the first time, and I'm impressed with the team that you have, the passion that you have, and I'll really hope that the team that you're managing are able to take this going forward. So as AMREF, you've been told that we support IRDO with the TB and malaria grants, and you've had the good results that have been shared by the program manager. I noted great success when she kept on sharing the feedback, and we are happy that when your small brother does well, you as a big brother also does well. So the success that IRDO has also reflects the same to AMREF, and I want to encourage you to keep this up. When you shine, we also shine. So big congratulations to all you, and also for supporting the counties The stories that they've shared with us are very positive, and we are happy that we're able to touch the community at that level. So I'll want to end it there. Just once again to congratulate Daktari for the great job, and wish you all a happy anniversary. Thank you.
Thank you, Daktari, for being brief. Dr. Ann Kirubu. Kindly.
All protocols observed. Good afternoon, all. My name is Ann Kerubo, and I am very happy to be here this afternoon. I am very impressed by what you are able to do. As IRDO, we have been supporting you throughout the various grants that were discussed today in the morning. And for me, I'm just here to say congratulations for the work that you are doing, and even for the work that you are yet to do, because I know there are great things ahead of you. Amen? Thank you.
Thank you, Daktari. Next, I want to move on to the Kenya Red Cross Society, who are funding our Global Fund HIV program across 6 counties. I'm going to first inquire whether the West Kenya region is represented. Ishmael? Okay, I'm told he sent his apologies. In that case, then I will invite the program coordinator for the North Rift region, Franklin Ochieng. Frank is one of us. We lay some bit of claim to him, but when he calls nowadays, we tremble. Karibu, Frank.
How do you do, my friend? I know sometimes
Jambo, how are you doing? Yeah, thank you very much. My name is Franklin Ochieng. I work for Kenya Red Cross. I coordinate Global Fund HIV grant in North Rift. It's kind of hard, but let me start by appreciating all protocols. Thank you very much. Thank you, Prof. I don't know whether to speak as a donor representative or as a beneficiary. Yes, we are talking about 20 years of impact. So it's best we put it as impact celebrating 20 years of impact. Yes, and I also have a claim in that celebration. I also share the 20 years, right from the dusty roads of Osieko Beach to where I am now. Thank you very much, and I thank IRDO family. Looking at this and looking at the celebration and even listening to the theme in the house, it's clear. Like you used to say then that IRDO is a training school. And listening to the speakers, listening to the abstracts, listening to the opportunities, it's clear that when we are talking about HIV programming, when we are talking about TB programming, when we are talking about malaria, and all these other components of programming, and the books are written and the records are captured, I'm very sure that IRDO is going to be on top or in the front pages of that discussion, because it can never be complete without mentioning of impact. And I'm glad that we have an opportunity to be able to just appreciate how far we've come, and also to be able to listen into how best we are ready to even proceed forward. So mine is to thank the organization. They usually say, this far the Lord has brought us. But most importantly is to listen to the opportunities when we look at the research components and even prepare ourselves that the future is brighter. So thank you very much for allowing us to be able, because this is where I started my journey. And I know almost 70% of those who are seated here are able to remember how we used to. Where's Jesse? Oh, he stepped out. Yes, I used to be told the stories about Jesse, how he used to ride in the deep villages with a motorcycle, with a bicycle, doing the mobilization, and I used to admire some of his cars. Akikuja na Prada, and then I'm told, do you know where he started from? And that is the story, and that is the journey. But I'm glad that as a family, we are able to sit together to look at how far we've come, but also to prepare ourselves for the future. And there is no any other better way to do that, but also to listen to the simple stories that all of us have been telling today. To Prof, back in my village, or for greater African context, we usually tell the story or celebrate people. Where do we celebrate people mostly? Where? Yes. I'm glad that for us today and everybody seated here, we have an opportunity for your stewardship and leadership that you've offered to all of us, that we are able to appreciate that as IRDO family. And thank you very much. Now as the donor representative. Yeah, so we are glad to partner with the IRDO. We support key population program. We support all other modules, and I listen to the county representative also giving components of the modules that are supported under HIV grant, supported by Global Fund. I coordinate the programs in North Rift region. And when it comes to performance, when it comes to issues of finance, absorption, and all those other components, I usually tell the team that when it comes to implementation for IRDO, we should be worrying about other things. We cannot be worrying about performance, because you've been in this game more than anybody else. So when we are looking at your performance, we know that no one can do it any better than IRDO. And that is why we are glad that we've partnered with you. We are coming to the end of this cycle. We are preparing ourselves for the next cycle 7, GC7. And if given opportunity, of course, with IRDO on the table, we are looking for those opportunities so that we are able to even expand the scope, to be able to share the story, to be able to lead the way, so that when they see IRDO presentation, when they see IRDO on the table, then they are able to listen and learn. Thank you very much, and God bless you.
How are you, my friend?
Thank you, Franklin. I know I have Dr. Kawango's permission when I say we are ready to work with you in the next funding cycle. Thank you. So next, very quickly, is to also recognize the implementing partners that we've been working with over the 20-year period. I will begin by inviting a representative from the Center for Health Solutions, Linda Otieno. Kindly come and give your remarks.
I know sometimes you be like say, nobody sent you, that's what I like, I care for you, my
friend. Happy anniversary. Happy anniversary. It should be a joyful time. We thank God that this far He has brought you. My name is Linda Otieno. I'm standing on behalf of Dr. Kataka, our project director, and the CEO, Dr. Paul Wekesa. They sent their congratulatory message. Congratulations and happy anniversary. All protocols observed. I would love to thank our IRDO. Ndio kusema IRD, kuna vile R na D inapotea katikati, si ndio? So, we are beneficiaries of what impact has impacted in Siaya County. They handed over a project for key and vulnerable population in this final grant that we are currently running. And we thank you for the foundation that you laid, because it has helped us take the program to the next level. Thank you for the work that you did. We also handed over the Dreams program, and we are loving working with those girls. And thank you again for the foundation that you've laid. As we sit here today to celebrate these 2 decades of a job well done, of impacting lives. And as I was seated next to Dr. Kerubo, I was telling her, today should have just been about those beneficiaries. I've heard beautiful stories today. And one that has really touched my heart, I love working with the youths. And when I heard you can actually help someone, you know that thing of from zero to grace, I have seen it with my own eyes today. And I thank you for the job that you're doing to impact the lives of the youth, especially in this country. Because we know the youth need an opportunity. All they need is an opportunity and someone to hold their hand to make them become the person that they need to be. Because life is hard. Isn't it? Life is hard and people go through a lot. You know, we can no longer say mental health is a thing of the Western. It is here in Africa with us. And we can see our young people suffering a lot because of that. But I love the way we are actually bringing them to the table. We are no longer making them the meal that we eat on the table. We are bringing them to the table. And thank you for showing us the way of how actually to involve the young people to become what they should be. So that when we finally retire, we can lay at home peacefully, knowing that there is someone somewhere who actually knows what they need to do, and they will do it well. For the impact you're having, I love the impact is celebrating 20 years of impact. You have actually impacted lives.
Thank you, Linda. We now move on very quickly to CHEB. CHEB mtanisamea. The long version is always a problem. So Dr. Anita Nyabiage, karibu.
All protocols observed. Good afternoon. Happy anniversary. Thank you so much. My name's Dr. Anita Bisera. Nyabiagi is also my name. And I'm the program director for CHEB, Education and Biosecurity, Kenya. And we are CHEB Kenya. For Kisumu and Migori, we are called CHEB Entrench. Before I say so much, I'm accompanied by a colleague who is our health systems strengthening officer. Lillian, kindly stand and wave. Yes, thank you so much. She's Lillian Kongani. I know she has interacted with so many of you, and currently she's serving at CHEB, also helping us with the stakeholder engagement and occasions like this. So for CHEB, we do a lot of work in this country in terms of HIV prevention, care and treatment. We are in Nairobi, we are in Lower Eastern, and we are in Kisumu and Migori. The other thing that CHEB does is also in vaccinations. I heard from the presentation for programs, I heard IRDO is also doing a lot in terms of the Chanjo platform and also several other studies. So we are glad that we are part of this celebration, because I know in several ways IRDO has really contributed to our achievements as CHEB. For instance, with the community services, including getting the mothers to come to the clinics, tracing for us the TB clients, tracing for us the other clients that default from care. We are really grateful for that. And we're looking forward to continuously partnering with you so that we even impact better or more in this society, because it's not by mistake that you are impact research. It's God's intention that you are able to be part of that organization and that you are going to impact positively in the communities that we serve in. And as we partner, we know we will achieve better. So congratulations and happy anniversary.
Asante sana daktari. This last one, among implementing partners, is one that we also lay a very big claim to. About what, Dorothy? 60%? So allow me introduce the Executive Director, Kiswa, to also give her remarks.
Toi t'es bon qu'à planer, ouais je sens ta sème, j'ai l'avocat. Entre nous y'a un fossé, toi t'es bon qu'à faire la mala. Bébé du sale, allo, 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 $1 million.
Happy anniversary. Frank said that we are celebrating the 20 years of impact. I'm part of the impact that people are celebrating. So my name is Dorothy Agala, known as Doti. I'm a female sex worker, a product of Dr. Kawango. Actually, when I first joined Impact, it's when Jesse came to the beach, along the beach, when it was still called MAPS. And he met me at one of the hotspots. And the first person to interview me to work as a peer educator or an outreach worker was Daktari. So from zero to grace. So we are the evidence that there is impact. Actually, I worked with IRDO for 8 years in the KP programming. And I learned. She's a mentor. I saw the gap. We were doing biomedical and behavioral and structural, but there was a gap in the structural, and I ran with the gap, and we started Kisumu Sex Workers Alliance in 2014. So I learned from her, and she would tell me, Doti, you are a go-getter, and I took it positively. So in 2014, Kiswa was formally formed at IRDO DICE at Naselica offices. That is where we sat with sex workers and started and said, now this issue of GBV, violence against sex workers and advocacy, we can do it to complement what IRDO is doing. And that is how it started. And our first support, actually IRDO was our first donor. IRDO paid for participants' transport for a convening at 500 shillings, and we had 100 sex workers convening. So IRDO was our first donor as Kisumu Sex Workers Alliance. Thank you very much, Daktari. What I know with Daktari, she value partnership. Angali wewe ni nani, umetoka wapi, umesoma ama hujasoma, you are a sex worker or you are who. She value partnership, and I appreciate her for that. She still writes an email. Siku hizi apigi simu. She writes an official email to me, and I say, hey, Daktari, umeyeka juu. So when she wants to do the studies with the sex workers, she recognizes there is Kisumu Sex Workers Alliance. And she requests for support letter. And we do support letters. And we are part of the co-creation of most of the studies, like Jitegeme. I tell her, Daktari, this one we can do this. This one is the experience that we have as sex workers. You can do it this better. So she values partnerships. She calls us on the table. And at one point, we had a program. There was a report from NASCOP that said that there were young girls engaging in sex work, and the number in Kisumu was around 300 and something. And so we were doing some scoping exercise as Kiswa. We wanted to know what are the factors that are making young girls to engage in sex work. And so we sat down with the young sex workers, we did some study, and we got, and so we were telling them, given 30 minutes, what would you want to do? 3 of them said would get an employment. And so we approached Daktari. And 4 of these girls are employed at IRDO. Fauzia wave. We have Fauzia, we have Nat, we have Laura. So anytime the government is telling Kiswa, you are recruiting young sex workers, we tell them no, and we have evidence. Some of us are linked to employment, those who want. We have 3 who are doing their 4th form papers this year, who are taken back to school immediately after class 8, and they joined sex work. So it's an evidence that we tell everyone we are not recruiting sex workers, but we give them other opportunities if they want. Thank you, Daktari, for absorbing Fauzia, Nat, and Laura. Thank you very much. I really celebrate impacts with a lot of joy, And IRDO, through KPIF funding, strengthened our systems as an organization. That one I cannot forget. They had a KPIF fund, which they worked with Kiswa, and our systems are one of the best when we look at the KP-led CSOs because of IRDO na kazi ya finance person. Angekuja angalia zile finance policies na HR policies na procurement policies za Kiswa na make sure they are good. We have the best policies. And that's why I think we have a sub-award with CHS, CDC sub-award in Siaya to implement KP programming. And we have a MOU engagement with CHEB to implement young sex workers program, the whole cascade in Kisumu. And we are working, IRDO left us in 2 sub-counties in Homa Bay. Currently, we are in all sub-counties with LVCT. So I really celebrate IRDO, and I want to wish you all the best and happy anniversary. Thank you so much.
Asante sana Dorothy. I know I may have pushed you a little, PIF, but it was for good in terms of system strengthening. So asante sana. Next we move on to collaborating research institutions. I want to recognize KEMRI and ask Imelda Wahungu to please come forward and give her remarks.
Good afternoon, everyone. Good afternoon. Happy anniversary. My name, as you have been told, is Imelda Wahungu. I'm here on behalf of Dr. Marisiana KEMRI and RCTP, which stands for Research Care Training Program, which is a project under the Center for Microbiology Research, KEMRI. We are based at Lumumba Sub-County Hospital and another center called Kargeno Research Hub. Mostly what we do is conducting clinical trials, implementation science, and behavioral research. And so I'll go straight ahead to just read Dr. Marisiana's speech for the day. Ladies and gentlemen, thank you all for this opportunity to celebrate with you this auspicious day. 20 years is no mean feat. A 20-year-old in our society is ready to leave the nest or already has. It has been beautiful watching you grow and transition from back in the program days to research and yonder. This site has lived up to its name, Impact. I cannot pretend to know your history more than you do, but I would like to mention the memorable impact that you have made on health. As a site, you have been known for spearheading the HIV pandemic control in the entire region. Voluntary male medical circumcision cannot be mentioned without IRDO coming to mind. Your impact on the control of malaria and tuberculosis has also been felt. Your work with key populations, adolescents, and young adults, you have played a major role in influencing policies and in turn revolutionizing medicine, and for that, congratulations. I'd also like to congratulate the site for coming in strongly into clinical research, having had the pleasant opportunity to collaborate in the solidarity vaccine trials that we both are a part. I would like to say that you have come in strongly and boldly. This site is known for the quality of data, which, needless to say, is the epitome of research. Meeting targets and dignity in handling participants. This is an indication of a site that is mature and willing to grow and develop. We are privileged to call you our neighbors. We hope to get more opportunities to interact with the site in more studies. The goal is always to advance knowledge, to impact health, and improve lives. Keep up the good work. The facility is growing at a fast pace. The inclusion of healthcare delivery will reinvent the site to an all-round site with experience in all aspects of healthcare, which is the ultimate role. I challenge each one of you to continue putting in work with dignity and pride. The future is bright beyond what you can fathom. I see it. Prof. Kawango, your leadership is felt and admired across the board. Your consistency in what you do, I believe, has played a huge role in the success we are celebrating today. To the staff and management, keep watering your grass and see it continue to bloom. As with growth, there will be different challenges at different times, but I assure you that you have proven and continue to prove that you are up to the task. Thank you. Happy anniversary.
Thank you, Imelda. Next, we move on to Ramogi Oginga Odinga University of Science and Technology. I think I need to go back to school. When I was in school, it used to be Deputy Vice Chancellor. I'm told it's Assistant Vice Chancellor, Professor Dennis Ochuotho. Karibu.
EMU Records. Prince Inda. Nabahati tena. Mrs.
Thank you so much, first for the invitation. And at this stage, may I wish you a happy 20th anniversary. I'm sure when you celebrate an anniversary, you are also celebrating a birthday, isn't it? I lived in a system where when you celebrate a birthday, then a bucket full of cold water is prepared. And so on my request, please prepare that, a bucket full of water, and immediately after lunch, pour it on Professor Kawango on my behalf. I will be there to witness. So all protocols observed, I'm very privileged to stand here before you just to join you in the celebrations. I'm not just joining you alone, but I'm joining you as Joost. So Joost is here celebrating with you. As I walked in, the one thing that I recognized was that we have a lot of similarities with Impact, in that there was a lot of youth inside here. And my life is a life that is tied to youth all the time. And so I felt very much at home being with the youth. So this is one characteristic that we share, and I congratulate you for that. The one element you mentioned when we were talking outside and also here is that the quality of data that one of your candidates had was better than what some master students show. But on the other hand, I also want to tell you that one of your board members is an alumni of Joost. That means a Joost master student will have the same or even better quality of data. So that's one thing we share. Again, excellence. is one thing we share as Joost and Impact. So I'm sure there's lots that we can do together. I wish to congratulate you because you are venturing into areas that very few people are venturing into. I'm not going to mention, but this is really unique. And I think by being unique in this area, I would still encourage you. There are not many unique areas where we can still walk into and venture into together. I see very unique funders coming on board. We never knew that Red Cross could fund anything in Kenya. Congratulations, Red Cross. Red Cross coming when things are offside. But here now, they are coming to nurture things that they can grow and work. So we thank you very much for coming on board also. And we encourage even the banks who are just helping us to save our money. Please bring also money so that we can generate more to give you to save. Is that not a good idea? Even the insurers, please insure our research projects. Don't insure our money on our persons. We want that money of yours so that we can do a lot more. One thing I must note is that Joost has worked with you, of course, probably at some stage during your life. We've been doing research together. We've been doing capacity building together. And we are happy that we continue these joint activities. We are very happy and we are willing to still work with you. At 20 years and seeing the type of results that I was seeing there, I think we have a lot to disseminate to the world. And I would let you know that when it comes to dissemination, then Joost is second to none. So we are happy again to come together and really look at all that we are calling results and see how they can be published. It's not time to just present abstracts. It is time to present nature quality papers. And we are happy to do that as Impact and Joost together. Professor, I must congratulate you. I have tried to really, in my person, write proposals. But when I saw the number of proposals there, the number of research activities there, and their conversion from proposal to really funded projects, I give you honor. Congratulations. So at this stage, I'm not going to really extend much. I just wish to say that we are very happy as Joost, and I must mention, when I got the invitation from Professor Kuno, I didn't say my name. My name is Professor Dennis Ochuado. I'm the Deputy Vice Chancellor in charge of Academic, Student Affairs and Research of Joost. So when my Vice Chancellor sent me the invitation, I was attending a meeting in China. And when I saw Impact, I immediately wrote back to her, I will attend. So I then came. So that's just because of the quality that you are. It's the quality that you are. When I got the name, I'm not even in health research. But still, I keep hearing impact, impact, impact. Really, you are making impact. And please continue this impact. So thank you very much. God bless you. And continue doing the good job.
Want to see you smiling, girl, can't you see?
Asante, Prof. And very finally, with our research partners, Maseno University, Professor Colin Souma.
Is to take the lead.
Is Prof in the house? Okay, so I think that then brings my session to an end, but I'm feeling kind of guilty not mentioning someone who has not slept for 3 straight nights to make this beautiful. A vendor that we have worked with for the longest. Penta MC, just stand up and wave. Asante sana. Thank you for the sacrifice. Thank you for the good job. At this point, I want to hand over to my colleague.
Want to see you smiling, girl, can't you see? Baby,
okay. Sorry, I'm reminded that we need to also recognize the presence of Dr. IRDO, Professor IRDO. Yeah, kindly 2 minutes.
Thank you very much. Happy anniversary, IRDO. I'm indeed excited to be here. In fact, I've met a number of my students around. It means we are building capacity together with IRDO. Ladies and gentlemen, let me once again congratulate IRDO. The rate at which they are giving birth to the projects is wonderful. And I would urge you not to go for family planning. Continue giving birth to projects. Once again, great opportunity. Thank you for inviting us. Thank you.
So after the next session, we are going to have an exhibition where we are going to present posters. Yeah. It's okay. Thank you. So you'll invite MOH representative from Kisumu County to give us a speech, then I'll proceed with what I was mentioning. Thank you.
Thank you very much. Good afternoon. Yes, I know my chief is around. If he comes in, we still have to give him some time. Yeah, so my name is Frederick Oloch, Director Public and Sanitation, Kisumu County. I know I must have interacted with most of you, if not all. Yeah, I want to congratulate IRDO or Impact for making impact for the last 20 years. Can we clap for them? Thank you very much. And for us as a county, Kisumu County, we really appreciate you. You came in to bridge the gap that it is the government that is supposed to do, especially offering health services and even health research, which should be a core mandate of the health department and even the county government. But even before that, during the national government, you are still here doing research. And I want to really thank you. Most of even HIV guidelines, including even testing, has been changed and been informed by the researchers that Impact has always done. And I'm even very much happy that even though we're also trying to look into the health of the key populations, you have managed and penetrated inside their middle, and you're already working with them and providing the health services that they need. I know we provide, but at some point, we cannot do much. But we want to thank you for making sure that you work together with them. As you do research, you also provide health service to them. If you look at our statistics, especially on HIV, you realize it's not very good. But we also want to thank you for even putting in some work on adolescent health. The current statistic, if you look at high new incidences of HIV/AIDS is very high between 15 to 24. And of course, that goes again with teenage pregnancy, which is at 16.6, and gender-based violence, SGBV, at 18.1. So we are talking about triple threat. And I think all our thoughts, plans, should be on how to tackle the triple threat. But we want to see that as we do research, can we make impact through impact to bring down this issue of HIV among adolescents, especially 15 to 24. And of course, we appreciate there's been projects like Dreams that you were part of, which of course brought something, but we still think we still need to do a lot in terms of awareness creation, sensitization, and generally engaging the youth and listening to them. You know, most of the time, we implement plans and projects that are designed without the input of that target group. So we want to appreciate you, and on behalf of the county government of Kisumu, our CEC, Dr. Ganda, my chief officer, Dr. Lucy, myself, and the entire department, we really want to thank you, and we are together with you. We have to work together, and as we've always been working in terms of research, and even other partnerships that we do together, we are still looking forward to work with you to achieve maximum health research and even services in the county. I want to thank you, but before that, I know I have some of my teams who are here, team work with Kisumu County government, who are here today. Wave, 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 wave. Yes, I can see. Is that Masanga? Thank you very much, Masanga. You are very far. Yeah, Masanga, just wave. Stand up and wave. Masanga is our head of preventive and promotion health division within the county. So that means we are here. And I know our chief officer is around. He might just come in and might say one or two. But we want to thank you, and we want to say that we are walking this journey together until we see that we end what? HIV/AIDS, and of course other infectious diseases. But do not go home without remembering that we want to end HIV in children by 2027. By 2027. Again, we have seen what research says about HIV in children. We have seen that the number of these infections are due to mothers. If they come for the first test, they're just okay. Subsequent, and at some point they are positive. So that tells us that either the male partners are going out and bringing this, or do you think a pregnant woman will go out? What do you think? Your guess is going to be good as mine. And again, also, mothers who are non-positives are also, they stop taking medication, and that makes their children also get infected. So we want to think about this, and if you are handling these people, have time with them, have a session with them, talk to them, and tell them what that can make their children get converted to HIV. So we are both committed as health, me and you, to end HIV in children by 2027. Otherwise, thank you. Bwana MC.
Prof, you'd allow me to say this. I want to sincerely thank the MOHs from the various counties. We have always knocked at your doors when you want letters of approval to conduct research, when you want letters of support to make grant applications, and you've always supported us. We want to thank you so much, and we pray and hope that we'll continue to have that harmonious working relationship with you. Having said that, next we are going to have exhibitions, which include posters from our various researchers, as well as posters from the vendors who have talked with us here. So we have different research coordinators who will be standing by the posters just to answer to your questions. And then after that, we'll have a lunch break. I want to wish you an intellectual moment around the posters and some nice appetite. Or did I say that? Yes, thank you so much.
IRDO at 20.
So next session is going to take 40 minutes. If you look at the program, we are way, way behind in terms of time. So after the posters, you'll come back. Then we formally break for lunch. Sawa. And the posters are quite many, so some can start from this side, others can start from the other side, so that we are not overcrowding in any given area. Thank you so much.
IRDO at 20.
Kulani zako twazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu. Kenya tunayoipenda.
To reduce the severity of that infection. That's what we are studying, the efficacy of the vaccine. Yeah, so they are healthy participants. Exactly. Yeah, so it's a very good study. We hope to conclude. At the moment, our follow-up is good, and it's doing well. And the feedback is okay? Yes, the feedback is very good. So we will be doing analysis. It's centrally managed data by WHO. So the analysis, they have done some analysis, quantitative analysis, which shows very promising
Screening at the we do mobilization and TB screening. This is where we have the hotspots. You realize like in Siaya County is a high burden county.
I'm saying we do mobilization and TB screening, especially at the hotspots areas in Migori, Siaya, and Busia County, especially in mines and factories. And after doing that, again, we link them up. We have linkage assistants. Anytime we do this, our linkage assistants are always present with us. Then we link them up to the nearest facility for treatment and follow-up. Then again, we have X-ray services. We support both MDR contacts and children below 14 years. So whenever we get an MDR patient, all the contacts are being screened for the first time. We cater for the cost, and after 3 months again, we do screening.
So where do you get the MDR cases at the facility?
Yes.
And then now all the contacts?
The contacts.
So you link the contacts to the breaks to support them in terms of...
We support them with fares, and then again we pay for these services. Yes. Yes, where there is a radiology site. So here, the role of the community health volunteer is to do follow-up and to ensure these class they don't miss treatment. And also to ensure, in case there is a child, maybe someone who has developed signs and symptoms, again they do referral at the facility so that they get screening at the facility level. Yes. No, we are riding on the existing community health system strengthening. We have, actually nowadays they are being called CHPs, community health.
Yeah, today it's a wonderful time that we are here. Impact at 20 years since 2003. We really appreciate each and every impact that has been made within the communities. Here we are as a team. We are also here to share with each and everyone. As you can see, we have partners. We have also colleagues amongst us. And everybody is feeling lively because of the impact that Impact Research and Development Organization has made to the communities around Kisumu and across Western Kenya. These include Siaya, Homa Bay County, Kisumu, and this is we give thanks to all the people who had made this day to be wonderful for us today, including the director, Dr. Agot Kawango, and the rest of the team members that has made this day to be awesome. Thank you very much, and let's enjoy the day.
You don't know what now. We're going to IRDO, come on. Yeah. We thank Impact for organizing this activity. We thank Impact for organizing this activity and for celebrating 20 years. And Impact, we always focus on our clients who are our primary employers, and we always work towards their betterment. We encourage also our funders who are supporting IRDO to continue providing that support so that we continue supporting our clients. Otherwise, at Impact IRDO, we believe on quality, we believe on transparency, and we believe also on accountability. And our projects speak for themselves, and with very high successful rate. We encourage our clients to always come to our clinics and follow up on our appointments so that they get the best service. We also encourage our partners to continue with the support that They have been giving us, our implementing partners, our donors, and all those who receive the services that we provide. Otherwise, thank you for now, and IRDO at 20, go for it.
Wimboni naimba sio wimbo ni maombi, nikiomba Mwenyezi Mungu aibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele.
So I would like to present to you Solidarity Trial Vaccine Study, and basically it is a COVID-19 study that we are evaluating safety and immunogenicity of the COVID vaccine administered through a nasal drop. So basically this study was enrolling adults 18 years and above, and they were healthy subjects, whereby when you came to the clinic, our first role is to check if you have got any COVID-19 vaccine given by the government. Thereafter, if you're found not to be in the chanjo system, that is when we could enroll you for the study. It involved you getting 2 doses administered intranasally. So the first dose was given, let's say, at day 1 or day 0, and then 28 days thereafter, you are to be given a second dose. So as you can see here, we have screened 522 participants, and the screen failure, we have 22 participants out of the 522. That is translates to 4%, and we have enrolled 500 participants. So the first dose is given at day 0. Then at day 7, we have a visit. Then at day 28, when you come back, you also get the second dose. And then follow-up will go on for around 180 days. That is around how many months? 180 divided by 30, that is close to 6 months. And then in between, there are also lab visits, whereby we take baseline blood and follow blood that will follow on day 28. So basically, immunogenicity and safety parameters were being observed. So as you also look here, we have given pictorial outlook of our laboratory, a pictorial outlook of our research pharmacy, and then the procedures. And then on pic number 7, you can see that is the call center, whereby participants are being called, and a clear follow-up is being done for that purpose. So thank you. If you have any question, feel free to ask. Yes. Okay, thank you. Yeah, it's on.
Thank you. My name is Doti Agala. I'm the Executive Director of Kisumu Sex Workers Alliance. Kisumu Sex Workers Alliance is a sex worker-led organization which is for and by sex workers themselves. We are located in Kisumu County, but we work in 5 counties of Nyanza, that is Siaya County, Kisumu County, Homa Bay, Migori, and Kisii. We work with sex workers to address their structural barriers, which are making them vulnerable to HIV infection, such as GBV issues, legal issues, and even other issues that are affecting the sex workers. IRDO has been a great mentor to Kiswa, and we're really happy and glad to share with them the 20 years of impact as part of one of the impact of IRDO. Thank you very much.
Annie, it's good for you. Why? Explain your that. Okay, I'm Ruth Rapando. This is the Ray awardees chart listing their names, and it is also including the way their proposals is going. There are some who has completed and started writing the manuscript, and some are on the way and are going to collect data for those who started late. Some of them are are on the analysis process, and we are hoping by the end of this year, before December, we will be completing everything so that we can do dissemination. Yeah, these charts, the awardees have different proposals. Some of them, they are encouraging girls to do savings. Some of them we are doing on a prep retention and adherence so that we can reduce HIV prevalences in our girls. We have done so much in every part of these proposals. Mostly you'll find that we are aiming in reducing HIV prevalences in adolescent people, mostly adolescent girls and young women.
So hello, here we have the RAY. It's reducing HIV among adolescents and youth in Africa, Eastern Africa and Southern Africa. So here we have the background on how the adolescents and young people were found. Then we have the implementation through the objectives, the capacity building, guiding young researchers in acquiring the required ethics and the regulatory approvals. We are setting up, they were setting up the RAY department and the secretariat. So the secretariat is composed of people under 30 years. We have 5 of us. So we have the 30 under 30 mentorships. So the awardees were ranged between high school dropouts up to university, masters. So the conveners enlisted 21 senior researchers and program implementers and mentors the awardees in refining their concept ideas to full protocols over 2 to 4 hour virtual sessions held weekly with assignments. That is across awardees in Kenya and awardees in Zambia, South Africa. So this is the RAY 2022 conference. We convened the pre-conference in 2018, attended by 152 adolescents and young people, drawn from 7 counties in Western Kenya to collect their views. We needed youths to know what they want. You know, we cannot help youths if we don't know what they really want. So we had our first conference. RAY, it was hosted in Kisumu County, June in 2022. So there were 335 attendants. This is the picture of it. So these are the milestones and our achievements so far. The 30 researchers, they had IRB's approvals. Some we've managed to implement, and we've submitted to various conferences. We have IAS, we have ICASA, we have one awardee who has already completed everything, and he has already published his manuscript to PLOS Global. Here we have, these are slight demographics of those who went to university, those who are in secondary school, those in Africa and in Kenya, and those in Uganda, Zambia, and South Africa. We have how they're married. We have 16 married and 14 are single. So we have obvious in any study we must face challenges. So we have challenges. We've had challenges with mentors. Some are really busy; they cannot show up. So some mentees gave up. You know, people start research and they give up so fast. So some dropped out. We've figured out replacements, and some awardees had really poor quality of data. Considering this is the first one, people have been educated, yes, but it's the first thing. There's always the first error. So we work that out. So we've learned various lessons through that, how to have quality data over time. Then we have the next steps that we are targeting to face. So some studies we've not finished implementation. We are targeting to finish that by end of next year, probably. Present results in various conferences, and we are hopeful for the best. Okay, thank you.
bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu kujua, mwarifu kuona tu, mwarifu kujua, mwarifu kuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka. Kenya nchi yenye baraka. Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo. Tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote. Mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya, wenye nchi. Kenya kipenzi chetu, hatutaiacha milele daima. Wenye nchi. Kenya kipenzi chetu, hatutaiacha milele daima.
Wimbo ninaimba, oh, sio wimbo ni maombi. nikiomba Mwenyezi Mungu aibariki Kenya yangu. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu nguvu zangu nimeziweka mbele yako.
It happened that the father I'm going to introduce, we share the same name, the first name. My name is Jacob Onyango, and I work for IRDO in the research department. I would like to take this opportunity to welcome our guests from CDC. With us we have Jacob or Carl. Karibu mheshimiwa. Wewe ni mheshimiwa mkubwa kabisa. Karibu.
Asante sana. I know I'm standing between you and lunch, and that's a very bad. Yeah, thank you. I'm Jacob Okal. I work for CDC. We changed the name the other day, so at times I do forget what my position is. But it's something like partner management. Something like that, yeah. So, you know, sisi watu wa pesa tunaongea kidogo. So naona hata nani Mike was yera nini tu. So I will not take much of your time. So it's good. And I think to celebrate our 20th birthday, Prof, you know, that's somebody who should now get married, isn't it? Yeah, it's funny that PEPFAR is also celebrating their 20th birthday. So I think PEPFAR and Impact, then again, they've worked for the last 20 years. So that tells you how conjoined a twin they are. Personally, my journey with IRDO started somewhere in 2003, I think, when I was working with Kemri in the finance office. There was some evaluation that was being done, and I think IRDO was the one who was doing that evaluation. Then when they brought their invoices, and I was wondering, what is this impact? And that's how I came to know IRDO. And I think we've worked with them for quite some. At Kemri, I worked with them when the BMMC was still under research. Then again, NRHS, then now IRDO. You cannot talk of BMMC without mentioning IRDO, isn't it? And I think a lot of programs have been talked here, a lot of impact on programs, but I didn't hear anything on finances. So, what were pesa, you know, we usually sit at the back office. Maybe people forget about us, but I think, as you said, only one person recognizes us. Yeah, so I've worked with IRDO for long. From 2011, I've managed their program. So, in fact, within those 20 years, I've been talking to Prof nearly, at times even daily, at times even more than one times daily. And usually we do what we call BSA. And I think for IRDO, we've done it for quite a long time. And one thing that is good about IRDO, I know we saw the impact on the programs. They've always been the first. As I said, when it comes to BMMC, they were the first. And I think they were the biggest partner who are doing BMMC. And I think anybody who is doing BMMC must have passed through IRDO in one way or the other. And I think Aroko will agree with me. And when I hear that IRDO is a university, I think I also agree with that. They may not be accredited, but everybody who has done BMMC have worked with IRDO. Everybody who has done UKP, because I think they were also the first in that. So nearly everybody, when you walk to the partners, anybody who's doing KP, I think must have also passed through IRDO. Dreams. I know when dreams came, there were a lot of confusion. So again, IRDO was the first in that field. And most of the people who are doing dreams now, they passed through IRDO. I know with Prof, we've gone to some of the remotest parts of Kenya. Lodwar, when BMMC was being launched, when the programs were launched there, and I remember the time we went to Lodwar when it was still a province. We wanted to do site visits, and we were being, the PMO there asked us, who does site visits in Lodwar? And we told them this is different. And when we gave our schedule for the whole week, he looked at it and said that it may not be possible. Then he gave us the team for each, there were districts then, the counties were still not there. So when we started, there were people from the province who started, day one, they were there, day two, day three, we never saw them. When we came back for the outbrief on Friday, he asked us that, I've been following you. You guys managed. And that was possible because of IRDO. IRDO, when you start. Then again, even Pokot. I remember there were places where we used to go through Uganda. We go to Uganda, then we come back to Kenya. So that tells you how the impact IRDO has, not only in Nyanza, but everywhere. And I think, personally, I've walked this journey with IRDO. At the back office, yeah, I've been at the back office there. So I think maybe next time, Mike also put a slide for how the program has, because can we have all this without the finances? All those nice achievements we saw, can we have all that without finances? Yeah, so I think, Mike, claim your space. Yeah, when it comes to compliance, I know somebody said that Prof is strict. She's not strict. She's stricter. If that term, if that term is there. If that term is there. Because I know with IRDO, for all those years we worked with them, and I remember there's a time they had funding that we were even very worried because it was a big, big portfolio. And anybody was wondering, how can a local partner manage these funds? Because if you understand the way CDC used to work before, most of them were university, the US-based universities. And I think IRDO was the only local partner. And IRDO was getting more money than even 2 or 3 of these universities combined together. And there were a lot of that, how possible? Will they manage? And I think that's why, Prof, we used to come often, because remember, we are in this together. That's why it's called a cooperative agreement. If you fail, we also fail. That's why we had to ensure. And I think Prof didn't let us down. She put a lot of systems in place. We reviewed the systems. We made maybe recommendations. How do we make it better? And I think Prof was one person, if you tell her that we need to do this, it will have to be done. However, resistance she's receiving from people, it will have to be done. And as I talk of the other first, I think IRDO is one of our partners who received an audit report that had no finding. And I think by then, people always think that an auditor must find something, isn't it? That when they come, they have to find something. But here's a case where auditor comes, looks at everything, he goes to the field, he comes back, he goes to the field again, comes back. Then he says that there's nothing to write home. They've used the funds well, they've used it the way they budgeted, the way it is approved, they followed all the procedures, and everything is okay. And that's proof for you. So I think, I know right now we don't have maybe an active grant, but remember another cycle is starting very soon. In fact, 5 years runs very fast. Yeah, they are in year 3, so I think we are missing IRDO. Yeah, and I believe that at least we are going to have them back in the next cycle. They're always 5-year cycle. And by the way these things are done is not done by us. So at times our hands are tied. We thought we would appeal, but we also realized appealing was not easy. Ilikuwa kama ile yetu. Yeah, so I think in the next cycle, we expect to see IRDO back. Prof, I believe you are putting up a strong team to start writing again, and I think everything will be okay. So I wish you well, and I think as you celebrate 20 years, as I say, 20-year-old, that's a woman, not a girl. So IRDO is very mature, and we wish you well in everything that you do. Thank you.
Jacob, we really miss you. We miss CDC, and we are hoping to come back with a big bang should we have an opportunity. Thank you. We expected Jacob to come with from CDC to come with Caroline, but unfortunately, Caroline is not with us. Instead, we have Dr. Julius, whom I want to welcome to share with us and celebrate with us and give us some words of wisdom.
So I'm not Caroline. Somebody told us to come with water to pour to Professor Kawango. So I'm ready with my bottle. So my name is Dr. Julius Oliech. I work for CDC together with Jacob. And we are really happy to have collaborated with Impact Research and Development Organization over all these years. My journey with Impact started even before I joined CDC. I think I've worked collaboratively with Impact through all the phases of the places I've worked in. I think my first interaction was when I was working in the district, in Bondo district. And Professor Kawango and the Impact team were doing a very serious research on PrEP and implementing and working collaboratively with the district health management team and also with the Bondo District Hospital. And they did impressive work. That was one of the first research I was able to see that the research actually translated into policy at WHO level. And the research they did on PrEP was actually quite commendable. Please, a round of applause for that. So you could actually look at, I was very proud of that policy document from WHO on PrEP. You could actually look at the recommendations for PrEP for global was actually, the research was actually done in Bondo. So when I was working in Bondo, I was very proud to say that this is the work that we did together with Impact during that particular time. And which is very unique also for implementing organizations. We saw that after the end of that particular project, the project was actually done in the hospital. And the infrastructure that Professor Kawango and the team put in the hospital in terms of buildings and furniture, they actually left all that to the hospital. Please clap for them again. And I think those were turned into departments, which was helped in terms of space and infrastructure for that facility. And right now, I think it's been turned into a Bondo KMTC. So I think they should have named that Impact or Professor Kawango School of Public Health or something. So we really appreciate the collaboration. And I think even when I was working at the county and also working with implementing partners, we've seen the impact that Impact has been able to create, working collaboratively, looking at the research projects, looking at the program. And I think like Jacob has been able to speak, we've seen the work that's been done over the years. I also work in CDC for the prevention program, and we've seen what they've been able to do to the beneficiary girls for the DREAMS project. We've seen the impact of EMMC. We've also seen the impact in terms of what they've been able to do, especially even informing policy for this particular country. Communities have benefited from you. I think in PEPFAR, when talking about PEPFAR at 20, I think also talking about impact at 20, I think we're really looking at what has Impact been able to do, and being a local organization and even looking at the research, they understand the context in terms of what needs to be done. They understand the burden. We understand that this region has a very high burden of HIV, has a high burden of maternal mortality, high burden of malaria, high burden of TB. And the research that is being done here is actually going to inform. These are some of the questions we're asking ourselves as PEPFAR now in terms of programs. What better can you be able to do for PrEP for the key populations? What better can you be able to do in terms of just looking at the lower viral suppression for adolescents? What are some of those answers that are needed in terms of programs to be able to go ahead and be able to implement? So we're really proud to be able to have collaborated with Impact on all this. And I think we're really happy in terms of looking at what is the next step in terms of what can you be able to listen. Just recently, we are developing the vulnerable population guidelines with NASCOP. And part of the vulnerable populations include fisherfolk. And actually we are looking at, when you're developing the guidelines, you need to look at what research has been done, what are some of the reasons. So we're actually looking at, there's this scholarly research engine you're looking at, it's called PubMed. We are looking at what are some of the research that has been done for fisherfolk that can be able to inform development of these guidelines. And when we clicked fisherfolk in Nyanza, fisherfolk in Kenya, we're just seeing Professor Kawango articles coming, Professor Kawango and the Impact team. So really going a long way. Not only is your research able to inform programming, but also you're able to inform policy, and it's even now up to this particular level going to inform the same. So we really appreciate Impact, appreciate you on the work that you've been able to do, and we're really looking forward to another 20 years. Please invite us again for the other 20 years. And on behalf of my colleagues at CDC who are not able to make it, congratulations again. Your water is coming.
Daktari, now that you mentioned, you talked about the building that IRDO handed over to the district, the county hospital. I think we need to revisit the place so that we talk about the naming, the renaming of the place. It would be nice if we have, like, you know, Dr. Kawango featuring the name, at the facility. I would want to hand over the mic to Winnie.
Good afternoon once again. So I'd like to urge everyone to just stay put. Lunch is ready. Actually, the reason we are back in here is because they had made rice and chapatis, and we understand that especially men from this region would not appreciate. So we send them back to the kitchen and we said, make ugali. So that is what is going on right now. That's why we have to proceed. But everything else is very ready, so please do not give up. Tell your neighbor, don't give up. Stay strong. Be energized. Okay, so we are at that point where we want to also know who are what is the governing body of Impact Research and Development Organization. So we have a board representative who is going to speak on behalf of the entire board. So ladies and gentlemen, put your hands together. Help me welcome Pastor Odanga. Put your hands together. Let's give him an Impact Research and Development Organization welcome. Clap for him all the way until he makes it to the stage. Karibu sana.
Thank you. Thank you very much, Winnie. Thank you so much. The chief guest, Dr. Ganda, I believe he's joined us, or he's soon joining us. The donors and their representatives, the partners, the institutions, such as Maseno, where I did my master's, and Just, where I did my PhD. I'm the one that the DVC was referring to as their student. He spoke of the small bird in the smoke. If you understand French, you know what I mean. The board members of IRDO, the management of IRDO, the staff, distinguished guests, good afternoon. Before I give the chairperson's speech, which was written down for me to read, I would just wish to invite the members of the board who are present to come, greet you so that you can know them and say their names. and I hope none of them is going to remain behind. I'm looking at you.
Good afternoon. The energy has gone low, eh? Good afternoon once again. My name is Edwin Makori. I'm actually the honorary treasurer to the board of Impact. Mine is just to be able to appreciate. I think I've been here for 11 years. Eh? It's been more than 11 years at the board of IRDO. And the joy was just to be able to see what we've done to the community around us. You can sit in a board, and if there is no outcome or there is no impact, then there is no point of sitting there. Prof can attest, sometimes we push them as a board. There is a time we tell, she steps out there for the board to discuss. Eh? So as much as we are celebrating here, when we go back, when there are issues, we tell Prof, step out, we need to be able to discuss. There are times when it become hard, and I know she knows what I mean, but it's for a good cause, and we've seen improvement and serious improvement for that, to be able to improve the quality and also the impact that we really desire that Impact has on the community. So on behalf of the other colleagues who could not be able to make it, is just to be able to appreciate and thank you for finding time to come and celebrate with us. Because tunaweza leta ugali and all the good things, but if you don't have visitors, what happens? You'll give it to the dogs. Is that the case? But at least we're happy you're here with us, and we really appreciate it. Thank you very much.
Thank you. Round of applause.
I'm going to talk. Okay. Yes. All right. This is my boss, so I am loyal. So asanteni sana. I'm a non-voting member of the board, so that's why you see that they sent me out. But they light fire under my chair, and when a fire is lit under my chair, I also light fire under other people's chair here, and they know it. I don't burn alone, but I think I have a really strong board. You know, there are people who have boards that are just there. I have a really strong board. Our chair is a legal person, senior counsel. We have clergy, reverend, pastor, doctor. Hiyo yote. How many of you have done accounts in here? Accounts? You know what FCPA means? And he was your boss until just the other day. The chair to ISPAC, president, right? The CEO of ISPAC. So wazito, okay? So when you hear that we get zero audit finding, it's because they light fire, and I also light fire. And all together, we form, because we want, our goal is to serve the people with the best, with our best ability, but also make sure that the data that we produce, everybody in Impact knows that there are two things that it's not negotiable. Everything else we can talk. One, data. And two, those are two areas that we don't even negotiate. There's impropriety, unaenda. And no apologies. Anything else, come, we shall talk. So I really thank you for helping us to move to where we are. And all these accolades is because of your support to Impact. Asanteni sana.
Thank you so much. Let's give them a round of applause. I may also need to report, we have other board members who are not able to come. One of them is Cynthia Cheng. She's not able to come. She's a young person. Another one is Dr. Zachary Kwena. He was not able to come. And the other one who was not able to come is Jacqueline Ingutia Onyango, the senior counsel who is the chair of the board. Let me also report that this morning, before we came here, we were invited to visit, investigate, check out, look at, consider the impact research and medical services called Tuungane Hospital, and that's why we joined you late. We were taken through, and we really appreciate. We know that Tuungane Hospital is now NHIF accredited, and I need to bring it to your attention that the person who was key in bringing the accreditation was none other than CPA Edwin Makori, who is a member of this board. Please, a round of applause for him. And now, without much ado, let me read the chairperson's speech. Good afternoon, ladies and gentlemen. 20 years ago, Dr. Kawango dared to dream, and her team. They not only dreamt, but turned their dream into the reality of a great and impactful institution, which is Impact Research and Development Organization, IRDO. The institution has changed lives, improved health, and impacted on change of health policies in the country. Over the past 2 decades, we have grown, faced challenges, and celebrated victories together. Our journey has been marked by a relentless pursuit of knowledge and an unwavering commitment to making a positive impact on our society. Our organization has been at the forefront of research and development, pushing boundaries and fostering innovation. We have made significant strides in our field, and it is all thanks to the hard work, dedication, and passion of each and every one of you. IRDO has made significant strides in improving public health and development over the past 20 years. Here are some of our notable achievements. 1, progressive expansion and presence. Over the years, we have moved from being a local non-governmental organization registered in Kenya with offices only in Kisumu County to establishing regional offices in 9 counties within the Republic of Kenya. 2, broader scope of programs. IRDO has continued to expand the scope of programs offered. We have implemented biomedical, behavioral, and structural HIV prevention programs and research in 25 of the 47 counties of Kenya. 3, enhanced stakeholders partnership. The institution has expanded its linkage and has attracted more strategic partners. Through these partnerships, we have expanded our funding base, and now we are able to implement various programs funded by prestigious organizations, including PEPFAR through CDC and USAID, Global Fund, National Institute of Health through various universities, Bill and Melinda Gates Foundation, the World Bank, and others. 4, program implementation. We have implemented various programs targeting HIV/AIDS, malaria, and tuberculosis in 13 counties of Kenya. 5, research contributions. From 2013 to the present date, the research division has conducted over 40 studies and contributed to policy formulation. 6, expanded organization structure. The organization has expanded its structure to promote emerging and strategic trends. The organization has now a business development division responsible for developing business and providing strategic direction on new investments and business opportunities. 7, community impact. Over the past 10 years, we have conceptualized, designed, conducted, and successfully completed several HIV/AIDS prevention interventions and behavior change programs in Rift Valley, Nairobi, Nyanza, and Western provinces. These achievements reflect IRDO's commitment to improvement public health and leveraging community resources for development. As we celebrate our 20th anniversary, we continue to strive towards our vision of empowered and healthy individuals and communities. As we celebrate this milestone, let us not only reflect on our past achievements, but also look forward to the future with renewed vigor and determination. Let us continue to strive for excellence, uphold our values, and work together to make even greater impacts in the years to come. I would like to tremendously appreciate our funding partners, PEPFAR through CDC, Global Fund, University of California, San Francisco, National Institutes of Health, Bill and Melinda Gates Foundation, and the World Bank. To our partners in the Ministry of Health, county governments, implementing partners, community advisory boards, and various stakeholders. I also take this opportunity to appreciate my fellow board members for providing strategic direction to our organization. Their skill sets and commitment to the organization is unmatched. Last but most importantly, to the executive director and staff who tirelessly work to implement and support the objectives of the organization. Your labor shall not be in vain. You have worked hard for this accomplishment, and we truly appreciate your dedication. Thank you all for your continued dedication and commitment to our mission to improve public health and development by promoting research and programs that leverage community resource. And I bring in my own because the chairperson referred to 1 Corinthians chapter 15, verse 58, and I just wish to quote the entire verse. The entire verse, 1 Corinthians 15, 58 says, "Therefore, my beloved brethren, be steadfast, immovable, always abounding in the work of the Lord, knowing that your toil is not in vain in the Lord." We look forward to another 20 years of success. Thank you very much. Asanteni sana.
Thank you. A round of applause again for Pastor Odanga, board representative. Now, without wasting any more time, the hour has come. It is my honor to invite the reason why we are all here today, the vision bearer of Impact Research and Development Organization. This is a face that is well known by all of us, and she goes by many names. There's how you know her, and then when you get to Impact, there's how you experience her. So when you get to Impact, you realize that there are several names that she goes by. You will hear Mudheri, you will hear Madhe, then you will hear Chamber. So chamber, Priscilla will ask me, "Where are you going?" "I'm going to the chamber." And then you have to ask Marilyn, "How is the temperature?" And, and then there is also Dr. K. There's also KA. That is the one she tells you, "Call me KA." And then, so before you go in, you have to establish your relationship. How did you come? What is your tone? Everybody has their own tone. Everybody has their own relationship. So everybody has their own identity, how they know Madhe. So it is she's a person who I am not worthy to untie her shoelaces, but there has to be an MC for this session, right? So I'd like to invite all of us to be upstanding to celebrate the vision bearer of Impact Research and Development Organization, because without her hearing the voice of God to establish this organization in this part of the region, we will not be here. Karibu sana.
Asanteni. Hey, Winnie, unaongeza chumvi. This is the lady that organized the youth conference, as you see her here. She's the one who organized almost 70 to 80% of this meeting. So, but she's not available, yeah? We can lend you. Yeah, and She's very articulate, as you can see. But she's doing a great job. She's in the Ray Secretariat. So when you hear all the successes of Ray, Gerald, Winnie, and then we have newcomers, Ivy, and the others. But she's been there from day zero of Ray trying to get young people to apply from the application time. So Winnie, thank you. I'm not going to repeat anything that's been said. I just wanted to give you a little bit of a background, kidogo too. And I want to call the people who are here pre-impact. And why they're important is that because of what we did together, that gave us a profile, that gave us the courage to apply for our first funding. Without that, we would not have had anything to show. So Tom, Archbishop, are you Archbishop now? You are still Bishop. Tom, Rocks, some people are, some people say like working with Kawango is so difficult. I've worked with, Joe, I've worked with Aroko. Aroko, I've worked with you from when? Now Toki. Aroko. And then, unfortunately, one passed on. This was the team that when I was doing my master's and PhD, I did my second master's and PhD concurrently. And so when I came to do my fieldwork back in Kenya, I studied in the US, we were with them, and there was somebody called Japolo. So Japolo has since passed on, although Daniel Oguso. So I wanted the wife to come, because it is important to see where you start from, not just where you've seen. Joe and Achieng. Me, I don't know Rosemary or Sijui who. I know Achieng. Where is Otieno? Okay. Otieno, you know Otieno Victor. So you know Victor, head of transport, ex-head of transport. Nani amebaki? Nani amebaki kati yenu?
Osodo yuko.
Osodo. Hey, where is
Osodo?
Osodo ako wapi? Ama mukumuita? Right. Did you invite Osodo? Because without Osodo, we didn't even have a meeting. Osodo would make you laugh from the time you get into the vehicle until the time you come back. If it is during daytime. Night time, you move, ukifika pale, ashalala, anangorota. But we had a great team. We would wake up in God Kachola. God Kachola is where the network is Tanzania. We are there until past midnight. The following day, we have appointment near Busia. And we have to come back, so zingine, and I was not very good in driving then. You are driving until unafungua macho na force because you are sleeping. And you know, ukifungua na force, the head is sleeping. I almost got into Nyakwere River. So we started with them, what gave us the foundation to be where we are. What we used to now get the profile that we could then apply for the funding with. So I want them to say just kidogo. And when I started working, Jieng and Victor, because I didn't have money to pay them, have you lived with these research assistants in your house? You research assistants who can afford your houses. They started where they were staying in my house because I didn't have money to pay them. Jieng was the data clerk and Victor was the driver, come RA. And we managed to do a great job. So Jieng, just say a little bit.
Hi. Vile tulianza, it was difficult. I would enter data the whole day, the whole night, mpaka ikafika mahali singeweza kutembea. I had to go to hospital. Ukienda church ni 2 hours and you're back kwa data. Akirudi anakuuliza, umefika wapi? Do you have any problem? Akipata makosa, my friend, utaonyeshwa gate. Ukienda kwa gate anakuwa, unaenda wapi? Unaenda life. But it made us sufficient. Juu hutaki kuonyeshwa gate. Na ulizwe tena unaenda wapi. And that is what made me who I am today. Thank you.
Hey, hamjambo.
Nimeshukuru sana, tumekutana na professor after 20 years. Tulijuana na yeye 1999. I'm appreciating my church, no mayor. This journey we started from no mayor. Our practical to circumcision, no mayor church. Bila alikuja akaelezwa kuna mtu jamaa mwingine amejiwana na watu wenye wamekuwa circumcised, mtu wa no mayor. Sasa I was the coordinator of the circumcised churches. Amen. Tukichukua watu 100 circumcised, tunachukua uncircumcised 100. Tunachukua sample, Mr. Roko yako hapa, anabeba sample, tunakuja naye, tukipima, tunapata uncircumcised have high risk in HIV. Hapo ndio hii maneno ilianza, alafu UNIM project ikakuja. It was very difficult, vile wamesema. Tunakuja asubuhi saa 12, unavaa saa hiyo unarudi mahali pengine. Saa zingine tunalala kwa barabara. Tunakaa mpaka asubuhi, ukiingia hivi, Otieno Victor ndio yeye amefika na Subaru Legacy kwa mlango. Utaenda hata kama umechoka. God bless you. By that time it was very small, tin. Sasa hii nimepana kama tukienda wengine wanasema, oh, si huyo ni positive ndio sababu naongea mambo ya negative. It was very small, tin. Nowadays nimeona kama ameongeza nyama. Amen. Kwa jina mimi ni Peter Odhiambo. Nilikuwa ninajulikana kama Tom Livindi Jakanyang'wa. Na yeye ni Kawangonya Sako Karabuor. Nyamajiwa. Asanteni sana.
Bwana sifiwe. I'm happy this afternoon to be with you here. I'm Mrs. Oguso. Oguso worked with Dr. Kawango. Okay. What I know, they were doing research. So I've seen the research has become successful. It is the 20th anniversary. Congratulations. I've forgotten my name. My name's Pamela Achieng Oguso.
Thank you everyone. Good afternoon. My name is Erastus Muga Aroko. Those days we used to introduce ourselves in full. Yeah, I had to say Erastus Muga Aroko, Jakarachu, Jakonyango Majieri, and Daktari would always say Nyakarabuor. So when I was calling Tom or Peter, we had to remember those kind of introductions. Because the churches, they would like to know, who are you? Where are you coming from? Are you part of us? Or are you coming for something else? Otherwise, that work was a bit very challenging. And it is good we have a wife of one of us who has passed on. Sometimes it would be difficult, like Tom said, sometimes we sleep on the road, meaning there were days, like the other day, we had to look for a mat at Ringa. We slept kwa veranda ya hapo, where somebody was repairing shoes, so he forgot to remove the mat. So at night we were there, it was very cold. We had to get the mat down and use it for some time until around 5 when the vehicle started passing. So we were able to to come. One of the teams, we divided ourselves into two. One of the team went to Olasi, and us we remained at around Ringa. So most of the days, it was almost the same. Doctor, you remember the other day, we almost had head-on collision with a leopard. Yeah, I almost had a head-on collision with a leopard when we were to cross. It was River Kodera Forest. Inside Kodera Forest, we were not able to see the road. It was past midnight, and I opted to go out of the vehicle so that I would visualize the road and guide the driver. So immediately I was stepping out, a leopard was also crossing in front of the vehicle. So Victor had to stop me and pull me back to the vehicle, because for me I was going to check the road, and we were going to meet at the corner. So when he told me just look in front, when I checked, I was seeing a big leopard crossing just next to the vehicle. So sometimes it was good luck. Otherwise, we thank all our funders, we thank all our staff who have worked with impact over the time. I know at a given time, we have to exit, and mambo ni matatu. Either you exit to other pastures, Dr. as Bob said, it is other pastures, not greener. Yeah, other pastures, or you exit to maybe retirement, as some of us, the days are going, and we are soon going there, or you exit to leave alone oxygen. Yeah. So we thank God for giving us, one, the chance to serve our people, and the time, 20 years and beyond, is not a few days. It's a long time. And we also ask our funders to continue supporting us, and be assured your funds are going to reach the end users. It will not end in the boardroom. Thank you, and thank you very much.
UNIM, I know there are two people from UNIM, because after we got this, it led to UNIM, where we started the circumcision for HIV prevention. Ayeko paso. So this led to UNIM, and UNIM we were with Aroko as well. Is there anybody in UNIM here? Merab ako hapa. Yeah, and Merab and Silas has a special place there. So then we moved to UNIM, where we did the study that then confirmed that male circumcision reduces the risk of acquiring HIV. And that was the UNIM project. And once we finished, before UNIM was over, then Impact was born. And we had the profile that we had developed through the work that we had done with them to actually then apply for funding, for our first funding, CDC funding. And our CDC funding was very strange. When we applied, we didn't know we were competing with I didn't know I was competing with my boss. My boss had been promised a grant. Tulikuwa tumemtafutia nyumba. We have got a vehicle for him. We've got a place where he was going to start a youth center, and so on. But then CDC said, you cannot handpick. Can you release the application? I apply, akiwin, atapewa. When it came, sisi ndio tuliwin. The most difficult thing was to go and tell him to win. At that point, I didn't know we were competing with him. I was just thinking he was going to ask, when did you get time to do this thing? But we would work during the day and write the proposal at night. We work mchana, tunaandika usiku. And those days you were sending in a poster. Hakuna cha email. And when it came, it was $200,000 US. Yani we didn't know whether we would finish that money. Hey, 200, yani hatukujua. We ended up that at one point we had 16 combined research and programs, 16 million in a year. From 200,000 that we didn't even know we would finish. So God is gracious. I'm meant to order our steps. And I wanted this gentleman and Jesse to just come and say two things. And as I call him, those of us who were there from day one when we started, Alice, Nancy, Morris also. So you don't know you are in UNIM. Yeah, so Jesse was mentioned here. Jesse has graduated from a bicycle to what? Prado. Mi hata sijanunua Prado ever. June has wanted me to buy V8 and I've never bought. Now ako kwa Range Rover. Ametoka simple case. There's somebody who mentioned here earlier. I think ametoka kwa baiskeli na kupiga watu picha kupata pesa. Now ako kwa Range Rover. Ametoka hata kwa Prado na Range Rover, which is higher. So people have grown. And I like the way people have grown in terms of investment, in terms of education. Sometimes I light fire and it doesn't work. I lit kwa huyu jamaa arudi shule. Alikuja akasema, madhe, unajua mimi shule sioni kama naweza kurudi. Unajua kuna wale wa kurudi shule na kuna wale wa kuingia tu business. And so one time tulikaza that everybody had to have a diploma. Nikamwambia, I've never seen anybody look so miserable. So he went and got a diploma. Where he got a diploma, I don't know, because when he came, tukamuuliza ulipata college gani, akasahau ilikuwa college gani. How do you forget which college umepata your diploma? Ndio akarudi akatuambia that unajua wacha mimi tu nifanye hii kazi alafu fanye biashara. Because people don't have to be because you push people into academic, you think everybody is an academician. But he has moved in that direction. And he's amenishinda. Me, I've never driven anything. Me, my best has been Subaru. Legacy kwanza hii ya chini. I've never had any, but it makes me feel proud. It makes me feel proud. And nani tena hajakuja? Somebody who has also really improved. Molzen aliingia kama alisema hakukuwa na chochote, akanunua land, akajenga mabati. Sasa hii anaishi kwa gorofa. So now you have people wengapi and they didn't have diploma. Yani mmeka tu one, wamepata degree, wamepata masters, ama wana study. Asioni mkono yako wewe ulipata masters before you came. People and their kids are going to school. So that is an achievement. Their kids are going to school, they are raising their buying houses. Aroka amejenga, well, you've been building since I knew him. Amejenga nyumba huku Mamboleo, amejenga gorofa huku Lolwe, amejenga huko ninio huko kwenu Kindu, amejenga. You know, he's always building. Kidogo tu anachukua kidogo. Every time you meet him akona loan form. Every time you meet him anatafuta guarantor. But he has reached where he has reached. And I wanted to bring somebody here that has been my child from uni to just say something about how you can hold somebody's hand indirectly, not only in academics. I've held people's hands in academic and so on, but how you can hold somebody's hand. Si unaona vile? Sio mchache.
Thank you. Good afternoon, everybody. I mean, I lack really words to appreciate Mama. Allow me to call her Mama because even in my text messages to her, we address her as Mama. And I also want to make this crystal clear that in no any way are we related with Dr. Kawango. I remember quite some times when we were doing business, quite a number of people felt uncomfortable discussing business with me, and in quotes, because they would perceive that you are a silent microphone to Dr. Kawango. And so whatever you say would be magnified in louder sessions when you speak to her. I want to speak about three things fundamentally and pretty fast and close. Pretty fast and expeditiously for that matter. One, I had known Daktari through my teacher. She might not remember whom she taught in Moi University, Mr. Wee. And they had a very nice version about her. So when I was meeting her for the first time through Merab also, I met somebody who was just out to work. And I had nothing. I had just started doing printing work from college. Laptops were very expensive, so I would carry my desktop home. I want you to imagine how that was possible. I have something to do for her overnight, so I carry the desktop home, connect it, carry the desktop again to somewhere where I was squatting in somebody's office. Such a tedious journey, and you can remember how the screens were big, and you have to do that daily. Finishing up a job for 2,000 shillings would mean that I go back to her. She has given me a job for 2,000 shillings, but I go back to her and ask, Mama, do you have 1,000 to start it off? And many of you could predict the reaction, particularly knowing that you are not able to afford 1,000 shillings, yet you are looking for the same job. But she would passionately grow with us. From as little as 2,000 shillings business to 11,000, the first check she issued me with was 11,000. And I was receiving that check straight. So we knew checks are not supposed to be squashed. I carried that check in a brown envelope diligently to the bank with no bank account. I was only informed at Absa Bank by the teller that, you need to have an account to have the check ready. But we will support you either way. Go back to the owner of the check. Let her counter sign the check behind. She did. She can remember the story. Come with your ID so that we see if we can cash out the check for you across the counter. That happened several times. And she would really support us. I have grown through the lenses of Dr. Kawang. I'm not saying this because she's here. I have told this to many people who come to my office. Probably many of you can attest. The name is the Penta MC, because I know quite a number of people are wondering who then is Silas and who is the Penta MC. The business name is the Penta MC. And so one time, my late brother, and I have to bring this story in her glare, was traveling and we did not have 500 shillings. So this is your boss who has given you a check the other day of 11,000, it has gone. And so you don't have 500 shillings for fare for my brother, who eventually studied law. He was a proud son of hers. And I went down and she told me, the way I'm seeing you, those people who remember the UNIM office, Prof was facing the wall. So you come from back, and she says, who is that, Silas? Then you come with all your hands back, and she says, there's something, there's a problem you have. I can see you have a problem. Say it very fast so that you leave my office. And say, I need some, you begin to scratch your head, about 1,000 or 500 if you have. My brother is, but I gave you a check of 11,000 the other day, say, I paid school fee, okay, fine. Get me 500 from this 1,000 shillings. And that is where she has brought us from. So we cherish you, Mama. I know most of us, when you call for function at home, quite a number of us, 3/4, because you've grown in leaps and bounds from home. When you call a function, the function turns into you. Like if Frank called a function at home to appreciate their mother, everybody would be saying, Frank, you have done so much. Frank, and the function changes to Frank now. Today's function, in my honest opinion, is just about you. We are not doing this because Impact is not celebrating 20 years. You are the reason for some of us. You are the reason of our pride. You are the person who has brought us from what we would not be to what today we are. We have also gone to school, and every time somebody who is not your relative wants to know what level you are. I remember when I was taking my second undergraduate, she's like, I know you will just pass, but you're not even reading. Can I see what you're doing? The time I was taking up my master, she was all over. The document, of course, she wants to see even what you are researching on. She might not have the time. And the ambience of time, not to be being with her, you definitely push it and push it on. Now, the other day, she's too proud when I was telling her that I'm pursuing my undergraduate in law. And she begins to tell you now, watanijua. I have other lawyers, but the list is increasing. I am barely in my 4th year, and watamujua is becoming part of the version. But as I finish up, Mama, tumekuweka katika kitengo cha juu zaidi. Ni vizuri niweze kuchanganya ndimi kwa wosia wale wengine ambao kupata fursa. Najua labda Kiswahili changu hakijabobea sana, lakini mtaniwia radhi endapo muundo msingi wangu sio dhabiti sana, iwe laini na yenu. Ni vyema kwa watu kama sisi wanaotoka mkoa huu kuonyesha uweledi wao kwa lugha ya Kiswahili. Ndiposa kuna wengine labda wakipata nafasi, wale wa Mombao na wamepewa nafasi, kuzidi kumshukuru mama kama huyu. Tutangoja mpaka wakati tunaomboleza, ndiposa kila mtu atakuwa akitoa rambirambi zake na kusema mengi kuhusu yale ambayo alikuwa ameyatenda. Nachukua fursa hii kwa sababu tumejifunga nira pamoja. Mama ametulea, ametuwezesha sisi kama wanawake, and calls us our son. Ametuita wanawake kila mara. We would associate with Gifto, and just to think that constantly you will be in that bracket because of Gifto. No, she would want to segregate you. Anakuambia wewe ni mwanangu, fuata njia zako, mpige foleni mahali foleni zinahitajika, ili niweze kuwahesabu moja kwa moja kutokana na ishara za kazi zako. Mimi nina ishara, mimi ni mwakilishi ya wale mama ameweza kuwasaidia. Kama kuna wale ambao wanatutazama katika mtandao wa kijamii kama Franco Juang, kuna Vintolin ambaye tunamuita 40, wale ambao mama amewakuza. Amewakuza kutokana na muundo msingi thabiti. Muundo msingi ambayo sio rojorojo, na pia kila mara hangetaka uwe kama tikitiki maji. Watermelon, for those people who are not getting this language. Na siku zako za usoni, kama ungepata fursa ili kuweza kaa katika ofisi nzuri na uweze kufurahia mandhari ya kiyoyozi, those are the air conditioners. I know we are getting lost. And mama, ukitoka hapa leo, jua wanaako wakiongozwa na mimi, tunakusherehekea, tutazidi kusherehekea, hatutangoja mpaka uwe hayati. La, mambo bado. Asanteni sana na mzidi kubarikiwa.
I think with that, this gentleman has a PhD that he did with year 2000. So don't tell me you need 500,000 to start a business. Year 2000, he went, he was photocopying our consent forms. These days, unajua regulations, we cannot give you consent form to photocopy, but we were giving him. Then he comes to ask you for money to go and buy photocopying material to go and photocopy, and then come and sell to you. And he went through, and one thing I admire about him is that akisonga na bibi anasonga. Akisonga, akienda kwa masters, the wife is doing degree. Akienda kwa PhD, the wife is doing masters. And amemaliza PhD, he's teaching at a university, I think part-time. Yeah, just, yeah. And then he went back, and the other day I was finding him. He's now doing law, and he's almost completing. Like, hey! But I am proud. And these are just examples of a few examples that I see here from the one who refused to go back to school. And is successful without going back to school. So sio lazima kila mtu aende shule. Where is your strength? Now nikitaka gari, I just say I want Prado ama I want Range Rover. Then to one that has got degrees, and I have multiple degrees that are around that I paid from the street of Kibera, and they got their degrees and they're everywhere. So I want you guys, and that's what I want to end with. I want you guys to hold somebody's hand. And holding somebody's hand doesn't have to mean that you're a director somewhere. You must be a principal somewhere. You can hold somebody's hand even if you are a mechanic or you are a carpenter. Kuna mtu unaona kwenu. Although saa zingine watu wa kwetu ni ngumu kuwasaidia, but pick a child of God from wherever and hold their hand in whatever it is you're doing. Imagine how many are we here? 200 plus. Supposing we each held a hand. Those are over 200 hands, ndio? And then those ones also hold somebody's hand. And me, that's what I thrive in. Impact has employed over 10,000 people. Tangu tuanze, to date. And those are the hands that I would say I'm holding indirectly. But they're the hands that I hold directly. And usihold hand ile inakusumbua. Jaribu ikikusumbua wacha. Hold the one that you can move with so that umalize you upate baraka za Mungu. Yeah, Pastor Danga yeye atahold whichever hand. Unajua hiyo ni training yake na yeko hapa another pastor. All the pastors can hold. Sisi tuna hold yule ukihold muna move. Na yule ukihold anakurufuruta si you pick up somebody. Just pick a hand and hold. And don't say that if you reach here, utahold. No. Remember your life wherever you are. There's somebody admiring that. It does not matter where you are. Even if you are a shamba boy somewhere. Unajua kuna mtu is wishing, I wish I would get that one. At least ningeweka chakula kwa meza. So whichever position you are better than somebody. That's somebody that you are better than in whichever area. Please, the only thing I'm asking you at our 20th anniversary, hold somebody's hand. Reflect back home in your neighborhood, wherever you are. Pick up somebody that probably hata hakujui. And I tell people, that's where I get my blessing. My relatives ni kichwa ngumu. So I helped them and I reached a point where I said, wananifuruta nyuma. And I get more of my blessings because I support people I don't even know. I've taken over 200 girls back to school in Migori. Hata mmoja paka leo. In Kisumu, about 70. In Homa Bay, this is the people I'm taking back with money that is coming from business. Kuuza suruari. Nimeuza suruari. Wengine wamekaa na mimi ni for a long time. You know that we were buying from Uganda. Tunakuja tunauza and profit. Tunapeleka wasichana shule. We've taken girls back to school. Siaya tukupeleka because there was already dreams and we thought we are not going to add there. So if I was Kenyan na ningepeleka Siaya because mimi ni wa Siaya. Siaya would have taken to Siaya. But I said Siaya already has dreams. Why should I take to Siaya na kuna wengine? And we sold underpants. Tukauza printed t-shirts. These ones are tukuuza. These ones are yeye ndiye alitutengenezea. Tukauza mbao. Tunaenda Mount Elgon. Tunachukua mbao, tunaleta, tuna supply. And profit, we take girls back to school. So that's why I tell people that if I wanted to steal, I would have stolen. If I was the stealing type. Right now we are launching, and you are all welcome. We are launching Nige Girls Empowerment Center that we built. We bought land. Na pesa ya suruari. So usidharau kazi. Kazi ni kazi, si ndio? Usidharau suruari. Kazi. Tukauza, we bought land. And then the French embassy wakaona, and they felt impressed by what we were doing. They gave us money for the foundation up to the slab ya chini. Then tukauza suruari tena. Tukajenga. Mpaka juu, mpaka roof. Gorofa. One story. And then now tukashindwa kumaliza a few places inside. And then Japan embassy juzi wakaona like, wow, this is excellent. Wametumalizia. So we are launching a girls empowerment center that has got vocational training. So mukiwa na watu wa kupeleka Nige, because the profit will go to support other girls go back to school. Profit si haikuji kwangu. Mi hata ndururu ya airtime wanipati, and I'm not looking for that. I'm being paid by impact. But they are having a girls empowerment center where we are having a place for children, because a lot of our girls kuna watoto hawajui wapeleke wapi. Tunawapatia uji. They have a place. We have a rescue center for survivors of sexual and gender-based violence, and we have a lot of things that we are doing for girls there. And with zero funding from the government or the county government or except for kutumalizia the rooms, alafu na the perimeter wall, and then the foundation. The rest is just profit. So when somebody saw what we were doing at Impact, alikuwa anasema, if I was running Impact, I would have owned Kisumu. I don't know whether somebody remembers. If I was running Impact, I would build an empire. And I said, you know what? There's some people that are different. And I'm calling on us to be different wherever we are working. Not just with at Impact. At Impact, tunakuwa different, upende usipende. Sindio? But wherever you are, you just be different. And when you're different, then you'll see that God lifts you. Because tumbo yako na yangu ni size gani? Biologist. Biologist, Pastor Danga. Si ni hivi tu? Ni tumbo. Yeah, utapeleka mingi hiyo wapi? Yeah. And I was telling this lady in the morning, Lillian Gala. She's doing a really amazing job in Homa Bay. So she wanted to also come and learn from us. So I was telling her in the morning how one time Pastor Danga used to be my pastor those days. before I moved out of Kisumu. And he was saying how 2007 he met Christians who were carrying TVs from Ukwala, mattresses and so on, wameiba, looting of 2007. So he said, how do you sleep on that bed with a stolen mattress? Every time you wake up, Ukwala, 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 Ukwala. And I still remember that. He probably doesn't even remember. That every time you wake up, Ukwala, Ukwala. So let us, and integrity pays. That one I can tell you. Integrity pays, patience pays, and supporting others, God rewards you. Yeah. I was to do my PhD at Moi University where I was teaching. And I got that scholarship. For those of you who are at the university, there's a DAD, it's a German scholarship, but you do it in country. And I had already signed, and then later I'm called and I'm told that it has been moved to somebody else. And then the person who moved it told me, like, I made an executive decision. And that was it. And I was so devastated. And then I said, I am not interested. After all, mimi niko na mtoto. I can look at mtoto mmoja with my, those days, I don't know whether they're still called tutorial fellows. I was a tutorial fellow. I said I can still be, but there was this person called Professor Chieng, who was the dean of graduate studies. He was on my case because he knew what had happened to my scholarship. And I told him I'm not interested. He was on my case, and to tell him I am done, I said, to get to Chieng off my back, I'm going to now do this application. It was a Fulbright scholarship. So I did a Fulbright scholarship, and it went, just to get Professor Ching off my back. But I had told somebody earlier that, my scholarship will come with my name tag written on it. That one I told somebody that it will come with my name tag. Because this other one came to the university, and the university was supposed to allocate. And the committee allocated it to me, but somebody made an executive decision, akachukua akapeana elsewhere. I said, mi yangu itakuja na name tag yangu. So when I applied for Fulbright, people were shortlisted about 12. And it is all universities in Kenya. And of those 12, 2 of us were from Moi University. One was called Fred Nafuko. And we went to the embassy, we were interviewed, and it's just the 2 of us who got it. And it came with my name tag on it. But this is for Kawango. And then I was told, now you go to the US. And then I was like, I don't even know where to go. Me, I only know Nairobi farthest. So then I'm checking, I choose a university, I'm looking at those who are doing my courses. And then I write to them, and the first one who responded, that's where I went. Not because it was my preference. I had no idea. I went to where I was called, and when I was going, I thought I was going to Washington, D.C. Kumbe I was going to another Washington. But that's how I went. And that's how I got the scholarship, and it came with my name tag on it. So if you do work for somebody else, the problem is that we are so self-centered, me, myself, and I. If you support somebody else, and I want to say it does not have to be your relative, God will pay you back in a way that you didn't even plan. I'm not a preacher lady, but I'm just telling you from my experience that God will pay you back in a way that you didn't expect. And don't expect that your story will be my story. That because I did that, you're going to do that, and you're waiting for that result. God doesn't have a marking scheme. Okay? Yeah, his ways are not your ways, right? So vile anafanya na wewe. Sasa zingine ni give you good life. Mbona huko hospitali? That is a blessing which we forget. So let's remember our blessings. Let's remember the privilege that we have that some people are looking for. And above all, let's remember to hold somebody's hand. Because at one point, somebody held your hand. However rich your parents are, or however well-placed, somebody held your hand, maybe teaching you math in school. So let's hold hands. To me, that is what I preach these days, is build mentorship, hold hands, because that is also building mentorship, and God will answer your prayers, but not in the way you expect, in the way that He has destined for you. And that's what I would say. And this team is an amazing team. This team, Paul, Tom Jakanyangua, he was our link to no. In those days, there were no circumcised Luos, many of them. Walikuwa wachache, sahi wako wengi. So we had to hunt circumcised Luos everywhere, every single corner in Nyanza. And we were going with him. And then I know it's Oguso, but we used to be Apollo. He was going to what is called African independent churches, which were now, because Nomia is an African independent church, for research you want to make sure that they are comparable. So we went to African independent churches, and we went to Nomia, and then tested people, and we wanted to look at association with HIV. And that is part of what has led to the study that we did, and to the now a big program that is followed internationally or being implemented internationally. So I think I want to leave you with that. I just wanted to appreciate this team. Thank you, thank you. Ayeko huyu ni wa UNIM. Wa UNIM. Jesse, we've been with Jesse is anaitwa Japap. Yani he can mobilize anybody. When somebody anakusumbua ita Jesse, he could mobilize. One time we had a study and it was ending saa 5. Na anapeleka bibi ya mtu nyumbani. Unampaka na panga kwa gate. Sasa hiyo mimi narudi tu nyumba. Nasukuma Jesse mbele. Yeah. Thank you, thank you, thank you. Jakanyang'ua. Asante. Wauoto. Pole kwa mzee. But you're fine. Thank you. Aroko, mbona we utoki?
Years are going.
Nasema kutoka ni ile kwenda kutafuta kazi elsewhere. But thank you. Asanteni sana. So that is the history of where we came from to where we are today. The first team that started, Alice and the others, just come and say and greet people. Alice, the people that the first time when we got the funding, so si tumepata funding kwa hawa watu. Okay, they know they are supposed to be coming. Tumepata funding kwa kina Okala hapa. Now we are supposed to look for an office. And I'm told when we got the funding, nobody knew about us. So CDC in Nairobi, I'm told they were like, Impact, Kawangu, who are these people? Who are they? Because they didn't know about us. We didn't have an office. We had nothing. I started Impact in my kitchen. My kitchen in the fact that when we were taking these samples that Aroko was taking, I was keeping samples inside my fridge. Until I was told by a lab person that, you know, you're introducing diseases in your fridge. Then I moved to the sitting room. Then I moved to the guest wing. So while they were guest wing, Joy ni wa guest wing. Jacob wa guest wing. Jacob na Joy hawa ni wa guest wing. So they came during when we had a guest wing. That's when we did the study that he's talking about. Yeah, so hawa ni wa guest wing. So you guys, you see, working with me is good. So naona kuna wale wako. So hawa ni wa guest wing. So this is the next group. After this group, this is the next group. Yako itakuwa ya tatu. That they came as the guest wing before we got the CDC funding. And they joined just as Impact was being, she joined before Impact was registered. He joined just the same year that Impact was registered. And he joined as a data clerk. Now he's a very senior person. He has even coordinated national studies for the government. So, usione tu mwili sikudanganye. And Joy was like the secretary and was doing everything. And she would call, you are away, you have traveled, and akupigia simu that, can I please go for lunch early? It's like, I'm not even seeing you. Can I go leave for lunch early today, you know? And so, thank you, Joy. Thank you, Jacobus. Why I call him Jacobus? Mtoto yake alizaliwa, last born, is Ako Form 4. University was born after he had joined us. Yeah, most of his kids. And then Alice ulikuja na mtu. Was there nani? Nancy ayuko. So we were about 4 people that we hired. The first staff meeting we had, we sat on the floor. Hatukukuwa hata na kiti moja. Those who knew where Dr. Misore used to have a pediatric clinic, we were sharing. We were one side, he was one side. Tulikaa kwa floor. And we have moved from there. That's sahi hata pale ya kuweka maviti hatuna. So we thank God. Thank you. We were with her when we sat down. Those days my knees could allow me to sit and stand. Sahi nikikaa nitasimamishwa. So asanteni. And I think I want to hand over so that, I don't know, we can just finish. Because I'm not seeing, boss wako. He's on the way.
Yeah. Yes, we can, because
okay, so can we have the presents and shule guests? Chief alikupata amekupata, atakupata atakupata, right? Sindio? Aya.
Yes.
Yeah, let's just have the
awards. Awards. Yes.
And then
as we set up the cake, no?
And then we have the cake.
Yes.
And then we go for lunch.
All right.
Give me love.
Pokaneni Yesu kinywango ngimana pokaneni Rabi iweyo ya mawasikoya.
I am 60-something years old.
Amina yo pile pile lochona pokiweyo wasigoloya. Sama wasikane no chokore. Simbane. Yesu tiyo talinga linga. Otiyo talinga linga. Otiyo talinga linga. Otiyo talinga linga. Yesu tiyo talinga linga. Otiyo talinga linga. Otiyo talinga linga. Yesu tiyo talinga linga. Otiyo ongeluoro yatelo tiyo talinga linga. Otiyo talinga linga. Yesu tiyo talinga linga. Otiyo talinga linga. Otiyo talinga linga.
So there's a key here. Has anyone lost his car key? So there's a key here. And Linda in charge of cake, where are you? Kindly help us set up the cake. Not. So Linda and the team, kindly just have the cake inside. Bring it inside as we are getting the awards ready.
It's the kids, baby.
Ni leo, acha tu niwaweke wazi, mubaki na mishangao kuswa ya mapenzi, nataka kuyaeleza. Na leo tena waiteni paparazi, warushe kwa mitandao, siataki mapenzi, nataka jipongeza. Nemwita yo baby, umenaya na baby, oh ulimuna kipenzi, ni mshenza kupendi, ama kweli mtihani, mambo mengi dunia na mistressi siwezi, oh siwezi.
Bora ni njoo, maisha mafupi ni simple. Yani nini tesekero, jiunge nami upozeko. Bora ni njoo, maisha mafupi ni simple. Yani nini tesekero, jiunge nami upozeko.
Kama kupenda, bora nimpende mama yangu. Kama kupendwa mimi, nitajipenda peke yangu. Oh, kilichomponza fala, kujiona simba kumbe swala, kazama kwenye penzi utwara, badala kusaka miamala. Ayo, toka ndeti pesa, sana pendeza, na tena na enjoy, na wanangu maombo. Akaunti nasoma, na kamwili kananona, we mwenyewe si unaona yani, ainasema bora.
Bora ni njoo, maisha mafupi ni simple. Yani nini tesekero, jiunge nami upozeko. Bora ni njoo, maisha mafupi ni simple. Yani nini tesekero, jiunge nami upozeko. Napenda nikilewa nipande juu ya meza, nichonjo kunatema Kiingereza. Tupande juu ya meza, tupande juu ya meza, tupande juu ya meza. Sa, 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 sa. Bora ni enjoy, maisha mafupi ni simple. Yani nini tesekero, jiunge nami upozeko.
Matibabu ya TB ni shilingi ngapi?
na vipimo vya TB ni shilingi ngapi? Kila kitu kwa TB ni shilingi ngapi? Ni nini unangoja? Basi nenda upimwe. Namka asubuhi napata na kohoa, joto mwilini, mwili inaenda, sina nguvu, mwili imechoka. Hizi dalili mbona za pumbaza? Usiku nikilala napata nimesweat hadi nguo imeloa. Mtoto wangu naye achezi, akuli, hawi, ana dalili kama zangu. Ni juzi tu nilisikia mabingwa wa TB wakisema kule sokoni ati dalili kama zangu huenda ikawa ni zile zile za TB. Swali ni je, naweza bado kupata usaidizi? Sababu bro, we sina hela. Matibabu ya TB ni shilingi ngapi? Na vipimo vya TB ni shilingi ngapi? Kila kitu kwa TB ni shilingi ngapi? Ni nini unangoja? Basi nenda upimwe. Matibabu ya TB ni shilingi ngapi? Na vipimo vya TB ni shilingi ngapi? Kila kitu kwa TB ni shilingi ngapi? Ni nini unangoja? Basi nenda upimwe. Together we can end TB na ile Vision 2035 NTB tutaimanage. Lazima mimi na wewe tushikane mikono to mobilize resources towards the fight. Call kwa government, NGOs, ma CBOs na CEOs na kila mtu tuungane mikono tushikane pamoja tukifocus ku NTB. TB is a killer. Tusipochunga watu wetu wataumia. Kwa prevention tunahitaji support, cure and treatment tunahitaji support, sensitization jukumu letu sote. Hey, jukumu letu sote. Sensitization jukumu letu sote. Matibabu ya TB ni shilingi ngapi? Na vipimo vya TB ni shilingi ngapi? Kila kitu kwa TB ni shilingi ngapi? Ni nini unangoja? Basi nenda upimwe. Matibabu ya TB ni shilingi ngapi? Na vipimo vya TB ni shilingi ngapi? Kila kitu kwa TB ni shilingi ngapi? Ni nini unangoja? Basi nenda upimwe.
Ee Mungu, matendo yako yanishangaza. Ee Bwana, ukuu wako wanishangaza. Nikufananishe na nani Bwana wangu? Nikulinganishe na nini Bwana wangu? Wastahili ibada yangu Bwana, wastahili ibada yangu Bwana.
Wewe uliyeketi juu sana ninakuinua, maana kuna aliye kama wewe. Ninainua jina lako juu sana, maana umetukuka Mungu we, Mungu we, Mungu we.
Umeinuliwa juu ya falme zote, matendo yako Mungu wangu yanatisha sana. Oh, ni wewe Mungu usiyeshindwa, ni wewe Mungu mwenye uweza, ni wewe Mungu usiyeshindwa, ni wewe Mungu mwenye uweza.
Wewe uliyeketi juu sana ninakuinua, maana kuna aliye kama wewe. Ninainua jina lako juu sana, maana umetukuka Mungu we, Mungu we, Mungu we.
Bwana wa mabwana, 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 Bwana wa mabwana. Nikufananishe na nini Bwana wangu? Nikulinganishe na nani Bwana wangu? Matendo yako yatisha sana, ukuu wako wadumu milele yote. Wasahili ibada yangu, wasahili sifa zangu, wasahili kutukuzwa milele yote, wasahili kuabudiwa Bwana. twakutukuza, tunakusifu, twakutukuza we.
Tunakusifu.
Aha.
Twakutukuza.
Tunakusifu yao.
One to my chain. Thank you, DJ. Ladies and gentlemen, we are inviting everybody to come inside the hall because our chief guest has come. So we want to accord him a moment to just speak to us, and then we get into our award ceremony and cut our cake quickly and have our lunch. So everybody please come on in right now. DJ.
Matendo yako yanishangaza, Bwana, ukuu wako wanishangaza. Nikufananishe na nani Bwana wangu? Nikulinganishe na nini Bwana wangu? Wastahili ibada yangu Bwana, wastahili ibada yangu Bwana.
Wewe uliyeketi juu sana ninakuinua, maana kuna aliye kama wewe. Ninainua jina lako juu sana, maana umetukuka Mungu we, Mungu we, Mungu we.
Umeinuliwa juu ya falme zote, matendo yako Mungu wangu yanatisha sana. Oh, ni wewe Mungu usiyeshindwa, ni wewe Mungu mwenye uweza, ni wewe Mungu usiyeshindwa, ni wewe.
All right. Thank you, everybody, for your patience. I would like to invite Dr. Kawango to, in turn, invite our chief guest for the day, and then we proceed.
And that is just one word. So, okay. Okay, so we were almost giving up, but I think we are patient. And our chief guest has arrived, Dr. Gregory Ganda, and we want to say thank you because we know that you had multiple engagements and you still made time to come. So thank you so much. We just ask you to proceed, and then we'll do the awards, and then the cake cutting, and then lunch. Asante sana. Thank you. A round of applause.
Good afternoon, everyone. My sincerest apologies for coming late, but I'm shocked that you guys still have energy. And I'm told you've not eaten lunch. And so I'm the cut line between you and lunch. And the more I talk, the more you get annoyed. So Dr. Kawango, invited guests, ladies and gentlemen, I usually don't know how to do protocols when I'm with health workers because I feel I'm just amongst everybody. So forgive me if I don't mention all the people who are here, but receive my greetings and allow me just to go through my remarks very shortly. I will cut it down drastically because of time so that we're able to take lunch. So County Ministries of Health, Department of Health, Implementing Partners, Board of Governors of the Impact Research Development Organization, IRDO funders, distinguished guests, ladies and gentlemen, good afternoon again. It's an immense pleasure for me to join you today in celebrating IRDO's 20th anniversary and unliking the remarkable journey of excellence in advancing health and development in our region. I extend my warmest congratulations to the entire IRDO fraternity. As we come together to commemorate this momentous occasion, we also celebrate the journey we have traveled over the past 2 decades. And indeed, for many years, IRDO has made us proud as a partner, dedicated to a single worthy and admirable pursuit to create, develop, and sustain empowered and healthy individuals and communities. By the way, IRDO does a lot of work in the communities. The other time, I actually didn't know when I visited them. Sometimes there's a lot of things going on in the county, and you don't know until I realized that they were doing something in malaria in the community. And there were rapid tests being done, and we started analyzing the data, and so the supposedly quick meeting ended up being an analysis meeting, which was very nice. So congratulations, IRD, for the work you are doing in the community. Makofi kwao. Ama ni kwenu? So since its inception in 2003, IRDO has changed the lives of communities by promoting local research and implementing evidence-based public health and development programs in the region, where HIV has been a disproportionate program relative to the national and global levels. And I take this chance to reflect on this journey. You know, by the way, some of us believe now that HIV has been in this region because of neglect. We come to realize that poverty follows HIV. Ama ni uongo? Desperation follows HIV. That's why you see the fisher folk around there. Once you get women desperate, they need food, they need to take money to their children, then now things start happening. And so we have thought that one of the things that we have to do is that we must claim the equalization fund, because we got HIV because we were neglected in this region. The same way Turkana was neglected for many years and they didn't have roads. The same way this other region was neglected for many years and they got HIV. And so now we are saying that we must get also part of the equalization fund based on that HIV, because as the donors are leaving, the burden is going to remain with us here. And so we are going to carry a burden for things that happened in the past, which we could not have changed. So ladies and gentlemen, IRDO has a long experience in implementing medical, behavior, and structural HIV prevention programs in up to 25 of the 47 counties in Kenya. And I'll not name all of them. There are so many achievements. Adolescent girls and young women served in Siaya County is almost 72,000. 700 orphans and vulnerable children in Siaya County. Over 2.8 million counseled and tested for HIV in several counties. 662,000 adolescents and adult men offered VMMC, and 2,568 MOH staff trained on VMMC. 18,000 KPs served in Homa Bay, Kisumu, Migori, and Siaya. 152,000 fisherfolk at HIV risk in Homa Bay and Siaya counties. 41,405 adolescents and youth aged 10 to 24, and 6,692 caregivers of adolescents reached with evidence-based behavioral interventions. These are just some of the few remarkable achievements of the organization. These massive achievements were made possible with funding from PEPFAR through CDC that ran from 2004 and to 2021. And we are grateful to the American people for their generosity. With funding from the Kenya Red Cross and AMREF Health Africa, IRDO has partnered with MOHs in up to 9 counties to work with 524 community health units, 1,000 community health extension workers, who are called CHARs also, and 5,000 CHVs to deliver HIV, malaria, and TB services since 2012. Besides the output listed above, IRDO has had a great impact on reducing HIV in the region, and Kenya generally. For example, taking VMMC as an example, when you have 662,000 circumcisions done, that translates into at least 44,000 new HIV infections averted between the year 2008 and 2031, at the documented rate of 1 HIV infection averted for every 10-year period through 15 circumcisions. Ladies and gentlemen, I'm extremely proud that IRDO has been a trusted partner of Kisumu County Department of Health in our quest for better health. And I just talked about this when we were talking about community health. For over 20 years, even before the advent of devolution, you have stood as a stalwart partner in our endeavors to reduce the burden of HIV, TB, and malaria in the region, and to improve the well-being of our people. Your work has not only transformed individual lives, but has also left an indelible mark in our collective progress as a community. The contributions of IRDO extend far beyond the realm of service, delivery, and your innovative research initiatives have have been instrumental in shaping our healthcare policies and strategy. For example, the data insights generated from IRDO have informed inclusion of secondary distribution of HIV testing in the country, as well as fast highlighting challenges with PrEP adherence among young women, demand creation for VMMC among older women, and how to promote savings among men and women with disposable income as a strategy for reducing HIV risk. But they have done this better than us. We've tried to convince people to save money to put in insurance. They don't save. Of note is that reducing HIV in adolescents and youth, dedicated to mentoring young people in research that responds to HIV burden among them, and the latest Kids on the Block, Kisihomi, Kisumu, Siaya, Homa Bay, and Migori, that aims at catalyzing local communities to tap into available resources to improve their livelihoods. That reminds me that I saw, let me not call her, she might feel too proud, but but I saw the organization organized a very nice conference for youth. It was very innovative, and Governor was very excited. We have never seen something like it. So they do a lot of work with the youth. It is imperative that I reiterate that working with an organization dedicated to empowering individuals and communities such as IRDO has a trickle-down effect, with over 8,000 individuals employed since its inception. The organization has had transformative effect in the lives of staff and their families, and employees have had the chance to build their careers, acquire new skills, and take on leadership roles within the organization and elsewhere. Consequently, staff have themselves become advocates for empowerment and positive change in their own lives and the lives of their communities. As we celebrate the journey we have taken together, health challenges continue to exist and new ones arise. However, the strength of our partnerships, the dedication of our healthcare workforce, the unwavering support of our communities provide all of us with hope for the future. And as we look ahead, I see a future that holds an even greater promise. As we celebrate this milestone, let us recognize and express our deep appreciation for the unsung heroes in the journey, our healthcare workers, community health volunteers, and countless others. Your dedication and sacrifices often go unnoticed, but your role is immeasurable. It is your hard work and commitment that has made us achieve. In closing, I would like to emphasize that our partnership with IRDO remains a cornerstone of our community health and development gains. Together, we have improved the health and well-being of our community, and together we will continue to do so. Let us move forward with renewed energy and determination to address the health challenges of our time. Let us remain committed to research and innovation, to collaboration, and to the spirit of compassion that has brought us this significant milestone. Thank you, Impact Research and Development Organization, for your remarkable contributions to Kisumu County, the Lake Region, and Kenya as a whole. Happy 20th anniversary, year to 2 decades of success, and to many more years of progress and prosperity for our communities. Thank you very much, asanteni sana. Makofi kwao tafadhali. With those remarks, today I'll not give off-the-cuff remarks because I've spoken too much. And there's between me and you. Oh, there's not between you and lunch, it's me. So let me hand this back to Professor. Prof, asante sana.
All right, thank you so much, our guest speaker. We'd like to invite Mora to come and preside over the award ceremony. So it's a short session, and then we get into the cake. DJ, Mora. Go.
Go. Thank you, DJ. I just want to invite Dr. Kawango to come and stand here with me. So next, we will start by gifting our guests. We'll start by gifting our guests. We start with the chief guest. Kindly, Winnie, can we have...
Go.
Oh. Umekuja wabebe. Watu wa picha. Mkwe karibu. Kindly, Dr. Gad. So we have a small token of appreciation that Dr. Kawango will present to you. Redemptor, the gift voucher, please. The basha. We are not done. Just a minute. Sorry. Okay. There is also another one. Kindly, let's have the T-shirt, please. Yes, the T-shirt. T-shirt. A minute, the T-shirt is coming. It's especially made for you. That is why it is taking a little longer. It is especially made for you. Yeah, thank you. Thank you. Let's clap for our chief guest, please. Thank you so much. Thank you so much. We have a gift for Dr. Lucy. Who's going to hold it for him? That's for Dr. Lucy. Thank you so much. MOH Vihiga, please. Thank you so much. Thank you so much. Thank you so much, Daktari. Thank you. Thank you. We appreciate our partnership. MOH Siaya. Okay. Okay. Dr. Fred CDS.
Genio Dumel 5.
Great. Okay, great.
Thank you. Thank you very much, Daktari.
IRDO at 20.
Okay, so I want to move to our donors. I want to call Jacob and Julius, please. Thank you so much, Jacob. Jacob, please come. I ask that you come back, please, for a minute. We have a certificate of appreciation to the CDC. Yeah. Oh. Asante sana, asante sana. I want to call upon the Red Cross. I'm calling upon the Red Cross. AMREF, please. AMREF. Thank you so much, AMREF. Dan, kindly, we ask that you come and take the certificate for Red Cross. You receive the certificate for Red Cross on their behalf. Kindly sit the, I'm calling upon MOH Vihiga, please. One more minute. And Siaya, please. MOH Siaya. Our collaborators in research, the VC, Jost, please. Professor Oyolo, I'll kindly. Prof. CHEP, CHS, we also want to appreciate our board who are leading us. Kindly, Dr. Udanga. Mr. Makori, please. Thank you so much, Professor Kawango. Please give a round of applause for Thank you so much. Winnie, kindly. We want to go to the next session. Winnie, kindly come and take us through the cake session.
I'll invite Joy and Aroko and Jacob and Linda to come and lead us in this cake cutting process. So Joy is going to be our matron. Linda. Utapanda. Alafu si unaenda kutulead pale. Wewe unaenda kukata keki.
Good afternoon. Yeah, I want to take this opportunity to thank all of us for the patience we have had from morning. For parents who are here, you all know the favorite part of a birthday is the cake cutting for every child. So as children of impact, this is the long-awaited moment. And in most occasions, as you have always witnessed, cakes are normally done by ladies. Today we are doing it differently. The two gentlemen are going to help us cut the cake. That is my colleague Rocco and my colleague Jacob. So before that, I'll hand over the mic to Linda to say something. Then Jacob and Rocco will lead us.
Hello, yeah, my name is Linda. I am the baker. Thank you.
You will forgive us because we are going to be clumsy maybe, because this is not what we are used to. But I would request our DJ if you could have something that would make us, not to be clumsy. We'll do it the ordinary way. Ni kukata tu keki, si ndio? Alafu hiyo maisha hii, hiyo chapter ishe. DJ. So, we haven't done this before, but I can see the way we've been assigned the duties. Rocco is one of the old staff who is in the list of the pre-IRDO, and I'm in the list of staff who just came immediately after the organization was registered. And by the way, I'm 19 years old at IRDO, so 1 year tunge celebrate na IRDO pamoja. So, yes.
We want to invite Dr. Kawango and our chief guest to also come, si ndio? And then tuone nani analisha nani na inaenda aje na inakuwaje, si ndio? Si ni kweli?
Keki ni tamu, ahe. Tamu, 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 keki ni tamu, ahe. Tamu, 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 keki ni tamu, ahe. Tamu, 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 keki ni tamu, ahe. Sweet, 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 keki ni sweet, ahe. Sweet, 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 keki ni sweet, ahe. Oh, sweet, 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 keki ni sweet, ahe. Sweet, 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 keki ni sweet, ahe. Tufurahi sote tukiingoja, ahe. Tufurahi sote tukiingoja, ahe. Tufurahi sote tukiingoja, ahe. Tufurahi sote tukiingoja, ahe. Tuna meza mate tunaingoja, 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 ahe. Tamu, 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 keki ni tamu, ahe. To last throughout the years. So bring your good times and your laughter.
Hello.
So we will now request mama, ama ni baba ndio ataanza kulisha mama, but in this case mama ndio mwenye nyumba, si ndio? Mama mwenye nyumba amlishe mgeni, si ndio? Haya, atachukua kidogo.
It's a celebration. Celebrate good times, come on. It's a celebration. Celebrate good times, come on. Let's celebrate. There's a party going on right here. A dedication to last throughout the years. So bring your good times and your laughter too. We gon' celebrate and party with you. Come on now. Celebration. Let's all celebrate and have a good time. Yeah, yeah. Celebration. We gon' celebrate and have a good time. It's time to come together.
I would request Team Nuts to come over and help us serve the rest of us.
It's a celebration. It's a celebration.
It's the kids, baby.
Let's celebrate. Come on now.
Acha tu niwaweke wazi, mubaki na mishangao kuswa ya mapenzi, nataka kuyaeleza. Na leo tena waiteni paparazi, warushe kwa mitandao, siataki mapenzi, nataka jipongeza. Naimwita yo baby, umenayo na baby, oh ulimuna kipenzi, ni mshenza
IRDO
ama kwa mtihani, mambo mengi dunia na mistresi siwezi, oh siwezi.
Bora ni njoo. Maisha mafupi ni simple. Yani nini tesekero. Jiunge nami upozeko. Bora ni njoo. Maisha mafupi ni simple. Yani nini tesekero. Jiunge nami upozeko.
Kama kupenda bora nimpende mama yangu.
Le général Dangote, le grand Maman Dangote,
Ona mpaka leo majibu sipati, yani mpaka leo mebaki katikati.
Didi Santos,
rafiki wa kweli ni nani? Rafiki ni ndugu wa majirani, unepati na kwa stare wakulia nawe msibani, wakukosa kuongeze ama yule wanipendani, kwa sababu nimekoma. Rafiki yangu pesa,
Ricardo Momo, Don Fumoye,
Chibu Dangote, Yamaji, Nachidi Benzi, Chibu Ageto, Akombeji, Chipolo Polo,
la présidente Maman Samia,
Atiki.
Atiki, 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 atiki.
Everything you put your hand, go walk. Your name go open doors. You self go be a boss. Amen. Amen. Everything you put your hand, go walk. Your name go open doors. You self go be a boss. Amen. Amen. Every hustler getting paid. Where the hustle go come to pay. Your own in no go take. Amen. If you don't find work, do your own. God self go do his own. And flesh go cover bone. Amen. Amen. If you believe it, say amen. If you believe it, say amen. If you believe it, say amen. 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 Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Sister where one man sees until where they fight begin. One day you go born twins. Amen. Amen. You're not well on losing job. Landlord come they do like God. One day you will be landlord. Amen. Good news go locate you. What you see in novelty. If you believe me, say amen.
Kwetu si tunashe mapenzi sio makasiriko. Kwetu ni furaha tele, maana mapenzi sio makasiriko. Hata kama tukishindia tembele, oh my love. Baba mwenye nyumba kodi apige kelele, oh my love. Hata kama tunapanda dalala, mimi na wewe my love. Eti chetu chumba kina mavyombo tele, inahusu. Wala sidhani kama unipendi, ila nawaza usipokwepo ntaishije. Mwenzako najua kama unanipenda umeniweka moyoni, ila nawaza usipokwepo ntaishije, ndo naogopa. Naogopa.
Shanghai inapendwa ila sura bado inakosa nuru, yani najiona sipo huru napagawa siku zinavyozidi kwenda, najiona kabisa nitakufuru, maana naishi kakunguru kutwa kuzificha mbawa, riziki yangu papatu papatu, mala nilipe vikoba upatu, vipi ukija kutamani vya watu, mimi si utaniacha. Ukiachilia mbali mashindano, wanaonizidi pesa mwonekano, si lazima nikutajie mifano, ili kama utaweza mapambano, hicho ndo kinanipa mawazo, nikikuposti biashara matangazo, sitoweza kukuchunga mbele za wenye mipunga. Baby, what can I do?
Baby, I'm not gonna let you go, and I want you more.
Baby.
And maybe every other place, baby. If you like, say I don't remember, say I don't really know you that well.
We can go there if
I
want to, but me, I don't know.
Oh, no.
Why I think I love you when I don't really know you that well. We can go there if
I
want to, but me, I don't know.
Oh, no.
Why I think I love you when I don't really know you that well.
I'm too polite to insult your intelligence. Why do I believe that we have met? Maybe not in this life. Time's frozen for a second, so I'm thinking tonight. Break the ice, or better still, we can set it aside. Temporarily, my temperature is telling me that you got me so hot. Stop, girl, there is no remedy. But you don't know me well enough to reply, and I don't really know you that well. It's funny, you have something in your teeth, but would you try to stop me if I want to take it out? Cause you don't know me properly. Girl, I think you love me, but you turn this bad boy into a busy boy. I see.
Attention, good people. So we would like to believe that everybody has had a taste of the cake. Kama hujaonja cake kabisa, inua mkono hivi. Yani mkono mbele ya Mungu, si mkono hivyo vile unainua. Hao wote ni waongo. But si kuna hakuna addition haki. Kuna addition kweli? Mnaona? So, tukakule chakula ya ukweli, tukakule lunch. Si ni sawa? So everybody has been given a voucher. Kama hujapatiwa voucher inua mkono hivi. So ya ukweli, yani true story. A meal card. Ati si voucher or meal card. Nani hajapata meal card? Dr. Yalo umepata meal card 2. Sawa. Okay, so everybody, you are invited to lunch. Lunch is going to be served at the poolside. Kila mtu akona lunch meal card. So tuendene tu, we take 50 minutes, 40 minutes, half an hour. We take half an hour and we come back to close with the tea. Sawa. Close kabisa. Close. Hold on, guys. Hold on a little bit. Hold on a bit. Wow, okay. All right, so we are being advised that instead of going and coming back, how about we just finish? Nasimgesema. Okay, so we will have a vote of thanks from Ryle. Oh, we have some more certificates. Before the vote of thanks, we have some more certificates, especially to staff that had not been issued. And then we have Kiswa. And then we have Kiswa Mora. We have Kiswa. We want to send our sincere apologies to Kiswa. As an organization, it skipped our mind to award you the certificate, but we are going to do that now before we go to the staff. Okay. All right. Sawa, take it away.
Sasa hii ndio shida ya kuwa mtoto wa nyumbani. Hadi tunafikiri tunafaa tukutreat kama nani? Mtoto wa nyumbani, and that is what we simply did. Please, Dottie.
Kuna aina za upendo, aina nyingi, lakini upendo wako ndio halisi. Kuna aina za utukufu, aina nyingi, lakini wako ni mkuu na wa milele. Kuna aina
Dr. Kawango, please.
za miungu, lakini wewe ni Mungu mkuu aliye hai. Nimekujua, nimetosheleka. Nimekujua, nimekupenda. Kuna namna unatupenda, inabidi Yesu nikupende. Kuna namna unatutenda, inabidi Yesu nikupende. Ukututena sawa sawa na hatia zetu, wala hukutulipa kwa maovu yetu. Umeniokoa mtegoni wa mwindaji, kwa manyoya umenifunika, niko salama. Nimekujua, nimetosheleka. Nimekujua, nimekupenda. Ujana wangu ndio umerejeshwa, ujana wangu ndio umerejeshwa. Kuna namna unatupenda, inabidi Yesu.
Ingelikuwa Mungu anauliza mwanadamu jinsi ya kumtendea.
Thank you so much, Kiswa. Thank you so much. We appreciate your partnership.
Hata tena nisingekuwa mahali nilipo, ungeambiwa sifai, ungekukanya vikali, ungekumbushwa dhambi zangu za kale. Baba yoyo, unabariki unayependa, unabariki unavyopenda. Mimi nahitaji ndio yako Yesu tu, nahitaji ndio yako Yesu tu, ninataka ndio yako Yesu tu. Yesu ndio yako, ndio itanisimamisha, ndio yako itanifungulia milango. Hakuna sikio lenye funiko jamani, wala sijaona jicho lenye pazia. Adui zako wangelikuwa na uwezo.
This is your certified entertainer,
Wangefunika
DJ Dream.
wasikuone ukiwa juu, wasisikie umebarikiwa. Meza utaandaliwa mbele yao, utakula utakunywa mbele yao. Nasema ndio ya Bwana.
Thank you so much. We want to appreciate our staff. Tunataka kuanza na wale wenye mlikuwa mnalala kwa baridi. Yeah? Before we even had an office, eh? Wale wenye mlikuwa mnatembelea makanisa. Those are the people we want to start with. I want to call upon Tom. Tom, kindly. Thank you so much, Tom. We appreciate your service to IRDO, and we celebrate you as we celebrate the 20th anniversary. Thank you so much. Mrs. Okuso, please, on behalf of Mzee, Mrs. Okuso. Mrs. Okuso, are you somewhere? Okay. Achieng, we will come back to Mrs. Okuso. Oh, she's here. Please, Mama. Achieng, Aroko, Osodo, in that order, please. And Victor, finally. Mrs. Osodo, thank you so much. Thank you so much for understanding Mzee kuwa alikuwa anafanya research. Ukisema kuwa alikuwa anafanya research. Akikwambia, thank you so much. Thank you, thank you. Thank you for taking this journey with IRDO. We appreciate you. Asante. Achieng, thank you. Thank you so much, Achieng. Thank you. Thank you. We celebrate you as we celebrate the 20th anniversary. Aroko, thank you so much. Thank you, we appreciate you. Thank you for paving way for the rest of us. Asante sana. Osodo. Osodo is not there. Victor is not there. Asante sana. We want to appreciate. Yes. HR, kindly keep yours. We want to celebrate the second category. Those who've been with us 15 years and above. I'm calling Royo, Nancy Odenyo. Please come in that order. Alice Otieno, Badia, Jacinta Badia, Jesse the Great Mobilizer, Jacob, Lilian Akoth Ouma, and Joyce Omondi. Thank you so much, Jacinta. Thank you. Thank you for the great work that you're doing for IRDO. We appreciate you. We appreciate you a lot. Thank you so much. Thank you, Jacobo. Thank you for celebrating 19 years with IRDO. Thank you. Joy, thank you for celebrating 20 years with IRDO. Thank you. Oh, Alili. Asante, Lillian. Keep on smiling. Keep on smiling. Thank you so much. Thank you. We appreciate you. Alice. Alice, you are somewhere. Alice. Okay. Jesse. Alice and Jesse. Thank you. We go to the next category.
That's the solution. That's the solution.
We want to recognize our staff.
Hello. Now we have outstanding performance. Okay? They know. See, you know, they know has They know the pilot. They know pilot. Ako wapi? They know pilot. Ona tumbo imeanza kuongezeka. Frederick Ochieng is in finance. What were finance were complaining? Frederick Ochieng is writing reports for almost everyone in Global Fund. Frederick Ochieng, your work has not gone unnoticed.
My hands, your waist,
okay.
My heart.
Happy Lotuge Tubes.
My lips, they touch, they kiss.
Amen. Happy Lotuge has been with us forever. And he's our ICT person. He repairs all the fridges, he puts on all the lights, he does every single thing that is electronic and electric. And then Marilyn Ochilo. These people know who you are. The board and everybody. Everybody you know, Marilyn, right? There was a time people told me nobody can work in my office. Because I'd sent away like a Chieng and Damaris and who. And they told me to get a man. And I got a man. And the man didn't last even a month. So Marilyn has been there since 2019. Thank you. Diana Gorma here.
Siwezi kosa kuteka mpoa sai, siwezi baiwa pombe alafu mimi nizirai. Sakata rumba, sakata kuna nyuma, chuchuma kuna wevunja ufupa. Tumia mikono ukishindwa miguna. Kilichopandwa ni ulichokikuza, na kikikukuza ni juli kichuna, na kisipozama ni jua kijavunwa, na kikizolea ni juu kimemwagwa.
My hands, your waist, my heart.
Diana, we know her with Global Fund meticulous. You know Global Fund, mnasumbua. Yani hey. And now she's in internal audit, and those who are her friends in finance now are her enemies. And I like it when people are enemies of internal audit, because I know there's no deal. Okay, thank you. Winnie Akech. Akech anywhere? Winnie is also in finance. So Mike, see now you see we are recognizing finance people. Every budget, the others have refused to learn. She has even trained them. Every budget, every contact with all the donors except Global Fund is Winnie. Everyone. Okay. Catherine Oso. For the hospital, she has worked all her time. She rarely even goes on leave. If she would count the number of times she has worked to bring the hospital to where it is, getting for us comparison prices, every single thing, we want to appreciate. And more importantly, the last 30 days before, that was September, they worked tirelessly to renovate the hospital to where it is today. So there were 3 of them. I was calling them 3 musketeers. So that is Catherine Oso, Rael Owira, and Julie Kadima. The 3 ladies worked. Where is Dr. Kadima? Amerudi kuona patient. So I want to appreciate, I always say, I like when people make my work easy. Because you give somebody, you assign a job, and you come back and it is done well, sometimes better than you would have done it. It makes your work easy. So I want to appreciate the 3 musketeers. They did a wonderful job. Our board can attest to that. And everything is running well. Wycliffe Mboya. groundsman. But he does not, anything you give him, he will do. He will go wherever. He also doubles up as our apiko guy. Piki yote, when we don't have anaenda. When there was demonstration, we are supposed to take samples to, Kargeno, and we can't pass. He went akapenya with Dr. Uriko, wakaenda wakapeleka samples. So thank you. Somebody who was, I had already nominated her, but I didn't tell people who it was. And I asked Rael to go and do a 360, find out from all the people who work with them to tell me who is the coordinator, study coordinator that has stood out. And it matched my selection. Joyce Boki. Boke picked a study from the start, and she's on top of things. Everything you ask her, she has thought ahead of everybody. And the thing that I like about her most, she delegates. So every week there are 2 research assistants who are responsible, who are coordinating things. That is building capacity. That is holding hands. And importantly, as my board is always telling me, right, that is what? Succession planning. So that when you leave, your coordinators are able to coordinate the study in your absence. Na hakuambiwa, alianza tu nikasema, even this one tutakopi. So thank you so much for doing a great job, young girl. We really appreciate. Yeah, thank you. Shantana Carol. Shantana. Hello. Shantana can mobilize for 4-5 studies in 5 counties continuously, simultaneously, and they are all successful. They are all successful. She's in Homa Bay, she's in Siaya, she's in Kisumu, she's mobilizing for this one, she's here, she's everywhere. And they're successful. And even where her peers are cheating, she will be there and they will not cheat. So Shantana, thank you. We recognize your contribution to impact.
Ananambia chombeza tena nikizidisha ananambia koleza nikitaka kusitisha ananambia ongeza.
So long service. Damaris Miller.
Hey, you're Tron.
Are you nice?
Eti nimemlambisha ananambia chombeza tena nikizidisha ananambia koleza.
She would have come with the earlier group. She has worked with us for 17 years. And also she's one of the honest people I've ever seen. And you know what? Haendi kanisani. And when I asked her, you know what she told me? That she's disappointed by people who go to church because of what they do. I don't know whether she had an experience, I don't know. But she doesn't. But Damaris, you will give her cash, you can ask her in the middle of the night, utaipata hapo. And Friday akienda mbali atakuita, atakwambia ile pesa iko hapa. You know barabara sio mzuri, I may not come back. So you will find the honest, she's honest. And that honesty is what we are looking for. So thank you for your service and thank you. Hey, somebody here is called Mbasna. Ukijua we ni Mbasna, we amuka. My age mate. Ukijua wewe ni age mate yangu. This is my age mate. Tulianza the hospital together. He resigned where he was working, Mary Stops, and he came and gave us his certificate to use in opening Tungane Hospital. And since then to now, we are using his certificate, and of course not just a certificate, his seniority in medical practice is what's holding us. And so, thank you, Basna.
Oh, mama.
And then we have, this was identified by program Daniel Nandwa as the best in terms of outstanding performance in Global Fund leadership. So that's for outstanding performance. It's not that people are not outstanding, but some are more outstanding than others. Some have stayed longer than others, right? Yeah, okay, thank you so much.
Usipna mana chakogola mo kanisa moja. Kabiri nyiri manwa chakogongi mama. Abanyana. Usipna manyako Amili. Amilo you are. Amilo mami. Amilo basna.
Hello. Please give me just 2 minutes of your time just to give certificates of recognition for stellar performance to staff who've been, most of the staff and others. The list was longer. So I'll take a few minutes just to call the names so that they can come and receive their certificates. Rosemary Achieng, 20 years of service. Erasta Saroko, 20 years of service. Liliana Kotho Uma, 19 years of service. Damaris Miller, 16 years of service. Jacob Onyango, 19 years of service. Badia Jacinta, 18 years of service. Jesse Okanda, 17 years of service. Alice Adhiambo Otieno, 15 years of service. Nancy Apondi Odenyo, in absentia, 15 years of service. Rosa Adhiambo Oyo, Lena Adhiambo Oluoch, 15 years of service. Timothy Okelo, 15 years of service. Habil Agoro. Habil. Dennis Odhiambo. So I am in the other category of recognition for stellar performance. John Okanda, Woodward. Molzen Aworo Nyango, 16 years of service. Joyce Tieno Omondi, 20 years of service. Josephine Hagoi, 15 years of service. Shantana Carol, outstanding performance. Winnie Adhiambo Akech, Diana Koth-Gore, stellar performance. Marilyn Ochilo, performance. Frederick Ochieng. Joyce Boke. Phoebe Olugo. Bernard Ayeko. Wycliffe Chotero. Julie Kadima in absentia. Catherine Aworoso. Jane Mora Arasa. Ray Osike. Ray Osike. Lillian Atieno Kumu. Dr. John Mark Ayalo. Daniel Nandwa. Victor Odhiambo And allow me to present to Vihiga Dice. We also did a performance evaluation among all the program areas, and Vihiga Dice emerged the best. So Teresa, as the Dice in charge, please come and receive
Masaina atutina obera miliura yo obera manya koka na lonya jodongo nya bejo lano no mama tonina ajibio abenjue maina na benjue anila na benjue anele na benjue yakwaro murusu na beunyoe ida koma be tinge oganade edala.
Okay, so allow me, DJ, now we can stop. So allow me to give a vote of thanks on behalf of IRDO. We did earlier introductions. For those who are not in, my name is Rai Lowira. I work in the HR department and oversee administration. To our distinguished guests, ladies and gentlemen, good evening. It has been such an honor to be part of this wonderful event. On behalf of Impact Research and Development Organization and the entire fraternity of the institution, I first of all extend my sincerest thanks to the Almighty God for his unmerited gift, unmerited grace and favor to IRDO, and for making today's event a resounding success. I extend a hearty vote of thanks to our chief guest, Dr. Gregory Ganda, who spared time within his very busy schedule to grace this occasion. Daktari, we truly appreciate your kindness. To our funders, I lack words to express our gratitude for the unwavering support to IRDO in the last 20 years. You have been a strong pillar in this journey. Your thoughts have enlightened our minds, and we have immensely grown over time. Receive our deepest sense of appreciation. To the Ministry of Health representatives in the different counties that we work in, your immense support in our program's implementation does not go unnoticed. We are forever grateful for the open doors you've shown us and for your unwavering support. I also take this opportunity to thank the Board of Governors of IRDO. Under their leadership, they have ensured that the organization has maintained a solid strategic direction and to remain afloat. Your involvement in this journey has been overwhelming. Thank you. A special thanks to our CEO, Dr. Kawango Agot. As the founder of IRDO, you have tirelessly worked over the years, right from the idea inception stages to date. You have been the catalyst behind the tremendous growth of the organization with a goal of impacting positively on people's lives. Your contribution is worth more than diamonds. As you have always said, service to humanity is service to God. May God bless you for this depth of service to empower individuals and communities. To our implementing partners, the higher education, the higher learning institutions and the local communities we work with, we thank you for the unity you have exhibited while working with us in different geographical locations. We have learned a lot from one another in the fight to reduce HIV and AIDS prevalence in Kenya, as well as in the treatment of malaria and TB. Last but not least, you agree with me that such an event of this magnitude cannot happen overnight. The wheels started rolling months ago. Special thanks to the organizing committee who have been very proactive and dedicated to see this day as a success. Thank you for working behind the scene to make this a gala event. Lastly, my sincere gratitude goes to all IRDO staff, ex and present employees. You have worked against all odds to make the impossible things possible. Your exemplary performance has left a mark in the lives of communities that we serve. Thank you for making this a memorable event. May God bless you.
Thank you so much, everybody, for your great sacrificial patience. We appreciate. Thank you so much. Now, we are going for lunch. This lunch we have been going since 12. So now we are eventually for real going to this lunch. This lunch is at the pool. But the way some of you have already gone to lunch, you know. Yeah, actually some people have already gone to lunch. So the rest who have not gone to lunch are the ones who are going to lunch at the poolside. And I want to believe everybody has a voucher. If you still do not have, I'm going to assign someone to tarry here a little bit to just ensure that everybody has a voucher. So I'll invite these 7 people to go to the registration desk. You forgot to register and you must register. Mike Ogera, Fidi Atieno Olugo, Triza Ogara, Ray Osike, Felix Odhiambo, Liliana Koth, and Millie Midecha. So now let's all be upstanding. I want to invite Pastor Odanga to come and close with a word of prayer. The videographers. Yes. And then we want to thank our service providers, Marcellus and the team. Thank you for your video coverage, for your live streaming. Our DJ Dream, thank you so much. If you are impressed by his work, you can invite him for jobs. And every other service provider, we thank you so much for coming today and supporting us.
Present us to God. There are 2 that I forgot. Gerald. Can you clap for Gerald? Outstanding performance. And Winnie Kiriga Wadera. Outstanding performance. I forgot.
Thank you very much, Winnie. Thank you very much, Daktari. When I was mentioning the members of the board, I forgot to mention Professor Elizabeth Bukusi. So she's also a member of the board. One time we wanted to release you to go for lunch and come back because there's tea, and we were afraid that if you go for lunch, you may not take the tea, and yet you have paid for it. So I'm kindly requesting you people who have appetite, after the lunch, please take tea. Let's bow down and pray. Lord God Almighty, we thank you so much for the wonderful day that you've given us today. Thank you indeed for the weather. Thank you for the good health that you gave us. Thank you for all the acknowledgments and the people that were here. As we part from this place, we commit IRDO into your hands. We pray that your grace shall facilitate every member of the staff, as well as the board and every other person concerned, so that everything shall go on well, and IRDO shall succeed even more than we have done in the past. When we shall be leaving this place, kindly give us journey mercies to our places of abode. Give us a blessed life and a graced time this weekend and into the next week and for the rest of our lives. We commit the meal that we are going to eat into your hands, and we pray that you may bless both the lunch and the 4 o'clock tea as we take both of them together. In Jesus' name I pray. God bless you.
Baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakuona tu, mwarifu twakujua, mwarifu twakuona tu. Kulani zako twazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Watakujua hata ukipanda ndege, harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Anakuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda, Kenya nchi tunayoipenda.
Twajivunia sana tukijiita wa Kenya, nchi yenye baraka. Kenya nchi yenye baraka.
Tumekomboa Kenya, taifa letu tukufu, tumebadili mwendo. Tutalinda katiba mpya. Anayependa Kenya ni yule mwenye kutenda haki kwa watu wote. Mtu mwenye kutenda haki. Na ukipenda Kenya ujitengane na mambo yenye kuvunja amani. Hatutaki matata Kenya. Wenye nchi
Kenya kipenzi chetu, hatutaiacha milele.
la Baba na la Mwana, Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana, Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini, sisi zote binadamu. Matajiri masikini, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Kulani zako zazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele.